Good morning, ladies and gentlemen. We are here to start our program, so please find your seat and make yourself comfortable. The session will begin shortly. Thank you.
Good morning, beautiful ladies and handsome gentlemen. I'm Anisha Matthew,
And I'm Megla.
third year BSc Nursing students from SKS College of Nursing, and we are the host for the day.
This is a memorable day in our college history as we are hosting this grand state level seminar for the first time in our college.
On behalf of SKS College of Nursing and SKS Hospital and Postgraduate Institute, Salem, I would honorably and delightfully welcome our Chief Patron, Treasurer, Resource Person, Observer, Organizing Chairperson, Organizing Secretary, lovable delegates, and all the esteemed invited guests who have come here to join our first CNE seminar.
Now, let us come together to honor our heritage and language with a Tamil Thai Valthu. Everyone please stand for Tamil Thai Valthu.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் மதனமென திகழ்வத கண்டமிதில் தெக்கணமும் அதில் சிறந்த திராவிடனல் திருநாடும் தக்க சிறு திரை நுதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே உன் சீரிழமை திறந்தியந்து செய்ய மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Thank you, everyone. Please be seated. I would like to welcome the organizing chairperson, Professor P. Selvaraj Sir, MSc, PhD Nursing, Principal SKS College of Nursing, to unfold the theme.
அனைவருக்கும் என் இனிய காலை வணக்கங்கள். சில நிகழ்வுகள் நமக்கு அறிவூட்டும், சில நிகழ்வுகள் நமக்கு வியப்பூட்டும், சில நிகழ்வுகள் நமக்கு பாதையை காட்டும், சில நிகழ்வுகள் நம் பாதையை மாற்றும். Good morning to one and all gathered here on this wonderful morning. So on behalf of SKS College of Nursing, I am delighted to welcome you all to this state level seminar. To all the resource persons, delegates and the faculty members of the SKS College of Nursing and the media personals and other invited guests, a warm welcome to one and all gathered here. The SKS College of Nursing was established in the year 2021, so under the auspices of VS Educational Stress, and currently offers a 4 years BSc Nursing degree program. So coming to this theme of this, so every one of us needs to show how much we care for each others and in the process care for ourselves. It is all said by the Princess Diana. So based on this quote and the theme of this seminar that has been selected based on the WHO report. The WHO report in the year 2023 says that is approximately 1 in 10 patients are harmed in the healthcare, resulting in more than 3 million deaths annually due to unsafe care. So patient safety breaches in healthcare are pervasive, problematic, and can occur in all settings and at all levels of healthcare provisions. So based on this report, the title of the seminar, Revealing Nursing Heartbeat. It is a revealing nursing heartbeat, elevating patient care through the key principles and practice is suggested by our organizing team and planned to be conducted at the state level for the benefit of nursing personnel across the state. So the seminar aims to explore and highlight the fundamental principles and essential practice that underpin the high quality of nursing care. We will delve into the core aspect of nursing practice, including compassion, empathy, professionalism, and evidence-based care. The objectives of the seminars are explore the fundamental principles that underpin high quality nursing care, and also discuss key practice and strategies for delivering the patient-centered care. And also they examine the role of the effective communication, teamwork and collaboration in enhancing patient outcome and highlighting innovative approaches and emerging trends in nursing practice. And provide the participants with the practical knowledge and skill to elevate their nursing practice and foster the networking and collaborating among nursing professionals, educators, researchers and policymakers. And inspire and empower the nursing professional to uphold the highest standard of care. So throughout this seminar, participants will have the opportunity to enhance the leading nursing expert in the field of nursing as well as the fellow healthcare professionals to discuss and share the insights on the best practice for the patient care. We will explore the various key principles such as patient-centered care, communication, teamwork and clinical excellencies, and how these principles can be effectively applied in nursing practice to enhance the patient outcome and experience. So I request all the delegates to sit back and enjoy the scientific session by the resource persons, and also our students are also eagerly waiting to entertain you with the different ideas. Although we have set up the selfie booth and signboard in the entrance of the hall, so you can enjoy the seminar and also take a selfie with your friends. ஸோ மீண்டும் ஒரு முறை உங்கள் அனைவரையும் இந்த ஸ்டேட் லெவல் செமினார் வரவேற்பதின் மூலம் SKS செவிலியர் கல்லூரியின் கல்வி குழுமம் பெரும் மகிழ்ச்சி அடைகிறது. வெல்கம் டு ஒன் அண்ட் ஆல். Thank you for the opportunity given.
Thank you, sir. We are going to start the scientific session. A good communication is a bridge between confusion and clarity. So, I have an opportunity to call upon our organizing secretary, Mrs. Christy Kamala ma'am, MSc, PhD in nursing, head of the department in medical surgical nursing, the administrative officer, SKS College of Nursing, to introduce our first speaker.
Good morning, everyone. Now I welcome Dr. Professor Bhaskaran, PhD College of Nursing, Coimbatore. His total experience is 17 years. He completed his UG in the year of 2002 in Sacred Heart Nursing College, Madurai. He completed his PG in the year of 2008 in Omayal Archie College of Nursing, Chennai. Also, in 2021, he completed his PhD in nursing from Adi Parashakti College of Nursing, Chennai. Melmarvattur, Chennai. He received an award on academic excellency and outstanding contribution in research, and he participated in international faculty and student in charge program conducted by Switzerland Institution. Furthermore, he done his specialization around 105 courses from various international universities. He is a research guider for both BSc and MSc nursing, guided around 90 students. Now I welcome Dr. Professor Bhaskaran sir to start this session. Thank you, sir.
Thank you, ma'am, for introducing our first speaker in a pleasant manner.
Good morning, all. Thanks for giving me this opportunity to present the topic today to organizing chairperson and principal Selvaraj sir and organizing secretary, Christy ma'am. Thanks, ma'am. Thanks for your warm welcome. Okay, my topic is bridging bonds, nurturing nurse-patient connections through effective communications. So, everyone knows about the communications. It's exchanging the informations between two persons. It's like that emoji also you can easily see. So they can easily exchange the informations. The receiver, they will receive the informations and then they will give the feedback to the particular persons. Then in therapeutic communications, here as a nurse, if you are going to interact with the patients, they have to get the benefit and then they will get the satisfactions with the help of your words and then giving the care. So that is the main importance of therapeutic communications here. Okay, these are the types of communications and ways to use them. It's like these are the types: verbal communications, non-verbal communications, written and visual communications. Here in verbal, use a strong, confident speaking voice. Okay, you have to talk it louder. Okay, when you are interacting with the patient side, if you are going to polite in manner, if you are talking with them, sometimes they won't hear. If it is elders, okay, they will think that you are not interacting with them. So that is the thing. Then use active listening. Okay, you have to listen carefully what the patients they said. If you are responding them, if you are restating the statements, that time they will understand. Okay, they are listening and they are going to give the care to me. Then you avoid filler words. Filler words, it's like when they are talking with them, you don't want to say, it's like if you are telling who like that, they won't think that. Okay? You are not listening their words. You have to actively, but you have to nodding the head, and if you are doing polite manner, that time they will accept. Okay, they are going to talk more with you. Then avoid industry jargon when appropriate. Jargon words, it's like if it is psychiatry, you don't want to use that much terminology with the patient side. If you are going to tell, I think you have the delusions, then hallucinations. They might not be known about that. These are the terms. You have to talk it with that, what they can easily understand. Okay, if you are talking with them, then only they will understand, and then they will reduce that type of symptoms also. Okay, these are the things it comes under. It's like verbal. Then in non-verbal, notice how your emotions feel physically. Okay, in communications, both the process will occur, patient side as well as the staff sides also. Okay, how you are going to respond with the patient side. Okay, so that is the thing. Then be intentional about your non-verbal communications also. How you are going to stand them. Okay, if you are going to talking with the patient side, then you are going to turn there. That time they won't think, okay, the staff is not interested to listen me, like that they will think. Then mimic non-verbal communications you find effective. Okay, these are the non-verbal techniques we have to use. Then in visual, ask other before including visuals. Sometimes, okay, most of the students also nowadays, if you are conducting any programs, they will take the selfie with the patient side also. But we have to tell, okay, you have to get the consent. Okay, without the consents, you can't take any selfie or video. But even though any that particular function day, but we have to get the consents. Otherwise, it's very difficult. Okay, why? Because that visual communications also will occur. Sometimes they will post it in Facebook or Twitter, and then if they are getting the annoying, so it's very difficult. So we have to get the consents there. Then consider your audience, okay, whom you are going to conduct. Sometimes some of the students, they are taking short videos with the patient sites also. So they have to think over that. Okay, otherwise, if it is possible, they have to cover the patient face or eyes. It's like they have to think over. Then only use visuals if they add value. Okay, otherwise no need to take. Just I am going to take the selfie with the patients, like that they don't want to take. Okay, then make them clear and easy to understand. So that visuals also sometimes with the help of YouTube, they are going to give the interventions with the patient side if they are doing any type of research kind of studies. So they have to carefully they have to take the videos. Okay, that video also communicate with the patients how they are going to respond to the particular things. They have to think over that. Then in written, strive for simplicity. Okay, don't want to write it para and para. They have to write it in simple and clear sentences, so anyone can easily understand about that what they written in that particular communications. Then don't rely on tone. Sometimes if they are new novice nurses, they are posted in the clinicals, sometimes consultant with the help of any kind of orchestras, if they are telling louder noise means they don't want to write it more important, it's like that. They have to think over, they have to analyze, okay, which one is it's correct. That thing they have to give the importance, and then they have to carry out the particular orders. Then take time to review your written communications. So if you are written immediately, then and there, then thereafter you have to read it once again. Whether you are written that sentences is clear manner or not, you have to read it once again. Then keep a file of writing you find effective on enjoyable. These are the types of communications and way to use them in patient side. Okay, verbal, non-verbal, written and visual communications. Okay, then that 7 C's are very important for communications. Okay, confidence, coherence, conciseness, courtesy, correctness, clarity, concreteness. Confidence, okay, when you are interacting with the patient side with the confidence, you have to talk. Okay, if you're not confidence means they won't listen to you. Okay, that time you won't get the exact informations from the patient side. Then coherence, you don't want to use that dilemma words or dilemma thinking. Okay, you don't want to maintain. You have to, with the confidence, you have to talk. Then concise, what you are going to give the information, it should be very concise size. Don't want to tell all the nursing interventions together to patient side within 5 minutes. Okay, that time they will think that they are overburdened or overloaded. Then courtesy, you have to give the courtesy to the patients. It's any idea about courtesy means? Yes. Yes, good. Showing sympathy or courtesy, it's one of the Tamil meaning is it's like mariyadai. Mariyadaiya pesanu. So it's like, okay, if you are not going to give some importance to, if you are going to if the sometimes other language students, Kerala students or Andhra students, they are going to talk with the Tamil means they will tell இதெல்லாம் செஞ்சிரு அப்படின்றாங்க. பட் டவல் இருந்தால் டவலை பத்திரமா எடுத்து வச்சுக்கோங்க அப்படின்னு டவலை சொல்லுவாங்க. பட் they are not going to give the importance to patients. So we have to train them. Then correctness, correct words we have to use. Then clarity, it should be very clear. Okay, don't get that any confusions when we are talking with that patient side. Then it should be concrete enough. Okay, with stable enough, you have to talk with the patient side. So these 7 C's are very important for effective communications. Some theories, not in detail. Okay, some few theories with briefly I will tell. That Roger's theory, core conditions of person or patient-centered therapeutic approach. These 3 things are very important when we are doing that communication with the patient side. Okay, warmth and genuineness, empathy, then unconditional positive regards. Warmth and genuineness means we have to accept the patient in psychiatric nursing principle. First one, any idea? Psychiatric nursing, principles of psychiatric nursing, first principle. Yes, good. Accept the patient as he is. We don't want to judge the patient. Okay, as they like, we have to accept and then we have to give the care. That time they will feel that okay, they are in safest place and then they can easily explain their whatever the feelings they have. Okay, if you are showing the judgment with the patients, அவங்கள பார்க்கவே கொஞ்சம் டென்ஸ்டாக இருக்காங்க, நான் பேச மாட்டேன் அப்படின்னு போனீங்கன்னா they won't communicate with you. So that is the thing, warmth and genuineness. Then empathy, we have to understand the empathetic feeling of the patients. Any idea about empathy? Yes? Any volunteers? Yes, feeling the patient's view. Okay, we have to stand with their shoes. It's like அவங்களோட situations-ல போய் we have to stand and look over the particular situations. So that is the empathetic feelings. That also certain limits, understanding their experience, but not necessarily agreeing with it. For example, alcoholics. Okay, they have empathetic feeling. It's like எனக்கு எவ்வளோ பிரச்சனை இருக்குது, ஒவ்வொரு நாள் ஒவ்வொரு பிரச்சனை, அதனால I am going to drink. நான் எம்பத்தியாக இருக்கேன் அப்படின்னு போய் I can give that money to drink. Is it or not? So we have to understand with their certain limit, okay, where we have to think, where we have to show the sympathy and empathy. Then unconditional positive regard, accepting the validity and value of the person's experiences. So we have to unconditional positive regards, we have to give it to the patients. That time they will understand and then they will get that quick recovery from the hospital side. Okay, these are the three important things given by the Rogus. The next one, nurse-patient relationship according to the PEPLAS, phases of nurse-patient relationships. These are the 4 phases: orientation phase, identification, exploitation, resolutions or termination phases. So in orientation phase, the patients may feel that they have the 6 professional assistance and support from the nurse. So as a nurse, we have to establish a rapport with the patients and assist them to engage in therapeutic relationships. So that is our first role. We have to accept the patients as he or she is. Then we have to render the care to them. Then identifications. As the patients, they have that use the nurse to explore the issues they experiences. As a nurse, encourage the patients to identify relevant issues and act as a resource to enable the patients to assess, support and informations. We have to identify the problems and then we have to give the care to the particular patients. Then exploitations. Patient side make use of the nurse to problem solves. They will think that the staff nurses, it's going to solve the problem with their particular things. So as a nurse, develop the patient's competencies and support the recovery. Based on the competency level of the patient side, as a psychiatric nurse or staff nurses, they have to give the health educations or rendering the care. That time they will recover from the problems. Then resolutions or termination phase becomes free of the need for assistance and support from the nurse. So it's like termination phase, they are going to discharge from the hospital. So as a staff nurses or psychiatric nurses, they have to give the effective psychoeducations or health educations. What are the things they have to follow in the home care we have to give. So that time they will feel the confidence enough and then they will discharge from the hospital. So these are the things it's given by the PEPLAS phases, 4 phases. Then so effective communications, it's essential for nursing practices in that all 4 years. Is it or not? Yes? Yes, audience? So, okay, if it is in the first year means introductions to communication in healthcare settings. So they are going to the particular hospitals or particular area and then they are going to communicate with the patients. They are going to learn the basic principles. What are the effective communications way to communicate with the patient side. Then professional writing in nursing. In the first year itself, they are going to write the care plans. So from the care plan itself, they are going to write what are the ways they have to write it in professional way. Then verbal communications, there itself in first year itself you are going to give the health education with the patient side. So you are going to learning that much therapeutic communication techniques. What are the ways you are going to communicate with the patient side. Then health communication strategies, the understanding and applying communication strategies to promote health education. So these are the things they are learning in the first year. If it is in the second year, it's like interpersonal communications. Building effective interpersonal relationship with patients, families and colleagues. So in second year, they are going to post it in the community areas. So there they are going to get the cultural competencies. So they are going to see the many community people and many cultural people. From there they are going to learn many things. What are the ways they have to communicate, what are the cultural beliefs, they will understand, and then they are going to communicate with them. Then therapeutic communics, these techniques for fostering therapeutic communications with the patient side. Then team communication in healthcare, collaborative communications within interdisciplinary healthcare team members also they are going to communicate. In second year posting, if they are going to particular wards, it's like whatever the wards, medical ward, surgical or cardio wards, there and all, they are going to talk with the patients as well as the team members, health team members, maybe physiotherapists or dietitians, there and all, they are going to interact, and then they are going to help the patients for quick recovery, and then they are going to improve the patient satisfactions. Then in third year, it's like ethical communications in nursing. They are going to understand that what are the ethics they have to follow. Mainly they are going to do the research also. In the research also, there also the patients as well as the study participants, they are going to get the benefit with the help of your effective communications. Then patient advocacy and communications. Your role, it's like advocacy to tell about that what are the important things in that patient's care side we have to tell. Then advanced verbal and non-verbal communications you are going to use. Then communication in crisis situations, managing communications effectively during emergencies and critical incidences. So crisis situations, sometimes the patients will feel that very depressed, or they feel they can't control that their feelings. Okay, if it is occur, means what you have to going to de-escalate the problems, and then they are going to get the benefits. Like that, you have to interact with them. Then in final year, it's like leadership communications in nursing. Then develop communication skills for leadership roles within nursing. So you are going to learning the management, and then you are become a leader. Okay, maybe the leader in a particular team. So you are going to know that what are the ways you are going to control over the particular team. Then health informatics and communication technology, you are going to use very effective informatic communications. Then capstone project with emphasis on communications. Capstone is nothing but it's theory into practice. So whatever the things you learn in that last 4 years, you are going to implement with the help of the patient side, with the help of your 4 years, what are the things you learn, with the competencies you are going to apply with the patient side. So theory into practice you are going to use. Then clinical practicum with communication focus, application of communication skill in real clinical settings. It's like during the 4th year itself, you have the intensives. Is it or not? Yes. So there also you are going to implement. Then in effectively after completion of 4th year, we are going to implicate with the patient side in clinical settings. Then professional development and communication, preparing for effective communication in professional setting and job interviews. You are going to get ready for that, your campus interview. So with the help of your effective communications. So these are the things we are using the students in that within 4 years. Then some of the modules, communication modules. First one, introduction to communication nursing. Then second one, therapeutic communication skills, nurse-patient communications, interprofessional communication, communication technologies in nursing, ethical consideration in nursing communications, communication in crisis situations, professionalism and communications. So first module, it's like introduction to communication nursing. You are going to overview of communications in healthcare settings, importance of effective communication in nursing practice. Then you are going to use all the types of communications, visual, non-verbal, written and visual communications. You are going to understand that what are the barriers in communications healthcare. Then only you are going to give the effective communications with the patient side. Then second one, therapeutic communication skills, building rapport with patients, active listening techniques, empathy and understanding nursing communications, non-judgmental communication, developing cultural competencies in communication. In previous slide we discussed. So these are the things we have to follow. Be empathetic, and then we have to understand the patients without any judgments. Then third, nurse-patient communication, interviewing techniques for health assessments when you are doing the health assessments or history collections with the patient side effectively. If it is second year or third year, third year, if you are going to do the assessment, health assessments for adult patients as well as the child patient, pediatric, then psychiatric, we have to use effective communications to collecting the history from the patients, then delivering difficult news with sensitivity, then informed consent communications, communicate with diverse patient population, establishing trust in nurse-patient relationships. These are the things we have to effectively have to use. Then interprofessional communications, collaboration and communications with healthcare teams, then effective handoff communications, interprofessional rounds and case discussions, conflict resolutions in healthcare settings, role of communication in patient safety. We have to think over that interpersonal communications with that other team members. So that time we are going to communicate with that other team members effectively, then only the patients will get the benefits. Then communication technologies in nursing, use of electronic health records in communications. This one is, it's like in futures most of the hospital they are going to use that EHR. It's like electronic health records. In our hospital, in PHG hospital and all, now they implemented no need to record that nurses notes in case file. They have to enter everything in tab. Okay, we issue the tab to all the wards. In EMD also they have to enter that all the patient details in that tab only. Okay, if you are recording everything, then it will saved in the cloud storage. We can easily download the things. It's like everything they are doing. So we have to know that how to effectively we are going to use that technology in that communications also. Then telehealth and visual communication in nursing, then ethical consideration in digital communications. We have to ready to accept ethical consideration in digital communications ways. Then enhancing patient education through technologies. Okay, before corona and all, we are not aware of that much of technology. It's like Google Meet, Zoom Meet, then whatever that WebEx, that and all, we are not aware of it. After the corona only, it's we are aware of it. We can easily now we can organize the Google Meet or Zoom Meet within a fraction of seconds. It also motivates us to learn the technology. So we have to use effectively. Then legal and ethical consideration in nursing communications, privacy and confidentiality in healthcare communications, ethical dilemmas in nursing communications, documentation and legal implications, communication in end of life and advanced directives. So we are the responsible. If the patient is some mortality, it's occur in that particular ward or ICU, we are the responsible persons to record that whatever the things, incidents it's occur, we have to note it immediately with the time and date. Okay, if it is any ethical issues or legal issues will rise, if we are having the evidence, we are going to recover. Otherwise, we are the responsible for that particular things. The communication there are also very effective, we have to use. Then communication in crisis situations, crisis communication strategies we have to use. Then communicating in emergency and disaster situations, de-escalation and high stress environments. Then managing communications during unexpected events. We have to de-escalate the crisis situations. Patients violent ஆகி கத்திக்கிட்டு இருக்காங்கன்னா அங்கே போய் வந்து நம்ம போய் நாட்டாமல் பண்ணக்கூடாது. We have to solve the problems and then we have to talk it very politely and then we have to reduce the stress of the patients and then we have to solve the problem. அவங்க சத்தம் போட்டு பேசுகிறாங்க, நம்மளும் ரொம்ப சத்தமாக பேசினா அவங்க சரியாக ஒன்று we can't talk with the patients. Is it right or not? ஓகே, நம்ம அவங்க ரொம்ப இப்போ ரொம்ப டென்ஸ்டாக இருக்காங்க, இப்போ சம் மோர்டாலிட்டி இட்ஸ் அக்கர் இன் த இஎம்டி. Okay, how you are going to handling the situations. We have to ready to do the things, how we are going to prevent the crisis situations. ஓகே, ஏன்னா பேஷண்ட் என்ன சொல்லுவாங்க, அட்டண்டர்ஸ்லாம் இப்போ தான் கொண்டு வந்தாங்க, நல்லா தான் இருந்தாங்க, ஆம்புலன்ஸில் வந்தப்போ உள்ளே ஏற்றுனாங்க, உள்ளே வந்தவொடனே இறந்துட்டாங்க அப்படின்னு சொன்னாங்கன்னா, ஸோ வி ஆர் த ரெஸ்பான்சிபிள் பர்சன்ஸ். வி ஹாவ் டு ஹேண்டில் த பர்டிகுலர் டேக்கிள். வி ஹாவ் டு டேக்கிள் த பர்டிகுலர் சிச்சுவேஷன்ஸ். வி ஹாவ் டு எக்ஸ்பிளைன் கிளியர்லி. தென் only they will realize, okay, they will accept and then they will go. Otherwise, they will fight with others. Then professionalism and communications, professional communication standards in nursing, then advocacy and effective communications, communicating with colleagues, superiors and administrators, lifelong learning and communications. So these are the 8 modules of effective communications. Then these are the barriers of effective communications. Okay, if it is positive is there, some of the negative also there. So we have to accept the negative. Okay, if you are not ignoring the negative, what will occur? Then we are become overconfidence. Okay, then overconfidence are in the, it's not effective. We have to accept the barriers. What are the barriers? How we are going to overcome from the barriers? So this one is, it's like physical barrier, perceptual barriers, emotional, cultural, language, gender, interpersonal, then organizational barriers. In physical barriers, particular time and distance, then personal space, workplace designs, then work environments, background noise. So these are the barriers will occur when you are communicating with the patient side. Okay, we have the patients when they are admitting in the EMD or particular ward, they will feel that someone is want to come and talk with them. Okay, patient வந்து half an hour போய் யாருமே பார்க்கலன்னா what they will think? Okay, ஒரு எஃபெக்டிவ் இல்லை, என்ன ஹாஸ்பிட்டல் நடத்துகிறாங்கன்னு தே ஆர் கோயிங் டு அனாயிங் அண்ட் தென் அட்டண்டர்ஸ்லாம் அஜிடேட் ஆகிடுவாங்க, யாருமே இல்லை அப்புறம் எதுக்கு வந்தோம். Okay, it's like time and distance, we have to think over that. We have to immediately go and talk with the patients, then our attenders, then only they will realize. Then personal space, we have to give some personal space to the when we are going to talk with the patient sides also. Sometimes if the patient is ignoring or they don't want to tell that particular incidents, means we have to give the space. ஓகே, இல்லை அதெல்லாம் இல்லை, நீங்கள் சொல்லியே ஆகணும். பேஷண்ட் வந்து சூசைட் அட்டம் பண்ணியிருக்காங்க, அட்டண்டர்ஸ் வந்து சொல்லிட்டாங்க சூசைட் அட்டம் பண்ணியிருக்காங்க, ஹேங்கிங் பண்ணும்போது வந்து ரெஸ்கியூ பண்ணிட்டோம் அப்படின்னு. பேஷண்ட் வந்து இருக்காங்க, இல்லை நான் எஃபெக்டிவாக கம்யூனிகேட் பண்ண போகிறேன், சொல்லுங்கள் எப்படி போய் தொங்க போனீங்க, தொங்க போகிற முன்னாடி ஏதாவது ட்ரையல் பண்ணிங்களா, எதாவது தொங்க விட்டு பார்த்தீங்களா, நம்ம போய் புதுசாக ஐடியாலாம் கொடுக்கக்கூடாது. ஓகே, ஸோ அந்த மாதிரி சொன்னோம்னா நெக்ஸ்ட் டைம் ஆமாம் அந்த ஸ்டாஃப் சொன்னாங்க ஏன்னா தொங்கும்போது ஃபேன் அந்து விழுந்துருச்சு, கரெக்ட், நான் போய் ஃபஸ்ட்டு வெயிட்டு தொங்க விட்டு பார்த்துட்டு நான் போய் தொங்குறேன்னு போயிடுவோம். ஸோ வி ஹாவ் டு கிவ் த சம் பர்சனல் ஸ்பேஸ். ஓகே, தேர் ஆஃப்டர் ஒன்லி வி ஹாவ் டு டாக். தென் workplace design, work environments, background noises. Background noises means some things it's going occur in the particular wards, means we have to priorly we have to tell. Some constructions work போயிட்டு இருக்கு, கொஞ்சம் இருக்குங்க, கொஞ்சம் அட்ஜஸ்ட் பண்ணிக்குவீங்களா, இல்லைன்னா வேறு வார்ட்ஸ் பண்ணலாமா என்னென்னு we have to ask it in politely. பிகினிங்லேயே கேட்டுட்டோம்னா ப்ராப்ளம் இல்லை, இல்லைன்னா what they will think, nothing is there in hospital, they will tell and then feedback formula அப்படியே எழுதி வச்சுட்டு போயிடுவாங்க. தென் யூ வில் பிகம் சஃபர். we have to avoid that. Then emotional barrier, anger, pride and anxiety. Okay, we have to control over the anger, then pride and anxieties. Okay, in therapeutic communications 2 things will occur. I think you are aware of it in 3rd year psychiatric nursing. Okay, I think just now you begins. Okay, it's like what are the therapeutic techniques? Any idea? It's like transference, counter transference will occur. Transference means, yes, toward the nurse, how they are going to use, positive or negative? Yes, positive. Okay, the patients will think that they are அவங்க வந்து என்னோட பொண்ணு மாதிரி இருக்காங்க, என்னோட பையன் மாதிரி இருக்காங்கன்னு they will feel that. ஓகே, அந்த மாதிரி நடக்கும். Counter transference, ஓகே, நர்ஸ் வில் திங்க் தட் அவங்க வந்து எங்கள் அப்பா மாதிரி இருக்காங்க, அண்ணா மாதிரி இருப்பாங்க, அந்த மாதிரி நடப்பாங்க. ரெண்டுமே பாசிட்டிவ் திங். அனதர் பாயிண்ட் இஸ் த நெகட்டிவ். நெகட்டிவ் ஆல்சோ அக்கர் இன் டிரான்ஸ்பரண்ட் அண்ட் கவுண்டர் டிரான்ஸ்பரன்ஸ். இட்ஸ் லைக் பேஷண்ட் என்ன நினைப்பாங்க, அவன் அந்த பொண்ணை பார்த்தாவே ஒரு எதிரி மாதிரி இருக்குது, எனக்கு வந்து அவங்கள பிடிக்காத அவங்க அதே மாதிரி இருக்காங்க, அதே மாதிரி ஆட்டிடியூட் இருக்குது, அதே மாதிரி ஃபேஸ் இருக்குது, அந்த மாதிரிலாம் திங்க் பண்ணுவாங்க. we have to accept it. ஓகே, அதை புரிஞ்சுக்கிட்டு we have to give the care to them. ஓகே, அதர்வைஸ் they will அவங்கள பார்த்தாவே டென்ஷன் ஆகிடுவாங்க. ஸோ we have to avoid that particular situations. Okay, what are the ways you are going to avoid? We observe the patient's activities or attitudes. ஸோ அது வந்து நம்ம சீனியர் ஸ்டாஃப்ட்ட சொல்லிவிட்டு we can change that also. Okay, these are the emotional barrier will occur when we are communicating with the patient side. Then perceptual barriers, thought, assumption, preferences, value, attitudes. Perceptuals, they have the pre-ideas about that, pre-judgment about the patients as well as pre-judgment about the staffs. Okay, for example, first time novice nurses, they are posted in the hospitals. In our hospital, in PAG hospital and all, we will allow them to wear white dress, white uniform. After 3 to 6 months only, we are giving the staff nurse uniform. They are in probation period. Okay, there they will learn to how to behave with the patient side. We are giving the, it's like. So the patients will think that white dress na அவங்க வந்து நியூவாக ஜாயின் பண்ணாங்க, அவங்களுக்கு ஒன்றும் தெரியாதுன்னு நினைப்பாங்க. பட் நியூவாக ஜாயின் பண்ணவங்க irrespective ஆஃப் வாட் எவர் த எக்ஸ்பீரியன்சஸ் 5 years 10 years முடிச்சுட்டு புதுசாக ஹாஸ்பிட்டல் வரவங்களுக்கு ஒயிட் யூனிஃபார்ம் தான் கொடுக்குறோம். ஏன்னா தே ஹாவ் டு லேர்ன் அபவுட் தட் ஹாஸ்பிட்டல் ரொட்டீன்ஸ். அட்லீஸ்ட் 1 month ஆகுது, தே ஹாவ் டு அப்சர்வ் தட் அண்ட் தென் தே ஆர் கோயிங் டு கிவ் த கேர். ஓகே, பேஷண்ட் சைடில் என்ன நினைப்பாங்க, ஏற்கனவே அட்மிட் ஆகிக்கிற பேஷண்ட்ஸ்னால் தே ஐடியா அபவுட் தட், அவங்கன்னா அப்படி பண்ணுவாங்க, இவங்கன்னா அப்படி பண்ணுவாங்க. சம்டைம் தே வில் கால் த சீனியர் ஸ்டாஃப், இட்ஸ் லைக். ஸோ தே ஹாவ் த தாட் அபவுட் தட் assumptions, preferences, value, then attitudes. Then cultural barriers, it's language, non-verbal language, cultural norms, beliefs and values. Okay, cultural barriers also will occur. We have to accept that patients, their cultures. Okay, based on that we have to talk with them. Okay, if the patient is they have that much belief about the God, okay, that time you don't want to argue with the things about the God. Okay, what will occur? Okay, they are annoying and then they will tell எனக்கு அந்த ஸ்டாஃப் வர வேணாம் அப்படின்னு வந்து சொல்லிக்கிட்டு இருப்பாங்க. ஸோ we have to ready to accept. Then language barriers, regional accents and dialects. So what is the meaning regional accents? ஓன் லாங்குவேஜில் நீங்கள் வந்து என்ன பண்ணுவாங்க, இப்போ கோயம்புத்தூர்காரங்கன்னா கோயம்புத்தூர் பாஷையில் நான் பேசுகிறேன் அந்த மாதிரிலாம் பேசும்போது சம்டைம் பேஷண்ட் வில் அக்செப்ட், சம் பேஷண்ட்ஸ் தே வில் ஆனாயிங் எனக்கு அந்த மாதிரிலாம் வேணாம் அப்படின்னு நினைப்பாங்க. ஸோ தட் ஆல்சோ ஒன் ஆஃப் த பேரியர் த. தென் பிடிஜன் லாங்குவேஜ், ஜார்கன், ஸ்லாங், வேர்ட் சாய்ஸ், லிட்ரஸி அண்ட் லிங்குவிஸ்டிக் எபிலிட்டிஸ். தீஸ் ஆர் த பேரியர்ஸ், வி ஹாவ் டு அக்செப்ட் இட். ஓகே, இந்த பேரியர்லாம் இருக்குது. ஸோ ஹவு ஐ ஆம் கோயிங் டு ஓவர் கம் ஃப்ரம் த பேரியர்ஸ் with the help of effective communication strategies, and then you are going to give the care to the patient side. Then these are the therapeutic communication techniques, common techniques: listening, broad opening, restarting, clarification, reflections, humor, informing. Listening, it's like active listening and passive listening. We have to be active listener when we are doing the care to the patients, as well as if you are going to give the counseling, be active listener. Then only you will understand the patient's communications, their problems. Then only you can give the solutions for that. Then broad openings means open-ended questions we have to ask. We don't want to ask closed-ended. இப்போ மனசுக்கு எப்படி இருக்குன்னு தான் கேட்கணும், இப்போ மனசுக்கு சந்தோஷமாக இருக்குன்னு கேட்கக்கூடாது. So it's like that we have to ask. Then restarting, okay, when we are interacting with the patient side, what are the important points we have, keep it in our mind. Then we have to restate the particular statement. That time they will realize, okay, they are active listening and then they are responding. நான் என்ன சொல்லணும் அதை வந்து அந்த ஸ்டாஃப் சொல்கிறாங்கன்னு they have the confidence enough to the particular staff. Then clarifications, you have to give the clarifications with the then and there when you are giving the care or talking with the patients. That is the thing. Reflections, you have to reflect. Then you have to use the humor also. Then informing, you have to give the much of the informations to the patient side for better outcomes. So these are the few therapeutic communication techniques effective in way of communications. Then what are the strategies to improve patient outcome and satisfactions means providing CNE interactive workshops and seminars. It's like same like type of conferences, staff nurses they have to attend. They have to learn more about that, what are the effective communications we can utilize with the patient side. Then conducting empathy and active listening training. We have to conduct the empathy, active listening training. Otherwise, you can search it in YouTube also. What are the ways empathy they are using in the patient side? You can easily get it from that. Then cultural competence training. Okay, we have to train ourselves. What are the cultures there? How we are going to behave with the particular patient side. Then access to resources, workshop, conferences focused on communication in healthcare. Then mentorships and preceptor programs where experienced nurses mentor newer ones. It's like I have quoted எங்கள் ஹாஸ்பிட்டல் நியூ ஸ்டாஃப்ஸ்க்கு வந்து ஒயிட் ட்ரெஸ் கொடுத்துப்போம். அப்புறம் தான் ஒரு 3 months we are going to give the normal uniform. So mentors, it's like senior staffs or head nurses, they are going to give their own experiences. They are sharing with the particular newly joined staffs, and then they are going to train them how they are going to communicate, how they are going to behave with the patient side. So with the help of preceptorships or mentorships. Then help for accurate assessment and diagnosis are foundational to develop effective treatment plans. So we are going to, with the help of effective communications, we are going to give more information about the particular disease conditions, and then they are going to come to know about the treatment plans with the help of your effective communications. Then patient understanding and adherence to treatment plans. Then prevention of medications errors, it will occur. Then clear communication helps prevents errors in medication administration, treatment procedures, and diagnostic process. These are the effective strategies of using communication with patient side. Then what are the effective communication skills means? We have to clear communications enable the gathering of comprehensive and accurate information about your patient's medical history, symptoms, and concerns. Accurate assessments and diagnosis are foundational to developing effective treatment plans. So whatever the things we are going to explain with the patient's side in very detail enough, that time they will realize whether they require that hospital admission or not. If it is required, how many days they have to stay, what type of treatment they are going to get, everything we have to tell it in effectively. Then then only the patient will understand and adherence to treatment plans. When patient and caregivers have a clear understanding, they are more likely to adhere to prescribed medications, follow recommend lifestyle changes, and follow appointments. Okay, when we are doing the effectively, then only they can easily understand, and then they will cooperate to the particular treatments, and then they will do the regular follow-up. Otherwise they won't follow that. They will think that if it is in psychiatry also, first time admission they will follow the medication effectively. After second time or third time, what will occur? Any idea? In psychiatry patient side? Okay, yes, they will skip or stop the medication. Why? Because எனக்கு வந்து அந்த சிம்டம்ஸே இல்லை, நான் எதுக்கு அந்த டேப்லெட் எடுக்கணும்? They have the attitude. Okay, as a psychiatric nurse or staff nurses, we have to clearly explain. ஓகே, எப்போ ஸ்டாப் பண்ணணும்னு கன்சல்டண்ட்டை டிஸ்கஸ் பண்ணிவிட்டு ஸ்டாப் பண்ணணும், இல்லைன்னா ரெகுலராக மெடிசன் எடுக்கணும்னு we have to tell it clear. Otherwise they will think that ஓகே எனக்கு சிம்டம்ஸ் இல்லை, ஒய் ஐ வாண்ட் டு டேக் த ரெகுலர் மெடிகேஷன்ஸ். They will skip or they won't take the medicines. So relapse will occur in psychiatry. Then prevention of medication errors, clear communication help prevent errors in medication administration, treatment procedures, and diagnostic process. Then patient safety is very important. Prevent misunderstanding, ensure the patient safety protocols are followed. When they are admitted in that particular hospital, we are giving that what are the safety measures we are taken for the patient side also. They have to follow that particular things. Then enhance care coordination. Well coordinated care ensure that all team members are aware of the patient status, treatment plan, and any changes in conditions leading to more cohesive and effective care. Okay, that is the way we have to render the care to the patients. They have to believe us. Okay, everyone they aware of my conditions, what are the medicines I am taking, what type of treatment I am getting from the hospital. They have to get the enough confidence. Then only they will easily recover from the problems. Then improve patient satisfactions. These are the ways. Then patient-provider relationships. Encourage open dialogue, allowing patient to share concerns ask questions, and actively participate in decision makings. So encourage open dialogue means we have to give the space for the patients to talk with the staffs. ஓகே, போய் ஸ்டாஃப் வந்து எஃபெக்டிவாக கம்யூனிகேஷன் பண்ணேன்னு பேசிக்கிட்டே இருந்தாங்கன்னா என்ன ஆகும்? அந்த ஸ்டாஃப் எப்படா பேசி நிப்பாட்டுவாங்கன்னு நினைப்பாங்க. ஸோ அந்த மாதிரிலாம் திங்க் பண்ணக்கூடாது. We have to give some space for them. They have to talk. They have to give their feedback to the particular things. Then only they will learn. They will recover from the problems. Then effective transition of care. Clear instruction and information during this transitions reduce the risk of complication and readmissions. Mainly in psychiatric care, transition of care, they have to clearly understand how whether I have to, what are the things I have to do after the discharge from the hospital, what are the follow-up I have to do. They have to get it from the staff nurses. Then psychological support positively impact of patients and mental and emotional well-being. They have to feel that they have very psychologically supported care. Then reduce patient anxiety. Patients who feel informed and reassured are more likely to experience positive outcomes. They have to feel that they are secure place. They are in the secure place. They are going to discharge from the hospital in very faster manner with the help of the communications. Okay, these are the things in future. Most of the hospitals, they are going to use the electronic health records. So we have to very careful to safer to use the electronic health records. That what are the ways means? S stands for conform to standards. A stands for it's acceptable to patients, carriers and healthcare staffs. F stands for fit for purpose. E stands for evidences, or stands for risk managed. These are the electronic system and the way we are going to use in the futures. Few of the hospital, I mentioned that in our hospital we are using the electronic health records. Whatever the informations we are entering in the system only. Tab in staff nurses side, provided tab in consultant side, we given the system, they are recording everything in that system only. Then what are the other ways of improving effective communications means? Self-review and reflections tool in a checklist format. We have to provide some of the checklist for the staff nurses side, whether you are doing the effective communication or not. They have to self-appraisals. They have to give the self-appraisal. How many techniques, therapeutic techniques they are using. Then what are the ways they have to improve. They have to give they have to fill the checklist. Then facilitate scenario work and role play learning. So within the ward, we can assign the staff head nurses to do the role play about the effective communication techniques. That time they will easily learn what are the ways they can improve their communications with the patient side. Then feedback from patients used an evidence base for change. We are going to analyze the feedback analysis of the patients who are admitted. Then what are the things they given comments for the particular staff nurses. We are going to interact with the staffs. What are the ways to improve the patient side care. Then peer observation of practice. Then training the focus of journalist experienced nurses rather than nurse specialists and trainees. So we have to give some more training for the staff nurses. Then technology for self-directed learning, for example DVDs or e-learning or video feedback training. So these are the ways we can improve the effective communications with the staff nurses in the patient side. Okay, in conclusions, okay, effective communication skills in healthcare, especially among nurses, play a pivotal role in ensuring accurate assessments, safe and coordinate care, patient understanding, and overall positive patient outcomes. Effective communication is essential for high quality healthcare delivery. So we have to give the much better care to with the help of effective communications. They will feel that they are insecure. They will get the post recovery easily. They are going to discharge from the hospitals with the help of your effective communications. Any doubts? Any queries? Any questions? Any queries? No. Thank you.
Thank you, sir, for giving an informative and comprehensive presentation. To honor our first speaker, I request our organizing chairperson and the organizing secretary to present the certificate and memento.
Thank you, sir. Thank you. Thank you, sir, and thank you, ma'am.
Ethics is knowing the difference between what you have a right to do and what is right to do. Once again, I would like to welcome our organizing secretary to introduce about the second speaker.
I welcome Dr. Professor R.R. Kavita, Jibmar College of Nursing, Puducherry. Her total experience is 18 years. She completed her UG in the year of 2021 in PSG College of Nursing, Chennai. She completed her PG in the year of 2006 in Nimans, Bangalore. Also in 2019, she completed her PhD in nursing at Rajiv Gandhi, Bangalore. She is a guider for undergraduate and postgraduate student and her 3 projects received intramural fund. She wrote a book, it's called The Textbook of Mental Health Nursing, Frontline Publication, Hyderabad in 2018. She is the reviewer for many reputed journals, subject matters except for TCS, and also attended and organized many conferences and workshops in various capacity. Now I welcome Dr. Professor R.R. Kavita to start this session. Thank you, ma'am.
Thank you, ma'am, for giving a pleasant intro about our second speaker.
Thank you, Mrs. Christie, for the wonderful introduction. Okay, my topic may look little related with the law and our consciousness, but let us talk about this. Ethical horizons, information of law and governance in clinical practice. So these are my objectives of this particular session. So discussing the social, legal, ethical and cultural context of decision making, develop basis for making ethical decisions in clinical practice, communicate the importance of patients' bill of rights, explain the concepts of ethical principles, apply the ethical principles embodied in the nurses' code of ethics. So what is ethics? What is your understanding about ethics? Right way of doing things. Okay. I expect from the student side. What is ethics? Your understanding. Okay, I will give a simple example. How many of you are day scholars or how many of you are hostelites? All are hostelites. How often you call your parents? How often you call your parents? Daily? Weekly once? Daily you call your parents. Okay. So how many of you feel everyday calling parents is important? Just lift your hands. How many of you feel it's important? Any law said that you are supposed to call your parents every day? No? In your nursing books it's given that you are supposed to call your parents every day? Then why did you call? Why did you call? Yes. You feel that whatever happens in your life, you are supposed to tell your parents. Okay, because they are paying money for you and they'll give so much love and affection for you. So you feel that I ought to call my parents and inform them about me. So that is your Consciousness is working. It is not, nowhere in your law it said that you are supposed to call your parents, and nowhere it is written in your nursing books that you should call your parents, but it happens. The similar way only our consciousness should work when we are working in clinical practice also. So what is ethics in nursing? Ethical values are essential for any healthcare provider. Ethics comes from Greek word ethos and meaning character. Ethical values, whatever ethical values we possess, okay, it is individualized. I feel it is individualized. Everyone should possess the ethical qualities. So rules the conduct that provide a practical basis of identifying what kind of actions, intention and motives are valued. So whatever you do for your patients, we are not observing with a camera. Whether we are putting a camera and observing what are the things you are doing with your patients? No. So when the clinical supervisor comes, so they are seeing how far you are good with the patient, and they may evaluate in a clinical evaluation or a procedures. They will be seeing what are the procedures you are performing with your patients. But it is our consciousness, our moral values, which makes us to work with the patient. So that is the difference, your ethical value. So how you should work for your patient? You should work for your patient with the kind of actions, and the intention and the motives are supposed to be a valued one. So ethics is a set of rules and values that define right or wrong of a conduct. Okay. So one of your ward supervisors have given a work of informing about a procedure to a patient. The procedure is scheduled in the afternoon. The morning supervisor has given you a task that you are supposed to inform the procedure about a procedure to a patient. You are waiting for a patient, but the patient went for some other investigations. So the patient did not turn back. Okay, till afternoon. So afternoon, the patient is supposed to go for the procedure. So what will you do? So you are waiting for your patient. The patient procedure is scheduled in the afternoon. Your supervisor has told you to inform about the procedure to the patient, but the patient you didn't find in the ward, but your supervisor is very strict. So supervisor is coming and asking, did you inform them about the procedure to the patient? What will you do? What will you do? Yes, we will find the patient. Where is the patient? But you couldn't find because patient went for some other investigations and patient procedure is in the afternoon, but you didn't inform. So that is where your ethics plays. So what is right and wrong conduct? So you are supposed to honestly inform the supervisor that you didn't find the patient, so you couldn't inform about the procedure which is planned in the afternoon. So they indicate when behavior is acceptable and when it is not acceptable. Because you are worried about a supervisor, she may reduce your marks, she may find fault, and she may inform that one to your higher ups. So because of that, you cannot say that I informed, but patient did not understand. Otherwise, I saw the patient, I have given the information to the patient attendants. Like that way, we cannot give it. So that is an unacceptable behavior. So the acceptable behavior is either you find a patient and give the information. If you couldn't find a patient, inform the supervisor that I couldn't find a patient, so I couldn't inform about the procedure to the patient. You openly accept. In this situation, nothing is going to be wrong in that. So you can accept. So moral principle prescribes rules of acceptable behavior that are intended to be impartial. Impartial, maybe. So where you are working as a staff nurse, the same ward, one of your close relative is admitted, but you are the duty nurse. So when you are giving care for the patient, you are not supposed to show any partiality in that when you are giving care. So what the time you are providing for the other patient, the similar way only you are supposed to provide care for your own relatives also. That is what the moral principle. You are supposed to be impartial. If at all you want to care for your patient more time, you can take a leave and be a attender for your patient and care. But when you are on duty and you are taking care of your own kin, you cannot be partial by providing only to care to your loved ones and not to the other patients. So ethical versus unethical decisions. Ethical decisions reasonable, acceptable because it's aids stakeholders, organization and society. Not only ethical decisions will improve our life, this one, as well as which organization we are working, there also it will provide. And the society also it's good. What is unethical decision? Individual gain is placed above other needs. So you're not thinking about your organization, you're not thinking about your patient, but you feel that this one only is supposed to be. The first example I gave, no, the patient you are searching, but you couldn't find the patient, but you are supposed to report to the supervisor. So in that time, you are thinking that my personal, this one may go down. So I will say the supervisor that I have seen a patient, I have given the information. You just think the patient is not actually verbose. So you can easily tell, I have informed the patient is not going to vocalize that the sister has already informed me, like that way. So that is what the unethical decision. So you should not do like that. So do what is right, not what is easy. So ethical perspective evaluating behavior, every one of our ethical principles will be influenced by the society, legal and organizational and individual. Each and every individual will have our own ethical principles. So societal ethics, when you say, how many of you are riding a vehicle to an office? Many of us will ride a vehicle to the office, maybe a two-wheeler or we are coming. So why are you following a road rules? Because I am paying a road tax, I am paying for my vehicle, I paid the insurance, why I should follow the rules and regulation? Law says, it's a societal norm. Okay, so that is what standards that govern how members of the society are to deal with others on an issue of fairness, justice, poverty and individual rights. So all those things, because if I feel that I need to go to my office by 8:25, so I am taking a one way and going, the other citizens also can go like that way. But that is affecting a societal perspective. So what I'm saying then, when you follow your ethics, the society is benefited. Legal perspectives, always law says something. Societal values and standards are enforceable by the court. So ethics are not law by any means, simple belief about what is right or wrong. The legality of actions and decision does not make them ethical. So in this way, how you can say that means law moved with the current culture and moral principles lag behind because they are written and set. So does not ensure and even promote ethical behavior. One example I would like to give. So a court case is happening in a court. So what does the law says mean? There should be any evidence for a person to be called as a convict. Okay, convict, if you want to call somebody convict, the person, some evidence should be there against him that he has committed that mistake. But the person committed mistake, but there was no evidence. The law says he cannot be convicted, he need to be released. But the person's ethical consciousness will prick. Because if at all he did an accident, a child has actually had injury, sustained severe injury, but the man has come to the court, but nobody has witnessed that one. So he can say that the child actually, without any knowledge, the child ran into my vehicle, like that way. But he only hit that child. But unless he is not revealing that he only did the mistake, no one knows. So the court says, when the mistake is committed, there should be some evidence to convict the convict. So that is what law says. But ethics is not like that. No one is seeing you. No monitors are kept. No cameras are kept. Then also you behave in your own consciousness. That is what the ethics. Why it is more important in nursing means most of the time we spend with a patient who is not actually verbose. Sometimes it's a comatose patient. Sometimes the patient is not in consciousness. Sometimes the patient is psychiatric. So many incidences, nurses are the only spokesperson for the patient. That's why ethical principles are very, very important for the nurses. Often, actually the last slide you can see that one word, often laws and ethics are always in conflict. So even the child is sustained with the injury, the law says the person who has actually committed crime is not a convict because there is no evidence, because law always needs a evidence. But ethics, there is no need of evidence, only your mind and the consciousness. Your own moral principles will speak in this particular situation. Organizational perspective. So wherever institution, whichever institution we are working, we will be having motto of our institution. What is your motto of the institution of yours? You know? Okay, next time you should know what is the motto of the institution. So that will prescribe the duty to you. Whichever organization we are working, love to serve, like that way there will be some motto, no? So that organization motives that is only a guiding principle for us to work with ethics. Individual perspective. I told you are calling your parents. Sometimes when you do a mistake, your consciousness pricks. How it is happening? How it has developed? That knowledge of ethics, how it is developed? Anyone? From small age, how did you come to know these are things are right, these are the things are wrong? Yeah, your parental upbringings, okay? Yes? School, your siblings, your college. So all those things actually made from childhood to adulthood. You have gone through so many phases and you understood that these are my ethics. So that is what Kohlberg has given your moral development. Moral development happens from the childhood to the adulthood. So when you were very small, when you did a mistake, what was the thing your parents did? Punishment. They will give small punishment, no? If you spill water, they may say you to dry the place. Or else you are beating your sibling. They will say that next time you will not be encouraged for this. Like that law, that punishment has been given, by that way you have learned this is what correct, this is what wrong. But now, if you are spilling a water or else you are hitting somebody, the same method will work. Next time you should not do it. Let the patient die. Next time you should not do it. Whether it will work? No, we have grown up. We know what is right and wrong. So that is what, yes. So first one, when we were small, only avoiding punishment was the first thing. So when you did a mistake, your parents may give you a small punishment. That to make you understand about your mistake. Second, it's becoming a self-interest. When you are mingling with your peer group, so you will be, it's like a self-interest that doing a mistake. Last time mother said, you are not supposed to do, you will get a punishment. Now I learned that one by out of my self-interest. Then goodbye attitude. I want to, in a classroom and all, no, small kids, LKG, UKG, or else 5th standard, till 5th standard, it's very easy to teach. So whatever you're telling, they will say, they believe. In a college, if you're telling, they will not believe. Okay. So that is, they want to behave like a goodbye attitude. I am a good boy. Like that way. If you're giving a credit of good boy, the 5th standard kid will do everything paka. But college student, if you're saying goodbye, I know. You are expecting something from me, I'll not accept, like that way. Law and order morality comes when you are becoming 10 to 13 years. That's that time only they are introducing the road rules, how to behave in a community, how to live with the society, all those things. And social contract. So when you're becoming big, then you understand that without telling anything, you start following some of the more things which will make you to be always right. Okay, if you're doing wrong thing, always it's bricks. Then that is becoming your life principle. So the person who has lived always with a convict or else with a maybe a group of gangsters. So what the person will think? The gangster, whatever they are doing are correct. Okay, the same way the child who is grown up in a very good house where the rules and regulations were there, where the punishments were there, the kid may say that what I should not hurt others, I should not harm others, like that way the kid will think. So that is what the principle which makes, and all through your life from the childhood to the adulthood, you are learning some of the principles, which is the guiding thing for your ethics. So this is what the main topic here. So ethics, legal and prudent. Prudent is your knowledge, what you learn from a books. So if you want to have a skill of initiating an intra-cat, you need to study well and you need to initiate the IV line well. What is ethical? You are supposed to do it in this way only. So that is what the ethical. And legal. Legal means it's must. Sterile procedure should be followed. There is no other thing. You are supposed to follow a sterile technique to give an IV line. So when you are initiating an IV line, intra-cat, so that needle has been broken, but your in charge will not give you a second intra-cat. So because of that, what you're doing, somehow I adjust and put next duty sister, let her do whatever she wants. So that is not ethics. So better get the scolding from your senior and you inform the intra-cat is broken. So that is what the ethical. So ethical principle, the governing principles in nursing practice are in a healthcare setting, we can say that autonomy, beneficence, efficiency, justice, veracity and fidelity. So these ethical principles are very, very important. So you can say that these are the 4 pillars of medical ethics, we say, and autonomy, beneficence, justice and efficiency. Apart from this 4, we have 3 more, that is what? Veracity, fidelity and integrity. Okay. So autonomy, recognizing the individual right to self-determination and decision making. If at all the patient is not accepting to participate in your research project, you are going and informing a patient that this is what the project happening, a new medicine, so we want to involve you in this particular project. The patient is telling no. So what will you do? Without informing the patient, strike off, and you just enroll the particular patient for your study. Whether it's correct? No, you are taking the decision for the patient. No, it is not correct. Let you give a choice to the patient. So the patient feel the patient is having autonomy and the patient can participate in the study. The way you are explaining the patient will participate. And beneficent, acting for the good and welfare of others, always doing a good to somebody. So when you are a nurse for your patient, always think good for your patient. So if at all a study procedure is happening, you can say that in this particular study, maybe 100 people are enrolled, 1 or 2 will be getting this one I am explaining to you. But 98% of the people will get only good out of this study. So like that way, you are supposed to always for your patients good, not for any harm. So efficiency means acting in such a way to prevent harm to others or inflict a minimum harm possible. So you know that this particular procedure, maybe you are giving a patient an ECT or a contrast CT scan if you're doing. We know that contrast CT when we are actually doing for a patient, some patients are allergic to the contrast. We are supposed to inform the patient. Because this is very important, the study, the procedure is very important, but there may be some allergy to you. That is what you are informing about the harm and not doing any harm for the patient. Okay, without informing if you're doing actually, sometimes if the patient is having allergy, we may not know. So we should ask for that. So that is what the thing. Then comes justice. Acting in fairness to all individuals, treating others equally, showing all the individual same degree of respect and concern. You cannot discriminate any patients by the color or anything, or else religion, caste and nothing. So you need to provide the care to everybody and you need to treat equally everybody, the justice. Even you want to include some people for your study because this is a good medicine, I will include only my known people. I will not include these people because this is a very good study. So I will include everybody from my loved ones. That is not justice. So give them equal opportunity. Everybody get the chance to participate in that particular thing. That is what justice. Veracity is being truthful, trustworthy, accurate in all interaction with others. Nurses supposed to have this quality very much because you are going to be with your patient, you know better about your patient. Most of the time, the patient is not verbose, but you are going to be the spokesperson for the patient. So, veracity is very, the patient should feel, I can trust the nurse, so I can tell everything to the sister like that way. And fidelity, being loyal and faithful to individual who place trust in the nurse. You are supposed to be loyal for your patients. And integrity, acting consistently with honesty and basing actions of moral standards. So your behavior should be consistent, not like one patient you like. So you will say, yes, we can do the procedures tomorrow. But one patient you don't like, no postpone of procedure. Today itself we are supposed to undergo. No, your behavior should be consistent with everybody. You should behave in the same manner. So ethical frameworks, we have so many frameworks. Utilitarianism means moral rightness of action is determined by the consequence. So if I do this one right, I'll get a benefit, like that way. That is utilitarian framework. So most of us will be this one now. Means if I do this one, I'll get. So if I do good to others, God may give me the blessings, like that way. Duty-based. Duty-based means when you are on duty, the duty book has some rules and regulation. You are supposed to follow that one. Everybody supposed to come to the college by 8 o'clock. Okay. But your class is at 9:30. But everybody comes by 8 o'clock? Because it's rule book written? 8 o'clock? Even though I don't have any work from 8 to 9:30, but still I come to the college by 8 o'clock because it is my job demands. Okay, that is what it is, duty based, this one or that ethics. And virtue ethics, action consistent with a certain ideal virtues. If I carry out this action, what kind of person will I be? So when you are going in the road, okay, that is a no entry, but that is not a very peak period. It is not a very, there is no much crowd. So let me go. So that is what the virtue ethics. No, I will not go because my child is sitting at the back. If my child is seeing this, what my child will learn from me? Okay, that is what virtue. So if I do this one, what will happen? What kind of person will I be? So that is what the virtue ethics. Then principalism, using the principles, ethical principle instead of theories to evaluate your action. We have read 7 principles. So those are the principles we are supposed to use whenever we are giving care for your patient. Moral ethical dilemma, sometimes 2 or more clear principles apply, but they support inconsistent course of action. It may be a mother is telling, I don't want to vaccinate my child because my child, I don't have a good opinion about the vaccines. Always we'll have a dilemma, whether to vaccinate the child, because vaccine preventable illnesses are present. So in that time, the child will be missing and the child may get the disease in the later stage. Moral uncertainty and conflict, when the nurse is unsure which moral principle to apply or even what the problem is, common to the new nurses. So mainly the new nurses will have this problem, moral uncertainty. And moral distress, when the nurse knows the right thing to do but organizational constraint keep them from doing it. So the person has come from a head injury, the duty personnel are there and they know that there is a bleed. Okay, they have taken the patient for CT scan and MRI, they found there is a bleed. But their hospital says that without paying the bill, you cannot give the report to the patient. So that is a moral distress for the person who is working there. Moral outrage. An individual witnesses an immoral act by another but feels powerless to stop it. The same incident we can say that. So we know that the patient is having a bleed. The patient need to be operated within some time, but because the patient did not pay the bill, so we cannot give this one. So that time we will undergo some of the outrage. So that is the thing. I am not going in which one is correct, which one is wrong. Okay, that is your own ethics thing. So list of patients' rights in India. So before we are going to care for our patient, we need to know the rights of our patient. How many of you know the rights of your patients? Very common, but still we are not following in India much. How many rights we have? 10. That is for giving the medicines. I am saying about patients' individual rights. There are 17. Okay, and psychiatry though, they have a different set of patients' rights. Now it's very advanced, and whatever act they have given in 2017, it is a patient-based act. So most of the time it supports patients, not the healthcare providers. So we have 17 rights. I'm not going in detail, just a quick review. So right to information. So what for I have been admitted, I should know. And write for the records to and reports. If at all any investigation has been done, I should know the report. Even though you feel that I will not tolerate that report, then also I have a right to know. Right to emergency medical care. You basic medical care. I am not saying you are putting a patient in ventilator and ventilator charge also bared by the hospital. Not like that. Yeah, basic emergency treatment should be given. It's a patient's right. Okay, right to health, in that it's coming. And right to informed consent. Any procedure you are performing on a patient should be informed to the patient, and you need to get a consent. Right to confidentiality, privacy and dignity. Maybe a very famous person is getting admitted in your hospital. Immediately you're going and telling in WhatsApp everywhere, hey, this famous personality has come for the admission. I have seen, I have taken a snap. Like that way, no. Okay, they have a confidential this one, and privacy and dignity to be maintained. Right to second opinion. If at all the patient feels that my doctor is not actually giving a proper treatment, I want a second opinion, they can take a second opinion. Right to transparency in rate. Some hospitals, it has happened in this one, when I admitted my father to one of the private institutions, they have clearly given, madam, if you want, we have a 3 rate system. So if you are going with this one, your rate will be this. If you are going B category, you are going with this. So transparent rates. So they have clearly given me the advice that whichever you want to choose, you choose. So these are the things. When I asked what is it, they have told that ICU charges are same. Okay, maybe 40,000 per day, like that way means. Once you are moving out of the ICU to a ward, the charges will be like, if you're choosing a category A, ICU charges will be revised. If you're choosing category B, ICU charges will be revised. If you're choosing category 3, ICU charges will be revised. So like that way, there should be a transparency in rates. But the transparency, I liked it. Okay, then I went for the, whichever package was suitable for me, I went. So like that way, transparency in rate, which procedure, what is the amount? Because sometimes when you're going to the private institutions, you're going and asking for a PET scan, they will say 17,000. Then if you're saying the doctor has told not to charge for doctor, 12,000. So transparency should be maintained. And right to non-discrimination. Doctors and medical personnel cannot refuse treatment to a patient on the grounds of gender, sexuality, caste, religion, race, place of birth, and illness. And right to take discharge of a hospital or body of deceased from the hospital. During any point in the treatment, the patient free to take discharge or leave the hospital. They cannot be held without the will or kept in the hospital by force. Similarly, the caretakers of a deceased patient have a right to receive the body from the hospital. So this also, it is again with ethics, and we have corporate system and we have government system. So whichever ways it works, but there is a right for the patient. And right to patient education. If at all I have some disease, a new disease, yeah, I'm supposed to be educated about the particular disease. Right to be heard and seek redressal. If at all I feel that somebody is showing discrimination, I want to give a complaint to the hospital management. They are supposed to hear the patient's voice. Right to proper referral and transfer, which is free from a perverse commercial influence. So recently I had a conversation with, when we are, actually I attended ACLS class, so that time I had a conversation with the private medical college doctors. So that time they told, if at all any patient comes, they are not knowing the diagnosis, but they have seen only a small red spot here. They will write Korea and bite and they will send it, seems. And bite also not confirmed, Korea and bite and sending. So write a proper referral and transfer, so the doctor who is sitting in the next to hospital should confuse and get the clear idea about what has happened, like that. So they like the proper referral. So what has happened in this particular hospital and what is going to be going to do in the next hospital, the referral should be a proper one. Right to protection for patients involved in clinical trials, especially when you're involving patients in the research. Most of the PG students, we do research. So when we are doing, all the criteria should be followed. Any clinical trial to be registered in the Clinical Trial Registry of India. If at all you are giving any intervention, you're applying a bomb, then also it's supposed to be registered in Clinical Trial Registry of India. And right to protection of participants involved in biomedical and health research. That is very, very essential. We have a book. 2017, they have given a book, people who are involved in biomedical and medical records research. You have a book which gives the guidelines how to enroll a patient in a research. Right to safety and quality care according to the standard. We have ICN standard as well as INC standards of care. So that's supposed to be followed. So that only ensures the safety. If you're following all the standards of care, then also the patient is having some problem, then you are safe. But if you're not following the standards, that patient safety is in query, definitely you will be caught. And right to choose alternative treatment options if available. The patient is coming with a diabetic mellitus and patient wants to take some herbal medicines. You can advise the patient, you continue with allopathy, but you can, along with that, you take this one, but don't stop, like that way. Right to choose source for obtaining medicines and tests. Source of obtaining means when medicines and tests are prescribed to your patient, it is up to them to decide whether they want to purchase it from this hospital or anywhere. We cannot force them to take it from our source only. So these are the guiding the rights of the patients, which is given by Ministry of Health and Family Welfare, India. Okay. So the Code of Ethics for nurses in India, the nurse respects the uniqueness of the individual in provision of care. The nurse respects the right of the individual. So the 17 rights which we have seen in patient care now, all those things are actually involved in this. As partner in care and help in making informed consents, informed choices. So you are, I don't know, you are the advocate, you are the spokesperson for your patient. So in informed decision making, you are also involved. And the nurse respects the individual right to privacy, maintains confidentiality and says information judiciously. Nurse maintains competence in order to render quality nursing care. And the nurse is obliged to practice within the framework of ethical, professional and legal boundaries. Okay, you should follow these things. Even though we are following ethical principles, your professional standards as well as the law. Everything we are supposed to have it in a balance. Nurse is obliged to work harmoniously with the patient and the healthcare team. So if even you have some interpretation or miscommunication with the health team members, please sit and talk and sort it out, because we are dealing with a human life. Nurse commits to reciprocate the trust invested in nursing profession by society. As a society nurse, you need to know about your societal concerns also. So everything involved. Code of Professional Conduct for Nurses in India, what has been given by our INC. So Code of Professional Conduct, first of all, we need to be a professional responsibility and accountability. As a nurse, I should follow all the professional standards, and whatever mistakes I'm committing, I should take the accountability. But one thing you would have noticed, our Code of Ethics, it is not published in the Gazette. Everybody knows that? If you are taking our Code of Ethics and seeing that papers, it is not published in the Gazette. It is a previous old one only we are following. We have adopted from ICN. ICN means International Code of Nurses and American Nurses Association. That only we are following. Our Code of Ethics is not published in the Gazette. But now our new curriculum is published in the Gazette. Means we are obliged to the law. Understood? So a law can ask about our standards of our care. Before that, it was not like that. That's why any incident happens in a hospital, the patient died, only doctor will be going and giving the witness, or they will be giving. But now nurses are entitled for that. Okay, so when you are practicing your profession, you are supposed to be much more careful. The novice nurses who are started with a new curriculum, your curriculum says that your everything is coming in the Gazette, but not the previous one. But still, the nurses, when you are taking knowledge in forensic and everything, you are accountable for your own activity. Nursing practice. Practice, actually, ethically you practice. Communication and interpersonal relationship is very important. If you feel that something is missed, voice out. This is missed. Okay, if this is missed for my patient, like that, voice out. Then valuing human beings. Every human being is valuable. Our life is valuable. Like that way, your patients also more valuable. And management. Whichever management we are working, we are supposed to follow the rules and regulations of our management, and we should follow our ethical principles also. Professional advancement is very important. Now world is not standing. Okay, every day new things are coming. So what I'll say that in your time, already sir said, we have so much of technological advancement. In your place itself, you can study a new course. You can upgrade your knowledge. So always keep a pace with the newer technology. So that is what the professional advancement. So these are the things actually given by Indian Nursing Council has given the Code of Professional Conduct for nurses in India. So what are the litigations can come when you practice? Duty to care. We have a duty to care. Means as a nurse, I should go and give care for my patient. How I should care for my patient? Because they are paying less, because I'm working in a private. I cannot say like that. I should follow my standards. It is not how much you are paid, how much duty hours you have. You may be doing a continuous duty. You may be just to finish night duty and join for the morning duty. Nothing. Your duty to care means whichever time you are in the duty, you follow the standards of care which you are provided. So that much care you are supposed to give, because the patient not knowing about how much hours you worked earlier or how much money you have been given, they are not going to. So how much, so if you are not performing your duty, because you did a night duty, you joined for the morning duty, you continued morning duty, you cannot sleep in the duty. So that is what the duty to care. So if you are sleeping, definitely somebody can click and send it to the police. Negligence. Negligence in nursing occurs when the care provided by nurse fails to meet the reasonable standard. They didn't say that highest standard. They said that reasonable standard. Means when you are using a syringe and needle for a pediatrics, the same syringe and needle you are using for 10 pediatrics. Is it correct? No, that is a negligence, because you say that I have less needles, I have less syringes. Then you can refuse to give injection. It is not a big thrill. But if you are giving injection and the child is getting HIV or HBsAg, then it is a problem. So that's why negligence per se, you should avoid it. So because of that, the child is having some problem, we are answerable for that. And improperly nursing medical instruments, not administering or logging the patient's medications correctly, failing to follow the physician orders, all those things are litigation, means the law. In front of law, we are mistaken. So what does the thing means? Maybe a medication error. Actually, you are supposed to give the medication in an IM, but you have given in IV. The patient has a serious illness. I'll give an example. It happened in our hospital. She was a novice nurse. She was giving there was an IV three-way connector connected in the hands. The same way from the abdomen, there was again one more three-way connector. She has connected the jejunastomach feed to a IV line. But it was identified within fraction of minutes and the patient was saved. But she accepted, yes, I did a mistake because I was seeing that three-way connectors are there. I thought this is the one I have connected. Then the hospital system, we have changed that jejunastomach feed should not be connected with a three-way connector. You should have a fitting to the whichever that fluid, this one. We have changed the connector. So the system has changed because of that one negligence. But it was not intentional. Law also says negligence is not intentional. Malpractice, this type of negligence refers only to professionals like us, as anyone can be negligent. In many courts, the term negligent and malpractice will go hand in hand interchangeably. There is a professional distinction. I told an example, no, three-way connected, because two three-way connectors are connected. The child has connected with means first year student, connected the jejunastomach feed to a IV fluid, like that. Wrongful death, about 100,000 people die every year because of medical mistakes, most of which are preventable. A finding, a wrongful death occurs if the court find that negligence led directly to the death of a patient. But I told no, our code of ethics is not coming in the gazette, so nurses are not going and standing in the court. But in future, we are not spared. We are supposed to be standing for our unlawful, or else we didn't follow the standards, we'll be standing in front of the court. And defamation, if a nurse speaks or writes negative, derogatory statements about a patient, if the patient is a public figure, then finding a defamation requires that the statement be false, made with a malice. You know that our Chief Minister, former Chief Minister Jayalalitha's death, Madam had idli like that way, so many things have been written in the media, and after that, when Madam was no more, then the problem arises. So that is what defamation can come for the nurse who practiced that time. Assault and battery, it is unlawful, and we can say this is intentional. Assault and battery is an intentional tort. So an act that causes patient to fear harmful and offensive conduct such as through threats. And battery, the act is resulting in actual direct harm. Maybe the patient you don't like, or the patient is a enigmatic figure for you. The patient has come and admitted under your care, so you are threatening the patients. Hey, I'll punch you. Otherwise, I will give you an HIV injection to you. Otherwise, you are doing, I will use the needle which is actually broken. So all those things are violating your, this one. You are using your power and threatening a patient. So that is called assault and battery. And loss of consortium. If a negligence of an act of a part of a nurse results in negative effect on patient's relationship with others, the nurse may be found responsible. Maybe a famous personality is getting admitted in your institution and somebody else is coming and giving care for them, not the wife. So you are telling to the newspaper that actually the actor's wife did not come, only the keeper came. That's all. That is called loss of consortium. You are not supposed to give those type of information to others. Okay. And emotional distress, if a negligent or intentional act is considered erroneous or outrageous, the patient may make a claim of emotional distress. Maybe you are telling this particular actor has a VDRL. You are actually giving a care for the actor, and you are going and giving the media that the patient result I have seen, this is VDRL. So it can cause emotional distress for the particular person. So they may, this happened when we were student. When we were student, that time and all, no, HIV, we will be writing the patient HIV positive. In a big cardboard, we will write and stick over the patient's bed. The very next day, it happened that they went and tried for suicide. The whole family. I'm saying about 98, 99, okay. So then only the laws and reformations happen. Now only we can write retropositive. That also we should not write it in the board. Okay, it's inside you can write the report. Other than that, you cannot tell. Even blood transfusion you are giving means you have taken blood from a patient and that blood found to be positive. You cannot call the person and tell your blood is positive. That is against his blood transfusion ethics. Because next time nobody will come to blood transfusion, means blood donation. If you tell people are coming for blood donation and you are telling your blood is positive for this one, you discard the blood. Okay, you are not supposed to call the person and inform. If you are informing next time when I am going for the blood donation, what I will think? And these people check for HIV, I will not go and give. Okay, so like that way, emotional distress, also a litigation. Identify, you can identify. Failure to follow standards of care comes in which one? Students? We taught this one. Failure to use equipment, failure to communicate, failure to document, failure to assess and monitor, failure to act as a patient advocate. What is the litigation will come? Yes, any one thing you can say. Nothing wrong, nothing right. It comes in the negligence and malpractice. Okay, it is unintentional because anytime failure to follow standards of care because you are in emergency, you didn't wear a glove and you started giving medicine. Okay, standards of care, universal precaution, you are supposed to use a glove. There was an incident happened in my institution when I was studying masters. The nurses were actually protesting. They came to the nursing officer, means CNO's office, and they were protesting that you didn't inform that the patient was having HIV. Is it correct to protest? The patient was having HIV, you didn't inform me? No. Because you are supposed to follow universal precautions. You wear a glove and treat every patient as a potent infector. But that was not happened. So they are told, it is your fault, please go back. It is not our duty to inform the patient is having HIV. You are supposed to follow the universal standard. So it is negligence and malpractice suit will come. Identify this punching, pushing, kicking, I told. Assault and battery. Okay, this situation you cannot force any patients like this way. And any enmity you have towards patient also, when the patient is coming to hospital, he is your patient. You cannot inject anything and make them die. Ethics in professional practice is given by American Nurses Association Code of Ethics, applies to all nurses in all healthcare settings. Ethical principles agreed upon the members of the nursing profession, set standards of conduct and behavior for nurses. You can visit ANA Ethics website. Based on this only our INC Code of Ethics has been formulated and we are following also. The key points are primary commitment into a patient, that is individual, family or community. Demonstrate compassion and respect for all patients regardless of the patient's status. Promotes the health and welfare of the patient. Accountable for individual practice. Maintain and increase own knowledge base. Always we are supposed to update our knowledge. Works to improve the healthcare environment for providers and patients. So they say that 4 fundamental responsibility every nurse should have, that is promoting health, preventing illness, restoring health, alleviating the suffering of a patient in any situation. A terminally ill patient comes, you know that there is no prognosis, but still the day you are carrying the patient, you are supposed to give a standardized care. Because I have heard, in my personal opinion, again I am bringing it, one day I was in a neurosurgical ICU for my own loved one, and the other patient, the next patient was actually 3 times underwent brain surgery. There is no hope for the patient. The patient is going to die, they are going to declare it today or tomorrow like that way. But the nurse ventilated that when the patient is not having good prognosis, why are they asking me to care? And why are they asking me to give bath to the patient? Is it correct? No. Even after a death, you are supposed to treat the body as with the dignity. So that is against ethical principle. When I heard, I was wondering, how can they talk like that? Even the next moment you are going to declare a patient, then also you are supposed to treat the patient with dignity. And you are supposed to continue your care. That is what the standard of care says. Okay, in a given period of time, if you're a patient, you are supposed to provide a standard care. You cannot say that the patient is not having any hope, why I should care for my patient. Like that way. That is why restore health and alleviating the suffering of a patient. When I was working in ICCU, when a patient came with a cardiac arrest, and patient was on a ventilator for nearly some 10 to 12 days. Patient came out, and when the patient came out, the patient told, Madam, you are the only one who were informing me about the procedure whenever you are performing on me. Because others were telling that, I may not hear, no? So they were coming and giving IV injections, they were pushing everything, but they can hear. Okay, so there where our ethics works. So we should treat them as they are hearing. They will hear. So that is a thing, alleviate sufferings. So ICN Code of Ethics, again, nurses and people, this you would have seen in your professional adjustment. Nurses and people, those in need of care have the primary responsibility of a nurse who must show respect of diversity and cultural differences, uphold the patient's right to privacy and confidentiality, and promote social justice and professional values. These are all those things we have seen in the professional standards. And practice, the nurse must practice responsibly and recognize accountability for action, delegation, personal conduct and provision of care. Where this delegation is very important when you feel means, maybe in a ward of very busy ward, one of your fellow nurses absent or taken leave, one novice nurse is coming. Okay, there is an emergency. You want to collect a blood and send for cross matching. Please don't assign to a novice nurse. Sometimes what will happen, no? Sometimes the blood is sent mistakenly. So inform a senior person, they can send for cross-matching, because this also happened in a ward. So when a novice nurse, means we say that a replacement nurse, when she came inside and when she was sending a blood, the blood was sent mismatchingly and the blood transfusion also happened, the patient had transfusion reaction. Okay, so delegation of work also very important. I didn't do, only my fellow nurse did. No, you delegated the work, so you are also responsible in that particular act. Profession, the nurse must uphold the values of the profession and promote the profession. Co-workers, the nurse must demonstrate respect for the colleagues and collaborate with them in provision of care, but must protect the patient's negligent and impaired healthcare, patients from negligent and impaired healthcare providers. So nurses' rights in ethical situation, I have given small this one. Even sometimes you feel that you will not give care for your patient, you can refuse. I will not care for this particular patient. But the patient is not having anyone else, only you are the duty nurse who are supposed to see the emergency, then you are supposed to work. So that's what they say, nurses has the right to refuse to participate in giving care to a client if they disagree. Maybe a terrorist who is waiting for the this one life imprisonment or something. So you don't like to give a care for the particular patient. So you are saying that it's against my ethos, I will not give for the terrorist. But still, when no one is there, you should treat them as a patient and give care. Okay, so that's what already sir said, no? Accept the patient as he is. And the Joint Commission also requires employees to establish policies and mechanism to address staff requests not to participate in aspects of care. Okay, you are also having a right to refuse in very, very rare situations. Ethical dilemmas will come in most of the ways when you are working in a clinical setting. Maybe the person who is pregnant, history of cardiac problems. So the child or the mother, whom you will save? Whom you will save? The child or the mother? Mother, always mother. Why always mother? Yes. Yes, always mother. Because she lived so many years, okay, 20 years, 21 years she lived in this world. We don't know the outcome of the baby, which is going to come out. So better always we save the son. But in America, there is a pro-care activist. So what they will say means, there is no abortion. Any baby which with any malformation, they can born in this world. That is what they say. So in that way, always it will be an ethical dilemma. Empirical knowledge and religious belief, ethical dilemmas. I'll finish in 2 minutes. Maybe some 2-3 minutes. So the empirical knowledge versus religious beliefs. Always, when you work in a situation called the patient is refusing a blood transfusion, especially the Jehovah Witnesses, they refuse organ donations, organ receiving as well as blood. So in that condition also, but you are an emergency nurse, you want to treat the patient. So in that, good Samaritan laws, because you don't know the patient is belong to a Jehovah groups, then you can give blood transfusion. But if the patient refuses, patient is conscious and refuses blood transfusion, you can write in the nurse's record, even though the benefit of the blood transfusion has been explained, the patient refused due to the beliefs. So that is where your ethical dilemma activates. Parents refuses to vaccinate the child. Already I told this example. So you need to explain to the family members how vaccination works, how it can prevent the vaccine preventable illnesses. Then also, some parents may refuse to vaccinate the child. So again, our ethical dilemma will act in this. And being honest with versus withholding information. You feel that a very young chap who has come with a diagnosis of terminal cancer, and you don't want to give the information because he's going to join a new career or something, versus withholding information. Being honest versus withholding information. So that also. The same situation I told, no, blood donation. When the patient is donated blood, we will be taking small sample and we will send for the investigations. In that, you found the patient is having HIV positive. You want to save the patient by informing the patient HIV positive, but you cannot give the information because again nobody will come for the blood donation. So that 2 areas, again our ethical dilemma will come. Healthcare needs versus resource allocation. You have 10 patients, but you have only 6 injections available. So allocation versus, so whom to give? So what we will do? We cannot give like randomly we can give. So whoever enrolled first, we may give. So in that method, like that way. So many areas your ethical dilemmas will come. As a healthcare provider, how you are going to take care of that, it's very important. So we have professional boundaries, boundary space between a nurse's power and the client's vulnerability. You cannot, so I told no that 10 people are there, 6 injections only you have. You cannot force somebody that, see, you are not eligible, you go. Like that, you cannot use your power. So you are supposed to, you should not cross your boundary. So what is ethically correct, only you are supposed to follow. And crossing brief excursion across boundaries that may be inadvertent, thoughtful, and even purposeful. Sometimes you cross your professional boundary and patient is asking you to come out for a day. As a family picnic, we will go because you have taken care of me so much. We cannot go like that. Okay, you always follow your professional dignity. Violation results when there is a confusion between a need of a nurse and those of the client. Maybe you are a research, maybe a master student, you want to recruit the patient very badly for your research. The patient is telling no. So in that condition also, need of a nurse and those of the client. It's very, very essential. And sexual misconduct, extreme form of violation, that is seductive, sexually demeaning, harassing, are interpreted as sexual act by a client, also should be avoided. This also comes in our professional boundary. And receiving and giving gifts means sometimes people will, mostly it will happen in the pediatric patients. The patient is sick and you feel that the child is looking very innocent. Sometimes you may cook and get the food to the child. No. Okay, the child may be having hospital food, they'll be having calories calculated. So how you are cooking and all those things, it is not. So receiving as well as giving gift is not allowed. And coercing patient, using your power and overpowering a patient. No. So maybe patient is in anesthesia table. That time you go and asking, we are doing one study, can I take one sample from your, this one, means maybe abdominal tissues like that way. If you're asking in that time, what the patient will tell? Yes, otherwise they will not do surgery on me properly. So like that way, you don't use your powers during that time. And showing favoritism, giving more attention to one patient, that is also not correct, that already we have discussed. Sharing in personal information and posting in social media, taking a selfie with the patient, all those things are big no, because we are violating the boundaries. So what is the nurse's challenge in this? Be aware of your own values and beliefs and the patient's beliefs, everything. Be cognizant of your own and patient's culturally negotiated behaviors. Be observant for the behavior of the other professionals, because sometimes the other professionals may mistake and you be part of that. Please don't do that. So always act in the best interest of the client. That is very, very important. So this is how you need to process the ethical dilemma. So what you are supposed to do, identify the problem, collect the information, state the option, apply ethical principles, make a decision. If you could not make a decision, ask your seniors. Okay, no problem. You ask your seniors and make a decision and act and evaluate. Withholding and withdrawing information, it is possible, already we have this one. These are the issues, again, it's a dilemma worldwide, that is ethical euthanasia means assisted suicide, or else we can say that intentional termination of life. So this, it is debatable. So young novice nurses may not understand this. When you work as a nurse, definitely you will encounter this type of euthanasia and terminal sedation, all those behaviors. Means terminally ill patient, no other treatment will help the patient, but you need to give painkillers. Okay, morphine is given for a terminally ill cancer patients. So how much we can give? Sometimes we may go beyond the dose. Maybe a scheduled dose of 4 hours every 4th hourly, but means 4th hourly means 8 o'clock you have given the dose, 12 o'clock there is another dose. Patient got pain by 11 o'clock. Whether we can give the dose or not? We can give the dose and continue with the 12 o'clock dose also. That is what the new recommendations. So the terminal sedation and assisted suicide, that is not much practiced in Indian this one, because still our law says euthanasia is not very much accepted. It is case based. Case based means whichever case we are dealing, according to the case they will be taking decision with the medical personnel's appointment. So not like that way. So it's under review only still. So we cannot accept assisted suicide as a method of care. And defining death also, universally we have, this is how the death should be declined. The similar way only the nurse also. So in this also we have a dilemma, because sometimes the patient is in a vegetative state. Sometimes the patient is in brain death. So in that situation also, what is the nurse's this one part? So that also need to be in always in ethical dilemma only. So conclusion, know yourself, know your values. So if at all you have any doubt in dilemma, or else you have any ethical query, please ask your seniors and know the facility policy for access to the ethical committee. Maybe you can ask the ethical committee also. Know your responsibility with regard to informed consent. Please, without informed consent, don't proceed. Respect the patient's advance directives. Nowadays we can write our will, how our property can go to somebody, like that way I can write a will, how I am supposed to be treated when I was in deathbed. Do not resuscitate, or else you need to give me bath, not give a bath, or else how you need to do. If at all I'm very ill, don't do anything. Like that way I can write. That is what the respect for patients, advance directives. Thank you. You have any doubts in your ethical as well as anything? We will take the questions later because we have inauguration function.
Thank you, ma'am, for your insightful presentation.
Taking time to rest, renew, and refresh yourself is not wasted time. So recharge and choose what energizes you. Now, let's have a short break for a refreshment, and simultaneously, our third year BS Nursing students, SKS College of Nursing, are here to give a dance performance. So, ladies and gentlemen, put your hands together to welcome our students to make you energetic and enthusiastic for upcoming seminars. It was such a warm and pleasant dance performance. Her steps were adorable. Thank you, Ms. Nandana, for your delightful performance. It is true that a prayer that comes from the heart can move mountains. It increases your faith and brings you closer to God. So I request all the dignitaries to be on the dais. I request all the dignitaries to be on the dais. Also, I request everyone to stand for Tamil Thai Valthu.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் மதனமென திகழ்வரத கண்டமிதில் எக்கணமும் அதில் சிறந்த திரு பிறை நுதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம் வியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Thank you everyone. Please be seated. Brightness and prosperity are the symbols of light. It is a positive force that removes darkness. Now I am privileged to call upon the Chief Patron, Mrs. Sri Vasanta Ma'am, MSc MPhil, the Chairman, SKS College of Nursing, followed by the dignitaries to light the Kuttuvilakku.
I request one person from audience to light the Kuttuvilakku.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति.
Always welcome your existence, which has been devoted to the clear ideals of goodness and happiness. Now, I am honored to welcome Mrs. Axel Janisha Ma'am, MSc Nursing in the Department of Medical Surgical Nursing, to deliver the welcome address.
A very good morning to one and all who gathered here. Myself, Axel Janisha, lecturer, SKS College of Nursing, Salem. I feel extremely glad to welcome everyone to this first CNE state level seminar. And it gives me immense pleasure to be standing in front of you all, that is amongst the most esteemed personalities who have won accolades in their respective field. A woman is not just a woman. She is a warrior, a mother, a leader and a fighter. I would like to welcome our Chief Patron, Mrs. Sri Vasanta Ma'am, MSc MPhil, Chairman of SKS College of Nursing, Salem. I heartily welcome you, ma'am. A leader is someone who holds himself accountable for finding the potential in people and process. That is none other than our patron, Dr. V. Suresh Kumaran sir, MBBS, MBA, HCA, Managing Director of SKS College of Nursing. I warmly welcome you, sir. A leader is one who knows the way, goes the way and shows the way. That is our treasurer, Dr. Sirpi Mani sir, MBA, PhD and Chief Executive Officer, SKS College of Nursing, Salem. I cordially welcome you, sir. Great leaders are not defined by the absence of weakness, by rather than presence of clear strength. That is our organizing chairperson, Professor P. Selvaraj sir, MSc Nursing, PhD scholar, Principal, SKS College of Nursing, Salem. I warmly welcome you, sir. A woman is with a plan is unstoppable. A woman with a purpose is extraordinary. She is none other than our organizing secretary, Professor Christy Kamala ma'am, MSc Nursing, PhD scholar, Head of the Department in Medical Surgical Nursing, SKS College of Nursing, Salem. I heartily welcome you, ma'am. Reality does not exist without the observer. It is the observer who creates the reality. I would like to welcome our TNNMC observer, Mrs. Kanaka Durga ma'am, MSc Nursing, OPG Department, Gokulam College of Nursing, Salem. I warmly welcome you, ma'am. Educating the mind without educating the heart is no education to all. I would like to welcome our resource person, Professor Dr. Kavita ma'am, Professor Dr. Badmavati ma'am, Dr. J. Maharnisha ma'am, Mrs. Intumadi ma'am, Mrs. Bonipas Bernardo ma'am. I welcome you all. Delegation is the act of giving power, authority, and personality to others. Now I am delighted to welcome every delegates to our first CNE program and extend the warmest welcome to those who have traveled from distance. Teaching is the profession that teaches all the other profession. I pleasantly welcome every faculty present here. You were born to win, but to be a winner, you must plan to win, prepare to win, and extend to win. I would heartily welcome every student present here. It is indeed a pleasure to have you all today. You are looking forward to meet you here and share your views with us, because educating and learning open a new door to world of progress. Once again, I welcome you all for our first CNE program. Thank you.
Thank you, ma'am, for welcoming everyone in a warm and heartfelt manner. It's one thing to be a boss, another thing to be a mentor, but a completely different thing to be a leader. We are proud to be led by a boss, mentor, and a leader like you. It is one and only our Honorable Managing Director, Dr. V. Suresh Kumaran, sir, MBBS, MBA, HCA. I welcome you, sir, to deliver a presidential address.
Good morning, everyone, and thank you for having me here. Today's program is continuing nursing education, just like we doctors have continuing medical education. Why do we have such programs? What I tell my students whenever, every time they join a college every year, and we have the lamp lighting ceremony, I tell them that they are now a professional. And a professional has to keep updated. Just because they've studied 4 years of college and when they graduate, I repeat the same message, it doesn't mean you've done studying. Every field has exponential increase in knowledge that comes up every year, and medicine is no different. So every year there's something new and something old is stopped. So unless we keep ourselves updated, we also get outdated. So such programs are essential not only for students, but also practicing professionals. If you are a medical professional, you are a student for life. So this is in the same spirit. I am encouraged to see such a good response from not only colleges, but hospitals in and around Salem. And unfortunately, the number of slots allocated to us filled up so quickly that we were not able to satisfy the actual demand. The other important component of these such programs is to learn what they don't teach you in college. College has a very strict curriculum, and you write your exams, but you come here to learn from seasoned professionals, people who have been working in hospital environments in the field with several decades of experience. So even when we came in, there was a talk on ethics and nursing ethics. So this is not something that you learn by theory. It is by practice. You see these cases in real life, and then you understand beyond what you learned in the books. So like that, you come here to learn from their experience and take it back with you so that you can become a better professional. You take it back to your institution and implement it, or if you encounter such a scenario, you will be prepared to deal with it in a professional manner. So once again, welcome, and I hope you find the whole day fruitful and knowledgeable. Thank you.
Thank you, sir, for your inspiring words honored on us.
To honor our second speaker, I request our Chief Patron, Mrs. Sri Vasantha Ma'am, to present the certificate and the Patron, Dr. Suresh Kumaran Sir, to present the memento. When you are thankful for what you have, you are always rewarded with more. I would like to invite our organizing chairperson, Professor P. Selvraj Sir, to deliver the vote of thanks.
So good morning to all gathered here. On behalf of the organizing committee, I extend my heartfelt gratitude to our esteemed chairman ma'am for gracing with us for your presence and inaugurating the seminar program. So your unwavering support and encouragement have been instrumental in making this seminar in a reality. Your visionary leaderships and commitment to excellency inspire us all to strive for greater height in our respective field. Thank you, ma'am. Next, I extend my sincere thanks to our managing director. Sir, we are truly honored to have you with us today, and your presence adds immense value to these events. So on this journey of knowledge sharing and collaboration with others, we are confident that your words of wisdom will resonate with each participant and guide us towards achieving our collective goals. Thank you, sir, your presence. And next, I express my sincere gratitude to our Chief Executive Officer for your invaluable presence and continued support, which serves as backbone of all our actions. Thank you, sir. And I sincerely express my thanks to the organizing secretaries for your presence. And thank you for all incredible responses. We are truly overwhelmed by the 150 entries we received. So your enthusiasms and participation have exceeded our expectations, and we are deeply grateful for your support. It is inspire us and to see you such a dedication and passion within the nursing communities. We are excited to review each entry and look forward to the opportunities to collaborate and learn together. So once again, thank you for your overwhelming response for being an integral part of our nursing fraternities. I express my sincere gratitude to all who have supported us in making this event in a grand success manner. Thank you all, and sit back and enjoy our next scientific sessions. Thank you for the opportunities.
Thank you, sir. I request all the dignitaries to be off the dais.
I welcome everyone to the third session. Caring is the excellence in nursing. So be patient with patients who are not patient. I welcome our organizing secretary, Mrs. Christy Kamla ma'am, to introduce about the third speaker.
It's a third session. I welcome Dr. Professor B. Padmavati, Dhanvantari College of Nursing, Namakkal. Her total experience is 23 years. She completed her UG in 1997 in Biomedical College Hospital, KMCH College of Nursing, Coimbatore. She completed her PG in 2005 in Vinayaka Mission Annapurna College of Nursing, Salem. Also in 2017, she completed her PhD in nursing from Adiparashakti College of Nursing, Melmarvattur, Chennai. She awarded by INC in the year of 2019 for the excellency of nursing. She is a multi-skilled personality person. She is an educator, program coordinator, research coordinator, also a guide for a PhD scholar, inspector, observer, participator, author and publisher. She started her career as a nursing tutor, lecturer, assistant professor, vice principal, and currently she is working as a principal in Dhanvantari College of Nursing, Namakkal. Now I welcome Dr. Professor P. Padmavati ma'am to start this session. Welcome ma'am. Thank you ma'am.
Thank you for your introductions. A very warm good morning to one and all gathered here this auspicious occasions. It's a great opportunity for the management, principal and the organizing team and the Tamil Nadu Nurses and Midwife Council has great opportunity for the nurses as giving into these type of CNE program to updating our knowledge. So my topic is evidence-based practice. We all know the evidence-based practice. How this evidence-based practice we are transforming into the nursing excellence. So the symbol which indicate that evidence-based practice. It is nothing but whatever we do, we need a proof with some scientific reasons apply to your day-to-day life. That's it. Whatever we do the work to the patients of our day-to-day life, we need some scientific principles. A simple thing, when we go to the hospitals, we just clean the patient's environment. It is some basic principles. Keep a patient clean. So that which helps to patients free from all the hospital infections. It is also to be a evidence-based practice. How come? The next slide. So what is meant by evidence-based practice in nursing? It's a way of providing nursing care. Who will that? It is guided by the integration of the best available scientific knowledge with nursing expertise. When we give into the nursing care to the patients, the people who have delivering to the care should be knowledgeable, rich in knowledgeable and understand in the particular field. At the same time, she should be responsible. As ma'am said, some ethical principles, we should be responsible on the field of your care. So when we do into the evidence-based practice, there is a weak and the strong. Where it is weak, when we communicate orally or testing some lab test. Just like that, when the patient is coming to the ward, we just giving into the instruction to the patients or the family members and without knowing into the patient assessment, without asking any questions to the patients, we just like that we do into the lab test. These ought to be a strong point. It is not to be a strong point. It is a weak point. We doesn't know that. Without asking any questions to the patients, without throw any questions, you will not get anything from the patients and the family members. So the communicating orally and testing the lab test is not to be a strong point. So what is a good point? Evidence. Search the things and do the work is conducting the research and publish your evidence. As you are the MSc students and so many students are there, when we conduct into the research is nothing but doing into the simple thing is also to be a research. As we said before we are starting into the topic, keeping the environment is clean, will giving into the good conducive environment, will keep ourselves safe and keep ourselves to be rich in that environment. So when we go some functions, நம்ம ரொம்ப ட்ரெஸ் பண்ணி நீட்டாக போகும்போது நம்ம உடம்புக்குள்ள இருக்கிற maybe negative, whatever it may be physically good or psychologically you not feel also, when you look at into the environment, we are happy, right? When I am seeing in this environment, all side you have a hot in. See the hots are pumping like anything. So which is helping or making you to be fresh, right? எஸ், வெளியில் அடிக்கிற வெயிலுக்கு உட்கார்ந்துருக்கிற கூழ் வெளியில் வெயில் இருக்கா இல்லையான்னு நமக்கு தெரியல. கரெக்டா இல்லைங்களா? ஸோ தட்ஸ் டு பி எவிடென்ட். ஸோ வி ஆர் கிவிங் இட் த பிக் கிளாப் டு த ஆர்கனைசிங் கமிட்டி பிகாஸ் where they are keeping into the good environment and safe environment, clean environment and the good environment. It is not only for the participants or the delegate, it is also to be a resource persons. We are giving into the cool environment, making ourselves to be a cool, right? So that's to be evident. So they find out where they conducted the research and giving into the evidence or published the evidence. That's to be there, right? So this is whenever we giving into the care to the patients, we should be very careful. We are giving into the care to the patients. So here the two sides, the peoples are standing, are telling that, are you sure the new bath technique was an evidence-based practice list? The new bath technique was an evidence-based practice list. The lot of things are there into the evidence-based practice. So this bath technique is giving it to the evidence? Yes, of course. The nurses should critically assess the relevant research evidence, then implement into the high quality intervention to the patients. ஜஸ்ட் ஒரு சின்ன குழந்தைக்கு மேடம் சொன்ன மாதிரி ஒரு இன்ஜெக்ஷன் போடுறதுக்கு முன்னாடி ஒரு சாக்லேட் கொடுத்துட்டு, நம்ம இன்ஜெக்ஷன் போட்டால் குழந்தை சாக்லேட் மேலே கான்சன்ட்ரேஷன் இருக்குது, நீங்கள் போடுற இன்ஜெக்ஷன் மேலே கான்சன்ட்ரேஷன் போயிடும். மேடம் சொன்ன மாதிரி ஒரு கிஃப்ட் கொடுக்கறதுக்கு பதிலாக அந்த குழந்தைக்கு வேறு ஏதாவது நீங்கள் அட்ராக்ஷன்ஸ் பண்ணுற மாதிரி அந்த நர்சஸ் செய்யும்போது, whenever the nurses is coming to the entering into the particular ward, she automatically smile. Whatever we have a problems also, right? So that's to be evident. It is not, as ma'am said, it is not giving into the receiving any gift or the nothing else. It is evidence. As if that is a nurse's quality. That is ethical principles. So the nurses always critically assess the relevant research evidence to giving into the high quality care to the patients. That's to be evidence-based practice. So what is the evolutions? Who was the first nurse or find out the evidence-based practice in nursing? Good. Another person? Good, sir. Thank you. Another person? We know the people. We know the persons. What is May 12th? See the one person's first find out the evidence-based practice in nursing. How? கிரீமி அண்ட் வாரில் சண்டை போட்டு எல்லாம் தான் பண்ணாங்க. இவங்க எப்படி எவிடன்ஸ் பேஸ்ட் ப்ராக்டிஸ் பண்ணாங்க? Giving into the clean environment to the patients. She proved that when we are giving into the clean environment or all the soldiers, she proved that the 60% of the infection to the 40% within a 10 days, after 7 days, within a 17 days, 22.3% the infections rate was reduced. So she proved that. That is evidence based practice. So she is a pioneer, she is a modern lady, as the first person has given into the evidence based practice in the nursing practice. So what were the evidence she collected? First one is, the patient's health status is directly related to the sanitary conditions. So we keep our patients into the clean and comfortable environment. And second, wash the hands before we are transferring from one patient to the another patient. Always and the days and 1850 and the days, she is telling that washing the hands in the hot water with the soap was effective in removing the most dirt as comparatively washing the hands with the cold water. And one more thing, she find out that maternal morbidity is due to the puerperal fever. It's following the childbirth was high in the hospital birth than into the home deliveries. Because those days we don't have any disposable syringes. We have only glass syringes and we have a reusable catheters. So these are all the things they're telling that the home deliveries as giving into the more evident than into the hospital birth. So these three evidence she find out into the evidence-based practice into the nursings. And was the evidence is published, நம்ம புக்கெல்லாம் பண்ணுறோம் எல்லாம் கண்டுபிடிக்கிறோம், பட் ஃபைனலி இட் இஸ் சிட்டிங் இன் டு த லைப்ரரி, தட் இஸ் அந்த ரேக்கில் வச்சு நல்லா தூங்குது, ஒன்றும் பண்ணுறதில்ல. பப்ளிஷ் பண்ண நம்ம எதுவுமே யார்கிட்டையுமே நம்ம கண்டுபிடிச்ச விஷயத்த ட்ரான்ஸ்லேட் பண்ணுறதே இல்லை. ஸோ விதின் அவர் பீப்புள் நான் கண்டுபிடிச்ச ஒரு விஷயத்த பக்கத்தில் இருக்கிறவங்கள கூட நம்ம ஷேர் பண்ணிக்க மாட்டேங்கிறோம், ஏன்னா ரொம்ப கான்ஃபிடென்ஷியலாக நம்ம வச்சுருக்கோமா. இல்லைன்னா லைப்ரரியில் உட்காந்து நல்லா அது தூங்குது, ஆயுத பூஜைக்கு மட்டும் தட்டி எழுப்பி ஒரு பெரிய பூஜையை போட்டுட்டு விட்டுறோம் இல்லைங்களா. ஸோ ஹவு இட் இஸ் டு பி பப்ளிஷ்ட், ஷேரிங் யுவர் நாலேஜ் டு த ப்ரொஃபஷனல்ஸ், ஷேரிங் யுவர் நாலேஜ் வித் யுவர் ப்ரொஃபஷனல்ஸ், மேபி த கான்ஃபரன்ஸ், lot of journals. Previously there is no journal at all. Now lots of journals are the free of cost. As UG students with the free of cost, lots of journals are there to publish your whatever simple thing. Don't want to go far into the advanced thing. ஒரு சின்ன ஒரு ஃபீவர் ஒரு பேஷண்ட்டுக்கு நீங்கள் 10 நாள் ஒரு கேரை கொடுத்து அதை கண்டுபிடிச்சி நீங்கள் பப்ளிஷ் பண்ணவே யூ ஆர் த ரிசர்ச்சர். Yes, our day-to-day life, whatever you practicing in your hospital setting, that's to be implemented in your patients, or not to be published. At least, whatever you find out from the one patients, that to be implemented to the another patients. Maybe the patient which be one patient to another individual will be differ, but to be applicable to the patient is will get into the knowledge. When you are putting anything to the applications, you will get into the knowledge. Right? Simple examples, I tell you the evidence-based practice. As your organizing committee people has listed 8 speakers. Right? 8 speakers unga brochures la irka. So how they are selected these people? அவங்க வந்து இவங்கெல்லாம் நல்லா படிப்பாங்க, நல்லா பண்ணுவாங்க, ப்ரெசென்ட் பண்ணுவாங்க அப்படின்னு ஒரு 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 குறிப்பிட்ட போக்கில் ஒரு லிஸ்ட்டை போட்டாங்க. கரெக்டா? சாயந்தரம் 5 மணிக்கு போகும்போது when you are giving into the feedback, then your organizing committee have a motivation to conduct another CNE program of your professions. Okay, இந்த 8 ஸ்பீக்கர்ஸுமே நம்ம செலக்ட் பண்ணவங்க ரியலாகவே they are taken the effort to give your knowledge. So அந்த விஷயத்துலேருந்து நம்மளும் லேர்ன் பண்ணிக்கிட்டோம். Right? That's to be evidence. We don't want to go for the பெரிய பெரிய புக்கெல்லாம் எடுத்து எவிடன்ஸுக்கு தேடவே வேண்டாம். This is to be evident. These 8 people has given into the good knowledge to your life. So this is a day, is a good day for you. You are giving into the rich knowledge, and end of your sections you are getting the things. That's to be evidence-based practice, right? Yes. So, was the evidence is published? Yes, of course, she published. The book is known as Notes of Nursing in 1859. Whatever the experiment she find out, she published the books. Where the published evidence is utilized into the practice? As I said, நம்ம கண்டுபிடிக்கிற விஷயத்தை பம்பளவே இல்லை, பட் இவங்க பப்ளிஷ் பண்ணியிருக்காங்களா? எஸ், அஃப்கோர்ஸ். See the look at into the picture, the before, how the patients are lying into the one place. இந்த பிக்சர்லேயும் அந்த பிக்சர்லேயும் உங்களுக்கு டிஃப்ரென்ஸ் தெரியுதா? எஸ், 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 அஃப்கோர்ஸ். She has given into the whatever she experimented, applied to the patient. Right? Yes, she published. She utilized their practice into the day-to-day life. Due to considerations was given to improve the sanitary condition of the hospitals. To improve the good environment to the patients, improve the sanitary conditions of the hospitals, so the patients are looked into the good. Next, was the published evidence utilized into the practice? Yes, I said the maternity and the hand washing practice. Nursing was the best practice guidelines in the nurses at the time. So for transferring from the one patient to another patients, they used the hand washing technique. Now only the term is universal precautions. Previously, there is no word like that. So, they practice the hand washing technique. When they are conducting into the delivery, they used into the hand washing technique practice. They use the syringes, sterilized. Sterilized is nothing but they are putting into the hot water, clean all the articles before they are using into the next patients. So they of course they are utilized into the practice into the daily life. Hand washing was also taken into the due consideration to attention among Indian nurses. Next, where the published evidence again as a result was used to implement changes in the organization of midwifery services and save the women's life from the puerperal sepsis. Whatever she find out into the first previous slide, she has applied. What was the older practice and what was the new practice? Yes, previously நீங்கெல்லாம் பார்த்திருக்கவே மாட்டீங்க, பட் நம்மெல்லாம் பார்த்திருப்போம். மேம் நீங்கெல்லாம் பார்த்திருப்பீங்க இல்லை சார்? when we was there into the GH, கண்டிப்பாக ஒரே ஒரு நீடிலையும் ஒரே ஒரு சிரிஞ்சையும் மட்டும் கொடுத்துட்டு அந்த வார்டில் 40 பேஷண்ட் 60 பேஷண்ட் படுத்திருக்கும். 60 பேஷண்ட்டுக்கு ஒரு ஸ்டெர்லைசர் இத்திலூண்டு பாக்ஸ் தான் இருக்கும். இவ்வளோ தான் இருக்கும், ஒரு குட்டி பென்சில் டப்பா மாதிரி தான் இருக்கும். ஒருத்தி எங்கள் கூட வரவங்க பிடிச்சிட்டு போகணும், நாங்கள் கூடயே போயிட்டு பேஷண்ட்டுக்கு குத்தி 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 எடுத்துகிட்டு வந்துடணும். ரைட், இட் வாஸ் தேர் இன் டு த ஓல்டர் ப்ராக்டிஸ். தட் இஸ் கிளாஸ் சிரிஞ்சஸ் அந்த நீடில்ஸ். ஒரே ஒரு நீடில் தான் இருக்கும். நீடில் கூட நாங்கள் ஒன்றும் பண்ண முடியாது. ஒரே நீடில் தண்ணிக்குள்ளே போட்டு 2 நிமிஷம் எடுத்துகிட்டு வரணும். அதுக்கப்புறம் கொஞ்சம் நாட்கள் வந்து when we was there into the MSc அந்த நீடில் வந்து பர்ன் பண்ணுற மாதிரி ஸ்டிக் அதை உடைக்கிற மாதிரி அப்புறம் கொடுத்தாங்க. இப்போ அதெல்லாம் இல்லவே கிடையாது. நீங்கள் எடுத்து கீழே போட்டிங்கன்னா மறுபடியும் போய் இன்னொன்று எடுத்துகிட்டு வந்துக்கலாம். ஒரு சிரிஞ்சை ஓப்பன் பண்ணும்போது டக்குன்னு நீ கீழே போட்டிங்கன்னா அதை நீ யூஸ் பண்ண மாட்டேன். கீழே தானே போட்டிருக்க அப்படின்னு யூஸ் பண்ண மாட்டேன், கொண்டு போய் டஸ்ட்பினில். பிகாஸ் யூஆர் ஆல் ரிச் பீப்புள், நாங்கள்லாம் புவர் பீப்புள். அதனால நீங்கள் ரிச்சில் இருக்கீங்க, நாங்கள் புவரில் இருக்கிறோம். கரெக்டா? எஸ் ஆர் நோ? ஆமாவா இல்லையாம்மா? நீங்கள்லாம் ரிச் பீப்புள். ஏன்னா நீங்கள்லாம் பேஷண்ட்டை தொடும்போது ஈவன் யூ ஆர் டூயிங் இன் டு த பெட் மேக்கிங். மேடம் க்ளவுஸ் தரீங்களா மேடம்? பெட் மேக்கிங் பண்ணுற ஸ்டூடெண்ட்ஸை கேட்பா க்ளவுஸ் தாங்க மேடம். கரெக்டாக இல்லைங்களா மேடம்? பெட் மேக்கிங் பண்ணுறதுக்கு எதுக்குமா க்ளவுஸ்? மேம் ஜிஹெச்சில் இருக்கிற மேம் பெட்டெல்லாம் ரொம்ப குப்பையாக இருக்குது மேம், அதனால க்ளவுஸ் தாங்க மேம். ஒரு பெட்டில் இருந்து அடுத்த பெட்டு போனால் கூட க்ளவுஸ் கேட்குறான். ஸோ யூ ஆர் ஆல் வெரி ரிச். ஸோ ஹவு கம் த எவிடன்ஸ் பேஸ்ட் ப்ராக்டிஸ் இஸ் தேர் இன் டு த லைஃப்? I don't know. But even though you are getting into a lot of infections when compared to our people, you are getting lot of infections because not utilizing the best evidence practice in your personal practice. That is the way you people are getting into the infections, right? So be careful. These are all the olden practice. Sorry. So this is a new practice. Nowadays we have lot of reusable, disposable, the syringes and the catheters are available for our day-to-day life. So it was that the saline as a lubricant for facilitating the easy passage of suctions. Previously we have a open sections. Now it is again into the advanced. You have a closed sections in the patients with the ventilator. Yes, anybody has seen? பேஷண்ட் வெண்டிலேட்டரில் இருக்கும்போது க்ளோஸ்டு செக்ஷன்ஸ் இருக்குது. இப்போ ஓப்பன் செக்ஷனே கிடையாது. முதல்ல ஓப்பனே வி ஆர் நாட் ஏபிள் டு ஓப்பன் இட் த செக்ஷன்ஸ். அது ஓப்பன் பண்ணுறேங்கிற பேரில் ட்ரக்கியாஸ்டமி டியூபையும் சேர்ந்து பிடிச்சி இழுத்துருவா இல்லைங்களா? ட்ரக்கியாஸ்டமி டியூபையும் சேர்ந்து கொடுத்து ரிமூவ் பண்ணிவிட்டு அவங்க வர்றாங்களா சுற்றி சுற்றி பார்த்துட்டு கடைசியில் அந்த டியூபை போட்டு உள்ளே சேர்த்திடுறது. இப்போ யூ நோ நீட் ஆஃப் ஓப்பனிங் யுவர் செக்ஷன்ஸ் பிகாஸ் தட் இட் செல்ஃப் நவ் தே ஆர் ஃபைண்ட் அவுட் தட் இட் செல்ஃப் மேக்கிங் த பேஷண்ட்ஸ் டு பி ஹாஸ்பிட்டல் acquired infections. So now there is no opening. You are stylish, again you are rich, so don't want to open the suction by this. You use into the closed suctions method which helps to improve the patients VAP, ventilated associated pneumonia. So to prevent that, முதல்ல 7 நாள் வந்தது, இப்போ 3 நாளில் கூட பேஷண்ட்டுக்கு வரதில்லை because we are using into the closed sections. That is to be evidence based practice in our nursing life, right? Good. So previously saline கொடுத்துட்டு இருந்தாங்க, இப்போ சலைனுக்கு வேலையே கிடையாது because it is a closed sections, right? Yes. So instillation of traumatic, the patient's cough reflex was always to be elicited. So the study also to be proved that practice increase the patient's risk in for the pneumonia for the possibility of pushing the bacterial formation deeper to the lungs. So how to implement our evidence-based practice to our life? The three components. One is use best external evidence. It is nothing but the scientific research. Second, we should be consider the patient values. Madam previous section la sollirukanga. Patient எப்பயுமே human being நம்ம think பண்ணோம். Third, correlate the individual clinical experience. So whatever we are applying into the one patients to the another patients to be applicable, to be compared, to consider before you applying into the next patients. So these components are very, very important for the evidence-based practice. Next, what is the need of the nurses in the evidence-based practice? The first need is have an ethical responsibility to provide the best possible care. So we have 7 ethical principles. Follow the principles before we are giving into the care to the patients. And the second, we are to be accountable whatever the actions happen in your particular environment. Wherever you are. ஒரு யூனிட்ல நீங்க இருக்கீங்க அப்படின்னா you should be accountable. இல்ல நான் செய்யல அப்படின்னு எப்பயுமே சொல்லாதீங்க. Oh, you done a mistake, apology it. That's a good way of learning the things. That is a good way of learning your things. So be accountable whatever you done in actions. That is very important for the nurses. Second, are you placed to provide the better care for the less money for the more people. So always think that patient is a patient. Don't think that this is a rich patient and this is to be a poor patients. Equal care to be equal opportunity to the patients. And the fourth one is you have delivered the innovative patients care using the most current healthcare findings. What is innovative care? Now so many technologies are there. இங்கே உட்கார்ந்த இடத்துல இருந்தே ஃபாரின்ல இருக்கிற கண்ட்ரீஸ்ல இருந்து ஒரு டெக்னிக் பண்ணினானா அப்படின்னா ஆன்லைன் பிளாட்ஃபார்ம் பண்ணி you will find out, you will learn all the things. So innovative patients care is very, very important. So these are all the the need of the nurse while using into the evidence-based practice. There is some steps for evidence-based practice. The 5 questions. Ask proper questions through on your patients. Acquire the knowledge. Appraise. Critically think. 4th, implement. 5th, audit or evaluate. What is that? What questions is supposed to be asked? What is PICO? What is PICO? P-I-C-O? Patient. P for patient. I for intervention. C for Kara. O for outcome. So always throw the proper questions to the patients. Patient வார்டுக்குள்ள வந்தோடனே emergency வார்டுக்குள்ள இங்க wherever you are standing near to the patients. When you are receiving the patients, ask, throw some questions to the patients, collect the proper informations to the patients or the family maybe. If the patient is not able to give you proper answers, get into the informations through the family members, then you go for your next step. That is ask. Always throw the questions, collect the proper informations. Right? நம்ம பேசுகிறதுக்கே காசு கேட்குறோம், ஆனால் பக்கத்தில் இருக்கிற நம்ம ஃப்ரெண்ட்ஸ்கிட்ட மட்டும் ரொம்ப நேரம் பேசுகிறோம், அது மொபைலை வச்சு பேசுகிறோம். என்ன தான் பேசுகிறோன்னு நமக்கு தெரியலை. நான் அதுதான் சொல்லுவேன், அம்மா நீ பேசுகிறது தயவுசெய்து உன் பக்கத்தில் இருக்கிற பேஷண்ட்டுக்கிட்ட பேசு. பாவம் அந்த பேஷண்ட்டு அட்டெண்டர் இல்லாமல் யாருமே இல்லாமல் அது பாட்டுக்கு படுத்துருக்கு, நீ கொஞ்சம் நேரம் பேசினீங்கன்னா அவங்க ரிலாக்ஸ் ஆவாங்க. ஆமாம் இல்லையா? டாக் டு தி பேஷண்ட்ஸ். தட் இஸ் அவர் எவிடன்ஸ்-பேஸ்ட் ப்ராக்டிஸில் ஃபர்ஸ்ட் கொஸ்டின் ஆஸ்க். த்ரோ த கொஸ்டின்ஸ் டு தி பேஷண்ட்ஸ். The second one is acquire. What is acquire? Acquire the best evidence by searching the relevant clinical articles from லெஜிட்டிமேட்டிவ் சோர்சஸ். ஸோ அதுக்கப்புறம் தான் உனக்கு என்னென்ன பொருள் வேணும் பேஷண்ட்டுக்கு கேர் கொடுக்கறதுக்கு. சிம்பிளாகவே நம்ம போவோம், ரொம்ப அட்வான்ஸ்டாக போகவே வேண்டாம். அதனால தான் சிம்பிளாக ஒரு வேர்டை போட்டேன். புக்கில் இருக்கிற வேர்டெல்லாம் நானே எழுதலை, இது நானாக எழுதியிருக்கிற வேர்டு. நீ தப்பாக தயவுசெய்து இங்கிலீஷ் தப்பாக இருந்தால் ப்ளீஸ் அப்பாலஜி. ஐம் டெல்லிங் ஆல் தி எக்ஸ்பர்ட்ஸ். ஏதாவது மிஸ்டேக் இருந்தாலும் என்னை அப்பாலஜி பண்ணிடுங்க. திஸ் இஸ் த வேர்ட்ஸ், இட்ஸ் இட் நாட் இன் த புக்ஸ், ஐ ஜஸ்ட் ரிட்டர்ன் த வேர்ட்ஸ். அக்கயர் த பெஸ்ட் எவிடன்ஸ் அப்படின்னு நான் நிறையா படித்து உங்கள்கிட்ட சொல்கிறதுக்கு பதிலாக அதில் தான், அதனால தான் கிளினிக்கல் ஆர்டிகல்ஸ்னு போட்டேன். எஸ் சார். செகண்ட், அப்ரைஸ். கிரிட்டிக்கலி. கிரிட்டிக்கல்னா என்ன? கொஞ்சம் கூட நம்ம மூளைக்கு வேலை கொடுக்கலாம். Appraise the resources gathered to determine if the information is valid, of optimal quality, then compare to the evidence level relevant to the patients. நீ சேர்த்து வச்சிருக்கிற ஆர்டிகல்ஸு பேஷண்ட்டுக்கு கேர் கொடுக்க கரெக்டாக இருக்கா, ஸ்பஞ்சிங்க்கு என்னென்ன வேணும் அப்படின்னு எல்லாம் எடுத்து கரெக்டாக வச்சிட்டியா? மேடம் சொல்லியிருப்பாங்க, உன்னோட ட்ரேயில் ரைட் கார்னர்லேருந்து இனிஷியல்லேருந்து தொடங்கி 1 2 3 4 5 6 8 9 10 11 வரைக்கும் இப்படி அடிக்கி வரணும்னு எங்கள் டீச்சர்லாம் கையில் அடித்து சொல்லி கொடுத்துருக்காங்க. இப்போல்லாம் நீ ட்ரே எப்படி செட் பண்ணாந்தாலும் நாங்களாம் ஓகே தான் சொல்கிறோம். எப்படி செட் பண்ணிட்டு வந்தனாலும் நீ இல்லை நாங்கள் ஓகே சொல்கிறோம். அப்போல்லாம் நான் ட்ரே எப்படி டீச்சர்கிட்ட தூக்கிட்டு போனேன்னா ஃபஸ்ட்டு எது எடுப்பேன், ரெண்டாவது எது எடுப்பேன், மூணாவது எது எடுப்பேன்னு அதை அடுக்கி வைக்கணும். செல்வராஜ் சார் கரெக்டாக இல்லையா சார்? பிஎஸ்ஜியில் ஜெயசுதா மேடம் இருப்பாங்க. ஜெயசுதா மேடம் அப்போ கேஜியில் இருந்தாங்க. நாங்கள் மெட்டர்னிட்டி வார்டில் இருக்கும்போது வரும்போது அந்த பியூப்ரல் லேபர் ட்ரே வச்சுருக்கும்போது அது இல்லைன்னா அது எந்த காலேஜ் ஸ்டூடெண்ட்ஸ்லாம் பார்க்க மாட்டாங்க. ட்ரே அங்கேருந்து அப்படியே பறந்து போயிடும். இப்போ இருக்கிற நீ ட்ரே கொண்டு வந்து நான் சும்மா இப்படி தட்டுனாவே நீ ஃபோன் பண்ணி என் டீச்சர் என்னை ஹராஸ் பண்ணிட்டா, என்னை திட்டா அப்படின்னு நீ சூசைடே பண்ண போயிடுற. கரெக்டா? ஸோ collect whatever articles you needed which is relevant to the patient's care. Last, implement it. Apply is nothing but implement. Ready for your care. போய் கேர் கொடுக்கறதுக்கு நீ ரெடி ஆயிக்கோ. லாஸ்ட், evaluate. நீ கேர் கொடுத்தது பேஷண்ட்டு இம்ப்ரூவ் ஆச்சா இல்லையா? தட்ஸ் இட். தட் இஸ் எவிடன்ஸ் பேஸ்ட் ப்ராக்டிஸோட 5 steps. புரிஞ்சுதாம்மா? ஈஸியாக தான் சொல்கிறேன்னு நினைக்கிறேன். Okay. Next, how to incorporating or combined evidence-based practice in your nursing. I'll give you 10 minutes. Sorry sir. So, keep up with the research findings. Whatever you finding out into the new things, update yourself. Next, the journal club sections, like now you have into the CNE program, same like you have a journal club sections, and learn to search and retrieve the data from the electronic database. Now lot of electronic உட்கார்ந்த இடத்துல இருந்து நீ நிறைய எடுத்து படிச்சுக்கலாம். முதல்லாம் புக்கை தேடி தேடி லைப்ரரிக்கு ஓடி போகணும். இப்போ டீச்சர் அசைன்மெண்ட் கொடுத்தா no need of going to the library. You sit in your place, you have lot of Android mobiles, you collect all the informations. ஒருத்தர் அசைன்மெண்ட் எழுதுவாங்க, கிளாஸில் இருக்கிற 100 பேரும் அதே அசைன்மெண்ட்டை சப்மிட் பண்ணிடுவாங்க. கரெக்டாக இல்லையா? பேஜை மாற்றாமல் சப்மிட் பண்ணுவேன். அது ப்ரீவியஸாக இருக்கிற தேர்ட் இயருங்க அசைன்மெண்ட் எழுதியிருந்தா அந்த ஃபஸ்ட்டு டீச்சர் என்ன பண்ணுவாங்க, பாவம் பிள்ளை கரெக்டாக தானே எழுதியிருப்பாங்க, முன்னாடி மட்டும் சைன் பண்ணுறாங்க. ஃபஸ்ட்டு பேஜ் டரடன்னு கிழிச்சிட்டு அடுத்த பேஜில் பேப்பர்லாம் ஒட்டி செகண்ட் இயர் மேடம் நான் கேர் பிளான் எழுதிட்டேன், எவ்வளோமா ஃபாஸ்ட்டாக கேர் பிளான் எழுதியிருக்கேன் அப்படி சொல்லிட்டு. ஆனால் நாங்கள்லாம் படிக்கும்போது 24 hours கேர் பிளான். காலையில் கேஸ் எடுத்தால் 4 மணிக்கு டீச்சர் பேக்கை தூக்கங்காட்டியும் பேக்கை கொண்டு போய் டேபிள் மேலே வச்சுட்டு வந்துடணும். 4 மணிக்கு கேர் பிளானை கொண்டு போய் டேபிள் மேலே வைக்கலைன்னா நீ நாளைக்கு வேறு பேஷண்ட் எடுத்துகிட்டு வந்துருமா, நாளைக்கு வேறு பேஷண்ட்டு எடுத்துகிட்டு வந்துருமான்னு சொல்லிடுவாங்க. சரிங்களா? இப்போ கிடச்சிருக்கிறவங்க டீச்சர்லாம் ரொம்ப உங்களுக்கு லக்கி டீச்சர்ஸ். ஸோ த எலக்ட்ரானிக் டேட்டா பேஸ், ஏன்னா நிறைய பிஹெச்டியில் படித்தவங்க கேஎம்சி அந்த சைடு அந்த டைமில் படித்தவங்கெல்லாம் நிறைய நாங்களாம் லேர்ன் பண்ணியிருக்கோம். நிறைய பேப்பர் கிழிச்சு கையில் வாங்கியிருக்கோம். பேப்பர்லாம் அப்படி பறந்து போயிடும். நிர்மலா மேடம்லாம் இப்போ ராமகிருஷ்ணன்ல அப்போல்லாம் ரொம்ப ஸ்ட்ரிக்ட்டு. இப்போல்லாம் மேடமே அப்படி கீழே பக்கத்தில் உட்காந்துடுறோம். அப்போல்லாம் மேடத்துக்கிட்ட உட்கார்றதுக்கு 15-20 நிமிஷம் யோசிச்சுட்டு உள்ளே கூட போகலாமா வேண்டாமா, உள்ளே கூட போகலாமா வேண்டாமான்னு அப்படியே எட்டி பார்த்துட்ருப்போம். மேடம் என்ன பண்ணுறாங்க, மேடம் என்ன பண்ணுறாங்க, அப்புறம் தான் உள்ளே போப்போம். இப்போ தமிழ் மேம்கிட்டயே கோகுலம் காலேஜில் தமிழ் மேம்கிட்ட நாங்கள் எம்எஸ்சி ஸ்டூடெண்ட்ஸாக இருக்கும்போது நீங்கள் போய் கேட்டு பாருங்கள், மேம் என்ன பண்ணுறாங்க. எம்எஸ்சி படிக்கும்போது 2004 எம்எஸ்சி படிக்கும்போது கூட இந்த மாதிரி நிலைமை தான் எங்களுக்கு. ஆனால் நீங்கள்லாம் வந்தீங்கன்னா மேடம் சைன் பண்ணுங்க மேடம், நாளைக்கு ப்ராக்டிக்கல் போகணும். கரெக்டா கரெக்டாம்மா? நீ சைன் போடலின்னா அடுத்த தடவை அவன் ப்ராக்டிக்கல்லாம் பயந்துக்க மாட்டா. நாளைக்கு காலையில் நீ போமா, நாளைக்கு காலையில் வந்து எக்ஸாமினர் சைன் போட்டுருவாங்க, அப்புறமேட்டு நான் அவங்ககிட்ட வந்து சைன் வாங்கிக்கிறேன். பிகாஸ் எக்ஸாமினர் வந்து பாவம் செருப்பில் சைனை போட்டுருவோம் அப்படின்னு எக்ஸாமினர் சைன் பண்ணிடுவாங்க. அதுக்கப்புறம் உங்ககிட்ட வந்து மேடம் எக்ஸாமினரே சைன் பண்ணிட்டாங்க நீங்கள் போடுங்க மேடம், அப்படி தான் கொண்டு வருவான். அந்த மாதிரி பிள்ளை தான் இப்போ இருக்குது. தட் இஸ் எலக்ட்ரானிக் பேஸ். இப்போ இருந்து என்கேஜிங் இன் டு த கிரிட்டிக்கல் திங்கிங் அபவுட் த இஷ்யூஸ் இன் த nursing, and the last organization must create the conducive environment to incorporate the evidence state into the practice. So incorporate your evidence based practice into the nursing. Sorry. Now the next, some of the factors which need to facilitate the evidence based practice in the nursing. What else as a nurse need? We should have the good knowledge. Always update your knowledge. Skill, very important for the nurses. Believe, truth, capability. Tools is nothing but சுத்தியெல்லாம் கிடையாது, நம்மக்கிட்ட இருக்கிற இன்ஸ்ட்ருமெண்ட்ஸ். லாஸ்ட், குட் mentors motivate yourself to be facilitate into the evidence based practice. நல்ல ஒரு கைடு கிடைச்சாங்கன்னா கண்டிப்பாக you will be a good. கைடு கிடைக்கிறது தான் கஷ்டம். The role of technology. Now the technology is improved in the evidence based practice. What are the technology? Now it is the electronic health records. முதல்ல ஹெல்த் ரெக்கார்டெல்லாம் உட்காந்து எழுதணும். கேஷீட்டெல்லாம் எழுதி சாவடிச்சிருவாங்க நம்மளையெல்லாம். இப்போல்லாம் அதெல்லாம் ஒன்றுமே கிடையாது. சிஸ்டமில் உட்காந்து நைட் டியூட்டி போகிற ஸ்டூடெண்ட்ஸ் எல்லாம் ரொம்ப ஜாலி. மேடம் ஏதாவது கேஷ்னா இல்லை மேம் எனக்கு நைட் டியூட்டிலாம் ஃபுல்லு வந்து கேஷீட்டு என்ட்ரு பண்ணேன் மேம். இன்ஸ்டா ஏதோ சொல்லுவா, இன்ஸ்டா போட்டேன் மேடம். என்னம்மா இன்ஸ்டா போட்டேன்னா அந்த 4 லைனை தான் எழுதியிருப்பா. ஆனால் நம்மலாம் அப்போ உட்காந்து பேஜாக எழுதிட்டு போய் அடுத்த நாள் டியூட்டியில் சிஸ்டர் மேடம் கிட்ட சைன் வாங்கிட்டோம். வாட் யூ ஹாவ் டன் இன் டு த பேஷண்ட்ஸ் ரெக்கார்ட். இப்போ அதெல்லாம் கிடையவே கிடையாது. ஸோ இட் இஸ் ஸோ அட்வான்ஸ்ட். எலக்ட்ரானிக் ஹெல்த் ரெக்கார்ட்ஸ், த டேட்டாபேஸ், மொபைல் ஆப்ஸ், online platform, data analysis and artificial intelligence. So advanced technology was there in the evidence based practice in our nursing field. And next, how to integrate the evidence based practice in our educations. We have a good compact. Now the curriculum was there. Previous இருந்த curriculum நல்ல curriculum தான். ஆனால் இப்போ இருக்கிற curriculum இன்னும் வந்து அட்வான்ஸ்டாக இருக்குது இந்த செமஸ்டர் கரிக்குலம் இல்லையா? This is not work for the students, this is work for the teachers. Am I right, all the teachers? INC curriculum is only for the teachers, it is not for the students. Student எப்பயும் அப்படியே தான் இருக்காங்க. only teachers grade போடுறது, மாடியூலை ப்ரிப்பேர் பண்ணுறது, எலெக்டிவ் மாடியூல்ஸு, அப்புறம் மேண்டேட்ரி மாடியூல்ஸு, எல்லா மாடியூல்ஸும் ப்ரிப்பேர் பண்ணி டீச்சர் கிளாஸ் எடுத்து மாடியூல் ஸ்டூடெண்ட் ப்ரிப்பேர் பண்ணுறாலோ இல்லையோ, லெட்ஸ் ஆல் இப்போ எல்லா காலேஜ்லேயும் 3rd செமஸ்டர் இருக்காங்க. ஐ திங்க் ஆல் த டீச்சர்ஸ் ஹாவ் அ குட் மாடியூல் ஆன் யுவர் பேக்கெட், ரைட்? அதுவும் எதில்? எலக்ட்ரானிக்கல்லாம் இல்லை, இப்போதைக்கு எங்கள் கையில் தான் இருக்குது, அதில் ரிட்டனில் தான் இருக்குது. ஃபஸ்ட் எய்ட் மாடியூல், ஹெல்த் அசஸ்மெண்ட் மாடியூல், அது மெடிக்கல் சர்ஜிக்கல் டிபார்ட்மெண்ட்டில் இருக்கிறவங்களுக்குலாம் ஹெல்த் அசஸ்மெண்ட் மாடியூல் ஒரு சிஸ்டம் வைஸ் போட்டு சூப்பராக பக்காவாக வச்சுருப்பாங்க இப்போத்துக்கு. அப்புறம் 8th செமஸ்டர் வரும்போது அதெல்லாம் மாடி போயிடும் இல்லைங்களா? ஸோ த கரிக்குலம் வாஸ் குட் டிசைனிங் இந்த நவடேஸ் அண்ட் simulation and the practical experience as our Tamil Nadu nurses, our midwife council, as madam have given it the good opportunity for all the nurses for the simulation labs, how to as to staff to implement if the patient is not available on the clinical setting with the simulation patients, how are you going to be applied into the practice? So the teacher learn பண்ணிட்டோம், in a student கிட்ட implement பண்ணவே முடியல because student is not ready to learn the things, right? So teachers are learn how to implement into the ஸ்டூடெண்ட்டுக்கு தான் நமக்கு இன்னும் தெரியவே மாட்டேங்குது. ஏன்னா ஒரு மாடியூலுக்கு ஒரு இதை எடுத்து ஸ்டோரி எழுதிட்டு வாடி அப்படின்னாவே அவள் எழுதிட்டு வரதுக்கு இருங்க மேடம் எழுதிட்டு வரேன் இன்னும் எழுதுறாங்க. ஸ்டில் இஸ் அப்படியே போய்கிட்டு தான் இருக்குது. இன்னும் மாடியூல் ரெடி பண்ண மாதிரி கிடையில. பட் எங்கள் டீச்சர் எல்லாம் ரெடி பண்ணிட்டாங்க. எல்லா டீச்சருமே அதை ரெடி வச்சுருக்காங்க. ஆனால் ஸ்டூடெண்ட்டுக்கிட்ட ஒரு ஒர்க்கை கொடுத்து ஒரு மாடல் இது மாதிரி மாடல் எழுதிட்டு வாமா அப்படின்னா எழுதிட்டு வரேன் மேடம், இன்னும் புரியல மேடம், எழுதிட்டு வரேன் மேடம். ஸோ அவங்க டீச்சர் ஆகும்போது புரிஞ்சு எழுதிட்டு வந்துடுவாங்கன்னு நினைக்கிறேன். ஸோ சிமுலேஷன் லேப்ஸ் இட்ஸ் அட்வான்ஸ் டெக்னாலஜி அண்ட் இட் இஸ் அ கண்டினியூயிங் எஜுகேஷன்ஸ். How to empower the patients with the evidence-based practice, educating the patients on the importance of evidence-based care, and sharing and discussing the relevant research findings, encouraging the questions and the discussions about the patient's care, and incorporating the patient's preference and the values in the evidence-based planning care. How to contribute into the ecosystems. You are supposed to conduct into the original research. Don't copy from the others. You conduct, whether may be small or the big or whatever it may be, you yourself take a time. உங்களோட பிரெயினுக்கு உங்களுக்கு கொஞ்சம் வேலை கொடுத்துட்டு find out into the original research. Then participating in the clinical. Even nowadays MSc ஸ்டூடெண்ட்ஸுக்கு போய் டாபிக் செலக்ட் பண்ணிட்டு வாமா அப்படின்னா லைப்ரரியில் போய் உட்காந்து ஒரு டாபிக் ஆல்ரெடி என்ன லைப்ரரியில் இருக்கோ எழுதிட்டு வந்து மேம் 25 டாபிக் வச்சுட்டு ஏதாவது ஒன்று செலக்ட் பண்ணி தாங்க மேடம் தான் சொல்லுவாங்களா ஒழிஞ்சு புதுசாக ஒரு டாப்பிக்கை கண்டுபிடிச்சிடும். நான் சொல்கிறேன் வாட் எவர் யூ ஹாவ் இன் யுவர் பிரைன் பிஃபோர் யூ ஆர் செலக்டிங் யுவர் டாபிக்ஸ், வாட் எவர் யூ ஹாவ் இன் யுவர் மைண்ட், ஜஸ்ட் த்ரோ இட் ஆன் யுவர் பேப்பர்ஸ் ஃபர்ஸ்ட். பிகாஸ் இன் டே டு டே லைஃப் யூ ஆர் சீயிங் லாட் ஆஃப் பேஷண்ட்ஸ். பேஷண்ட்டை மட்டும் பார்க்கல, உங்களோட பர்சனல் லைஃப்லேயே நிறைய எக்ஸ்பீரியன்ஸ் ஆகிருப்பீங்க. உங்கள் பக்கத்து வீட்டுக்காரங்க, உங்களோட ஃப்ரெண்ட்ஸ் நிறைய அந்த எக்ஸ்பீரியன்ஸு ஜஸ்ட் த்ரோ இட் ஆன் யர் பேப்பர்ஸ் ஃபர்ஸ்ட். அதுக்கப்புறம் நெட்டுக்கு போங்க. என்ன இவங்களுக்கெல்லாம் கொடுக்க முடியும், எப்படி ஓவர் கம் பண்ண முடியும் இந்த ப்ராப்ளம்ஸை, அதுக்கப்புறம் நெட்டில் போய் சர்ச் பண்ணி தென் யூ அப்ளை டு யுவர் ப்ராக்டிஸ். ஆல்வேஸ் த்ரோ யுவர் கொஷின்ஸ் ஆன் யர் பேப்பர்ஸ் ஃபர்ஸ்ட். Then you make your statement of problems. So, participating into the clinical trials, publishing your findings, presenting in the conference, joining into the professional networks. What are the benefits? It is a well-founded decisions. When you use into the evidence-based practice in your life, you have a well-founded decisions you will make. Positive patients outcomes. Reduce your healthcare cost. Incorporating the new technology in your day-to-day lives. Increase the nursing or the nurses' autonomy and the confidence. When you are giving into the care only, you will get into the confidence. பயந்துக்கிட்டே இருந்தீங்கன்னா ஒன்றும் நடக்காது. Encourage the lifelong learning. SAR inaugural section should always to be update yourself, otherwise you will be outdated. Enhance the critical thinking. The last, stay updated about the new medical protocols. ஒரே ஒரு ப்ரோட்டோகால்ஸ், அதாவது கோவிட் வந்தது, கோவிடுக்கு முன்னாடி நமக்கு யாருக்குமே தெரியாது பேஷண்ட்டுக்கு நிமோனியா இருக்குதா இல்லை வாட் இஸ் அ லங் ப்ராப்ளம்னே நமக்கு இப்போ தெரியவே தெரியாது. இப்போ நிமோனியான்னு வந்தாவே தே வில் யூஸ் ஆல் த மெடிக்கேஷன்ஸ், அந்த 5 மெடிக்கேஷன்ஸும் கோவிட் யூஸ் பண்ணுறது போட்டுட்டு அப்புறம் தான் பேஷண்ட்டையே எக்ஸ்ரேக்கு போகுமா சிடிக்கு போகணுமா பண்ணால். ஏன்னா தே வாண்ட் டு பி சேவ் த பேஷண்ட்ஸ் லைஃப். தட் இஸ் யுவர் நியூ டெக்னாலஜி. கோவிட் வந்தனால தான் அது தெரிஞ்சிட்டோம். கோவிட் வந்தப்போ எத்தனை பேர் நம்ம திட்டிருப்போம், ஆனால் கோவிட் வந்தனால வி லேர்ன் த திங்ஸ். தட் இஸ் நியூ டெக்னாலஜி, ரைட்? இப்போல்லாம் இருமுனாவே பேஷண்ட் என்ன பண்ணிடுறான், ஹாஸ்பிட்டலுக்கு ஓடி போயிடுறாங்க. முதல்லலாம் என்ன இருமுனாலும் சுடு தண்ணியை வாங்கி குடிச்சிட்டு ஒரு விக்ஸை போட்டு ஆவியை பிடிச்சிக்கிட்டு எதையோ ஒன்று படிச்சுக்கிட்டு இருக்கும். இப்போல்லாம் அப்படி வேலையே கிடையாது. ஸோ வாட் எவர் இஸ் ஹேப்பனிங் அவர் லைஃப், மேபி நெகட்டிவ் ஆர் பாசிட்டிவ், வி ஆர் லேர்னிங் ஃப்ரம் திங்ஸ், applying into the new technology in your practice. That's to be evidence-based practice. The last slide, how to overcome the challenges. So what is the negative? The lack of knowledge and the training. What is positive? Continuing education and the training. What is the negative? Inadequate organizational support. There is a good support and mentorship. Negative, resistant to change. எதையுமே நம்ம சேஞ்ச் பண்ணிக்க மாட்டேங்கிறோம். But creating the culture to change our practice. Last, time and resource constraints. எங்கேயாவது ஒரு ப்ரோக்ராம் நடக்குது போய் அட்டன் பண்ணிட்டு வேணா டைமே இல்லை மேம் 8 to 4 டியூட்டி முடிச்சு இப்போ தான் மேம் ரூமுக்கே வரும் அதுக்குள்ளே நீங்கள் போய் ஒரு சிபிஆரை கண்டக்ட் பண்ணால் அதை பண்ண சொல்லுங்கிறீங்க. Allocating the time to the resources. That's it. Thank you for your patience listening.
Thank you, ma'am, for enlightening talk packed with valuable insight. To honor our third speaker, I request our organizing chairperson and organizing secretary to present the memento and the certificate.
To make you more energetic, our third year BSc Nursing students, SKS College of Nursing, are here to give a dance performance. So ladies and gentlemen, put your hands together to welcome our students to make you energetic and enthusiastic for upcoming seminars.
இப்போ நம்ம எங்கே வந்திருக்கோம்னு பார்த்தா நம்ம எஸ்கேஎஸ் காலேஜ் ஆஃப் நர்சிங் கண்டக்ட் பண்ணுற ஸ்டேட் லெவல் செமினார் ப்ரோக்ராமுக்கு தாங்க வந்திருக்கோம். எங்களோட தீம் என்னன்னு பார்த்தீங்கன்னா இன்ட்ரெஸ்டிங்கான தீம் தாங்க. என்னன்னு கேட்குறீங்களா? அதாங்க ரிவலிங் ஆஃப் தி நர்சிங் ஹார்ட் பீட்.
ഹൃദയവും ഉണരുമേ നിമിഷമായി.
ലവ് യു മുത്തേ ലവ് യു, നീ എന്ത് പറഞ്ഞാലും ലവ് യു, വീണ്ടും വീണ്ടും ലവ് യു, എന്നെ വട്ടു പീഡിപ്പിക്കും ലവ് യു. ലവ് യു മുത്തേ ലവ് യു, നീ എന്ത് പറഞ്ഞാലും ലവ് യു, വീണ്ടും വീണ്ടും ലവ് യു, എന്നെ വട്ടു പീഡിപ്പിക്കും ലവ് യു.
என் இதயம் என் இதயம் என் இதயம் இதுவரை துடித்ததில்லை, இப்போ துடிக்கிறதே. என் மனசு இதுவரை பறந்ததில்லை, இப்போ.
എന്റെ എല്ലാം എല്ലാം അല്ലേ, എന്റെ ചേലത്തെ ചെമ്പരുന്തല്ലേ, നിന്റെ കാലിലെ കാണാ പാദസരം ഞാനല്ലേ, ഞാനല്ലേ, നിന്റെ മാറിലെ മായ ചന്ദനപ്പൊട്ടെനിക്കല്ലേ, എനിക്കല്ലേ. കീലുങ്ങാ കിങ്ങിണിച്ചപ്പേ ചിരിക്കാ ചെമ്പകമൊട്ടെ, പിണങ്ങാൻ എന്താണ് എന്താണ്, മിനുങ്ങാൻ എന്താണ് എന്താണ് എന്താണ്, മയങ്ങാൻ എന്താണ് എന്താണ് എന്താണ്.
ஐயோ என்னாச்சு என்னாச்சு என்னாச்சு? ஏந்திரிங்க, நல்லா இருக்கீங்களா? நீங்கள் சீக்கிரம் ஆம்புலன்ஸ் கால் பண்ணுங்கள்.
Hello, Monisha here. Who is calling?
ஹலோ, என் ஒய்ஃபுக்கு ஹார்ட் அட்டாக் வந்துடுங்க, கொஞ்சம் சீக்கிரம் வாங்க.
என்ன பிரசவ இல்லையா? இதோ உடனே வரேன்.
இது அது இல்ல.
ஹார்ட் அட்டாக். சரிங்க சிஸ்டர், நீங்கள் அந்த பேஷண்ட்டுக்கு சிபிஆர் கொடுங்க.
வாய்ப்பில்லை ராஜா.
உனக்கு வேலை தெரியுமா தெரியாதா? நானும் நீ வந்ததுல இருந்து கவனிச்சுட்டு தான் இருக்கேன். மேக்கப் போட்டுட்டு மினிக்கிட்டு எப்படி போறே வர என்ன நடிக்கிறியா?
சரிங்க சிஸ்டர், நீங்கள் சிபிஆர் கொடுங்க.
அழகு இல்லையா அவள் இவளது ஸ்டைலா சந்தன வேலா இவள் மன்மத புயலா.
இதுலேருந்து நம்ம என்ன தெரிஞ்சுக்கிட்டோன்னு பார்த்தீங்கன்னா, ஒரு இன்ஃபர்மேஷன் வரும்போது அந்த இன்ஃபர்மேஷனை நம்ம கரெக்டாக அண்டர்ஸ்டாண்ட் பண்ணிக்கணும், கம்யூனிகேஷன் எரர் ஆகாமல் பார்த்துக்கணும்.
ചിരിമണി മുല്ലേ ചിത്തിര മുല്ലേ സുഖമല്ലേ സുന്ദരി മുല്ലേ ചെല്ല നിലാവിൻ ചുംബനമേൽക്കാൻ സുഖമാണല്ലേ.
ചെമ്പകമലരെ കളി പറയാതെ കരിവണ്ണെ കൊതിത്തു വീഴാതെ മധുവിതുരാവിനിൽ എല്ലാം പണ്ട് പതിവാണല്ലോ.
കണ്ണിണകൾ കടുകു വറുക്കണ സുഖമാണല്ലോ. കവിളിണകൾ ചോന്നു തുടിക്കണ പതിവാണല്ലോ. Better just tell me സ്നേഹം തൊട്ടു തൊട്ടു തരുമോ? കനവിൽ മുട്ടി മുട്ടി നീ വരുമോ വരുമോ വരുമോ?
I just wanna love you ചുണ്ടിൽ തൊട്ട് തൊട്ട് നൽകാം കനവിൽ മുട്ടി മുട്ടി ഞാൻ തനിയെ പോരാ.
ஏதோ நானும் வளர கொஞ்சம் காதல் வளர உள்ள வைக்கும் வளர அவ வந்தா தேடியே தன்னை நேரம் நிற்குதோ கொசுக்குது பாடத்துக்குதமா நெஞ்ச போட்டி வச்சத வந்தொடைச்சிட்டமா. கட்சி சேர நிற்குது கண்ணழைக்குது பொண்ணு நிந்திடமா தேங்கி நிற்குது வந்தெடுத்துக்கோமா.
என்னடி சாக்லேட் சாப்பிட்ற? சாக்லேட் ரொம்ப நல்லா இருக்கா?
ஆமாடி, சாக்லேட் ரொம்ப நல்லா இருக்கு. உனக்கும் வேணுமா?
இல்லடி, எனக்கு சாக்லேட்லாம் வேண்டாண்டி, நீயே சாப்பிடு. என்னடி ரோட்லேயே குப்பையை போட்டேன்? ரோட்டில் வந்து குப்பை போடக்கூடாது, இது உனக்கு தெரியாதா? அஸ் ஏ ரூல்ஸ் படி நம்ம பப்ளிக்கில் வந்து குப்பை போடுறது ரொம்ப தப்பு. நம்ம இப்போது பப்ளிக்னு மட்டும் இல்லை, நம்ம இப்போ ஹாஸ்பிட்டலில் ஒர்க் பண்ணுறதா இருந்தாலுமே சரி, நம்ம அதுக்குன்னு ஒரு ரூல்ஸ் அண்ட் ரெகுலேஷனை வந்து ஃபாலோ பண்ணுவோம். இப்போ ஒரு பேஷண்ட்டுக்கு வந்து ட்ரீட்மெண்ட் கொடுக்குறதா இருந்தாலுமே வந்து நம்ம அந்த எத்திக்ஸையும் அந்த லாவையும் ஃபாலோ பண்ணி தான் பேஷண்ட்டுக்கு வந்து ட்ரீட்மெண்ட் கொடுக்குறோம்.
ஓ அப்படியா? நான் இனிமேட்டு ரோட்டில் குப்பை போட மாட்டேன், ரூல்ஸ் எல்லாம் ஃபாலோ பண்ணுறேன்.
சொர்க்கம் என்பது நமக்கு
சொர்க்கம் என்பது நமக்கு சுத்தம் உள்ள வீடுதான் சுத்தம் உள்ள வீடுதான்
சொர்க்கம் என்பது நமக்கு
சுத்தம் உள்ள வீடுதான்.
சொர்க்கம் என்பது நமக்கு சுத்தம் உள்ள வீடுதான்.
சுத்தம் என்பதை மறந்தால் நாடும் குப்பை மேடுதான்.
சொர்க்கம் என்பது நமக்கு சுத்தம் உள்ள வீடுதான்.
சுத்தம் என்பதை மறந்தால் நாடும் குப்பை மேடுதான்.
Thank you, students, for your marvelous performance.
So do you all think this is the end? No, it's not the end. This dance is to be continued in the after sessions. An ounce of prevention is worth and proud of cure. So don't wait for an outbreak, prevent it altogether. I cordially welcome Organizing Secretary to introduce about the fourth speaker.
I welcome Dr. Mehranisha, MBBS, MD, Microbiology, the head of the Department of Infection Control in SKS Hospital, Postgraduate Institute, Salem. Her total experience is 12 years. She completed her MBBS in the year of 2006 in Annamalai Medical College, Chidambaram. She completed her MD Microbiology in the year of 2012 in Keelpark Medical College, Chennai. After her PG, she started working in Government Hospital in the Department of Public Health, Salem from 2012 to 2014. Also, she started working in SKS Hospital and Postgraduate Medical Institute from 2014 to till date as a HOD of Microbiology, Serology and Molecular Biology Department. Now I welcome Dr. J. Mehranisha to start this session. We welcome you, ma'am.
Good morning, one and all present here. I feel very honored for being invited as a speaker so that I got a chance to communicate with you. And the topic given to me here is guarding against germs, combating hospital-acquired infections. So this is a very interesting topic according to me. Infection control is supposed to be a very interesting topic, and it is also going to be very useful for you in your future job, because in this entire presentation I am going to talk about the precautions that you are going to take to protect yourselves from being exposed to infections. At the same time, you are also going to prevent the outbreak or transmission of infection across the hospital, that is from patient to patient. So we'll start with the definition. So with the healthcare associated infection, it is defined as the infection which is acquired by the patient after admission in the hospital. So which means that during admission, the patient did not had any infection, but the patient was admitted for some cause and the patient was getting treatment for a period of 48 hours. And after 48 hours, if the patient has signs and symptoms of infection, then it is considered as hospital-acquired infection. Or if the patient is discharged and within 30 days, if the patient get any infection, then again that infection is due to the hospital cause. So that's called as hospital-acquired infection. This is a timeline given by WHO. So which means that the patient has got infection during the care or treatment given in the hospital. Now, whenever there is an infection, there will be some cause, right? So, what is the cause of infection? So, there are a lot of microorganism classes like bacterial, virus, fungi, and parasites. So, all these classes of microorganisms are responsible to cause infection. So, these organisms will be present in the body of the patient. And sometimes that patient will not have any symptoms. So there are two conditions which these microbes can cause. The conditions are called as either colonization or infection. So what is colonization? We have to understand the difference between a colonization and infection. So in a colonized person, the bacteria will be in the body, but the patient will not have any immune response, which means the patient will not have any symptoms. So in a patient who is colonized, do we require treatment with antibiotics? No, we need not treat them. Even though the bacteria or bugs are present in the body, it is only colonization because the patient is not suffering any infection. Yes, but the patient can transfer this bacteria to another patient. So what we have to do is we have to isolate the colonized person so that he is not being a danger to the next patient. But he does not need any treatment with antibiotics. So that is condition called as colonization. What is the next condition called as infection? So infection is a condition where the bacteria, the same bacteria will be present in the body of the patient,
but the patient will be suffering with symptoms. So that is, the immune response will be there. The patient will have fever or any signs of symptoms. So that is called as infection, and in the patient who is having infection, the patient requires a treatment. So the patient needs to be treated with antibiotics. So I hope you are able to understand the difference between a colonization and an infection. Now, what are the common HAIs, hospital acquired infections? So most commonly in our hospitals, we are coming through these types of 4 infections: urinary tract infections, surgical site infections, hospital acquired pneumonia, and hospital associated bloodstream infections. So when a patient comes to the hospital, the patient may require a Foley's catheter, right? So we are inserting a Foley's catheter to the patient, and while inserting, we have to follow aseptic technique. That detail of aseptic technique I will be telling in the next slides. But if you are not following the aseptic technique while insertion, similarly, the maintenance of this catheter should also be done following hygiene and the bundle care approach, like hand hygiene and giving proper care, that is meatal care. So there are so many things like urinary bag. It should not be above the level of the bladder. So the uro bag should be maintained below the level of the bladder even during transport. So sometimes you would have seen in a hospital a patient being transported from one side to another. The uro bag will be placed on the top of the bed. That is not at all acceptable. Why? The urine will backflow, go back into the bladder and cause infection to the patient. So this type of infection is called as CAUTI, that is catheter associated urinary tract infection. It's a fancy name. So we said CAUTI, SSI, VAP, CLAPSI. So these are fancy names. So what is the full form of CAUTI? It is catheter associated urinary tract infection. Second is surgical site infections. So by the name itself, we know the patient has undergone a surgery in the hospital, and following the surgery, the patient landed up in a surgical site infection. So which means, what are the causes for surgical site infection? There are numerous causes. We have to analyze and do the investigation why the patient has landed up with surgical site infection. So for example, the instruments needs to be sterilized. OT is considered a sterile site. So environmental disinfection in the OT should be proper. Even the AC maintenance, AC filters should be cleaned regularly. And surgeon's hand sepsis. Surgeon is doing a hand scrub before doing the surgery. So that steps he has to follow correctly, the timing, proper antiseptic solution, proper skin preparation for the patient before the incision is done in the surgery. So many factors has to be analyzed. All if these are proper, then the patient is safe. But if there is a small breach in either of these conditions before surgery, then the patient will land up in surgical site infection. Then coming to the next is hospital acquired pneumonia. So the patient is admitted in ICU, the patient has worsening of oxygen, and the patient needs to put on ventilator. So when connecting to the ventilator, you do an intubation. So there also, while the doctor puts a ET tube inside the patient, he has to follow certain precautions, wearing a proper PPE, wearing a glove, sterile glove, a mask, and then see that the tip of the ET tube does not touch any contaminated site, and all those precautions the doctor has to take while inserting, and following which maintenance also should be done properly. So maintenance is done by the nursing staffs, like for example suctioning, like close suctioning, and maintaining the pressure level so that the secretions don't go inside the lung. And if there will be oral secretions, so chlorhexidine mouth rinses are given frequently so that the patient is safe and does not land up in ventilator associated pneumonia or consider a VAP. And lastly, it is bloodstream infection. So patient requires IV treatment in the hospital, right? Most of the patient get admitted only when they require an IV treatment, even in general ward. So we put peripheral cannula. Sometimes we also go for central line cannula. So, and after that, during insertion, here also we have to take the same sterile precautions. For example, for a central line insertion, We have to wear full PPE, right from the cap, mask, apron, and sterile gloves is very mandatory for inserting a central line. Similarly, for a peripheral line, definitely you should wear at least a clean glove and do the skin prep properly, then insert the cannula in a proper way so that you don't counterpuncture, and also put a sterile dressing over it and label the date and time. So all these things has to be done meticulously so that the patient doesn't land up in bloodstream infections. So these are called as infections, but you know how much pressure the patient has because of these infections. The patient came for a surgery for a different cause, but due to some breach in the hospital procedure or protocol, if the patient lands up in a surgical site infection, how much constraint of money financially the patient has to undergo. The patient has extended admission in the hospital. The mental condition of the patient will be under stress. All the family members will be stressed. The doctor also will be in stress. So that is a very, very difficult situation. So I think this topic is very important for us nursing staffs. We are all healthcare workers. We are always exposed to risk of infections. So we should know what are the precautions we should take so that the patient does not get the infection. At the same time, we should also protect ourselves from getting those infections. So whenever there is an infection, it's a chain of infection. So there will be one source, which is the infectious agent. There will be a mode of transmission, how it is transmitted to the susceptible host. This is called a triad or the chain of infection. So our duty is to break this chain of infection, right? So how are you going to break the chain of infections? For example, these are the bugs, the infectious agent, and what is the reservoir there? Example like people, dirty surfaces, dirty equipments, all will have bacteria if they are not cleaned and disinfected. So there is a symbol back, there is a bucket there which is having some disinfectant in it. So you have to do proper environmental cleaning, not only floor, every equipment, like right from the bed, right from the patient trolley, medication trolley, syringe pump, IV stand, everything has to be cleaned. So that is one way to break the chain, right? Chain of infection. Second way, PPE, personal protective equipment. So these are the ways you can wear the PPE so that you do not get the exposure of infectious agents. So the mask is a protection, apron is a protection, gloves is a protection. So by wearing a PPE, you are going to break the chain of infection. Similarly, immunization and importantly, hand hygiene. So these are some of the methodologies you can follow to break the spread of infection. Now I talked about the mode of infection. How is the source patient transferring the bacteria to a host patient? So there are modes like contact, airborne, droplet, and environmental sources and other sources. So contact, by the name itself you come to know, it is through touch. So either directly touching the patient's skin or in contact with the blood or body fluids of the patient. So in contact, it is divided into two, direct and indirect. So what is direct contact? Directly you are going to touch the patient, skin or body fluids. So that is direct contact. What do you mean by an indirect contact? You, through fomites, inanimate objects which were in close contact with the patient. For example, the bed sheet, the bed rails, the medication trolley, whichever is close contact with the patient. So the bacteria will be deposited in these environmental inanimate fomites. Now if you come and touch these environment of the patient, that bacteria will be transferred to your hand. So these hands are contaminated. Now you have to do a hand rub with alcohol hand rub. If you miss that step, you can transfer it to another patient while giving care, or you can yourself, self-infect yourselves. So that is called as indirect contact. The next one is airborne contact and droplets. So I'll talk about this in the next slides. So I told about precautions. we have to take certain precautions to protect ourselves so that as well as protect the patients. So what are these two types of precautions I'm going to talk through this presentation is, one is transmission based precautions, the other is standard precautions. Madam told it was previously called as universal precautions, standard precautions. Now the terminology has changed, it is called as standard precautions. First, the standard precautions is applied to all patients, universal. So which means that every patient who is going to get care or admit in the hospital, you have to apply standard precautions. Whereas transmission based precautions is applicable for certain known and suspected patients. For example, they are considered as they are highly virulent and infectious patients harboring these bugs. So this in transmission based precautions, it is mandatory that you put the patient in a single isolated room. So in transmission based precautions, you isolate the patient, whereas for patients who are just put on standard precautions, there is no need of isolation. So which means that they are not that infectious. Just by breaking the chain which I told earlier, you are able to manage. But for transmission based precautions, the bug which the patient is having, for example, bacteria or virus, that is very easily spread to others. So you have to isolate the patient until the patient is not infectious. So first we'll go into deeper into what is transmission based precautions. For transmission based precautions, it is again subdivided as contact, airborne and droplet precautions. So you have to put a patient on contact precautions for certain diseases. For example, if the patient is having an infection with MRSA. Have you heard the word MRSA? Methicillin resistant Staphylococcus aureus. So Staphylococcus aureus is nothing but a gram-positive bacteria. It is resistant to methicillin, which means it is resistant to most of the antibiotics. So the option left for treatment is higher end antibiotics. So in that case, the patient having MRSA is considered to be put in isolation room with contact precautions. Similarly, vancomycin resistant enterococci, Clostridium difficile, scabies. So these are some of the examples in diseases where the patient should be isolated and put on contact precautions, because this spreads through touch. So how to break the chain of infection in contact precautions? So the green color patches on the patient is a, the green color patches on the patient is considered the microbes. So the patient has used the toilet, commode, and if you don't disinfect this non-critical equipment, commode, and then it is used by another host, susceptible another patient, then the bacteria will be transferred to this patient. So one thing you have to do, cleaning, disinfection, and then through gloves also. If you don't remove the gloves and do proper hand hygiene, through hands also it can be transmitted. So that is why, because this patient is harboring very infectious agent, the patient should be put on isolation room. In that case, the patient will have a separate toilet, so which will be used only by that patient, so that infection does not spread to the next patient. All right. Similarly, then come to the airborne precautions. I'll put another slide here. So this is a simple slide where you can very easily understand a difference between airborne and droplet, right? So airborne precautions, it is a smaller particle aerosols which is less than 5 microns in size. So it is very, very small. So as the particles are very small, they can travel for a long distance, which is considered more than 3 feet, and reach another person. So that is called as airborne spread. So for examples for airborne spread is like tuberculosis, chickenpox, and measles. So they travel for a long distance and reach another person. This is called as airborne precaution. So how will you prevent this? In case of airborne precautions, you have to wear a not only ordinary mask. For airborne, the particles are small. So what type of mask will you wear? Yes. For airborne precautions, you have to wear a particular PPE respirator, let us say N95 mask. Whereas for a droplet precaution, the particle size is bigger. It is more than 5 microns. Example of the diseases there is pertussis, influenza, rubella and mumps. So here what mask you will wear? A surgical mask is enough. So you were able to understand the difference between an airborne precautions and a droplet precaution. So all these patients you have to put them in isolation. You also have to put them in a single room, and the door should carry a signage board like this, so that they are aware a patient is isolated in this room, and at the door entry, you have to put this signage board. So for example, contact precautions, you have to put the word stop. So no one visitor can just directly enter into a patient who is put on isolation. And you have to go check with the nursing department. Before entering the room, you have to do a hand rub, and you have to wear a glove and a gown, because this is to touch. So gloves is very important for contact precaution. Similarly, hand hygiene is important. Whereas for droplet precaution, again hand rub you have to do, wear a mask, just a surgical mask, and sometimes a goggles also. Whereas for airborne precautions, you have to do hand rub, you have to wear gown and gloves, but mandatory to wear an N95 mask. So all these details should be posted on the door of the patient who is isolated. So to contact, droplet and airborne precautions. Hope you are clear with all the transmission based precautions. So here we are completing the transmission based precautions. Now we are coming to standard precautions. So standard precautions, I told it is applicable to all patients. So what are the elements of standard precautions? So standard precautions consist of 8 elements. So each one we will see in detail. So standard precautions, first very important, this is given by CDC guidelines, the standard precautions. So here it is appropriate hand hygiene, wearing personal protective equipment, patient placement to prevent transmission based precautions that we have already seen in the previous slides, followed with respiratory hygiene and cough etiquette, cleaning and handling of environment, equipments and devices, safe handling of laundry, sharp safety and aseptic technique. So these points we will discuss in the next slide. So these are called as, all these if you implement together, put together, if you implement for the patient, it is called as standard precautions. Are you able to get me? So now coming to the first element, that is standard precaution, that is hand hygiene. Very, very important, which is universal, and the nursing staff before entering into the hospital should be very well aware of what are the steps of hand washing, when you have to do a hand washing with soap water, when you have to do a alcohol hand rub, right? So these are the hand washing photos that I have got here. So with soap and water, you have to do a particular timing. It is not like just open the water, rinse it like this, or squeeze your hand and come away. That is not at all hand washing. So hand washing should be done for a period of time. It is 40 to 60 seconds, always, otherwise 1 minute is easy to remember. Soap water hand washing should be done for 1 minute. So what are the steps you have to do? So alcohol hand rub should be done for 20 to 30 seconds. So this is a waterless one. It is easy to access. Every time you cannot go and wash your hands with soap and water. So for easy access, you can do alcohol hand rub in between. So now coming to, when you do soap water hand washing, when you do alcohol hand rub, you should know when you have to do either of these things. So first, when the hands are visibly soiled. What do you mean by visibly soiled? Any blood stain or exposure to body fluids on the hands, that is called as visibly dirty. So in that case, you have no other option other than soap water hand washing. If it is an alcohol based hand rub, it is done when the hands are not visibly soiled, right? Now what are the types of hand washing? So this is called as social hand washing, which is for 1 minute I just discussed. Then antiseptic hand rub, which is for 20 to 30 seconds when the hands are not visibly soiled. Then there are other one, that is surgical hand scrub. When is this done? Surgical hand scrub is done before surgery by the surgeon, and it will be done till the elbow. Whereas normal hand washing will be done only till wrist. Right? So surgical hand scrub timing is 2 to 5 minutes, and similarly using an alcohol hand rub you can also do surgical hand rub. That is for 60 seconds. So all these steps and this timing, everything is given in WHO guidelines. Evidence-based WHO guidelines has defined how you have to do hand washing, how you have to do alcohol hand rub, and what is the time you have to follow. So now these are all from WHO guidelines. So when you do soap water hand washing, some not only visibly soiled hands, after using toilet, before after having food, after removing the gloves, or doing any diapering or toiletering of children, and before leaving the work. So all these are the places where you have to do soap water hand washing. Now next is when you do alcohol hand rub, when you are going to do some invasive procedures like intravascular device placement. So in these places you can also do soap water hand washing followed with alcohol hand rub, and before and after direct contact with the patient. So in every patient cot with there should be an alcohol hand rub. So that it is easily accessible. Now coming to the advantages. So this alcohol hand rub will kill most of the gram-positive bacteria, gram-negative bacteria, even tuberculosis and fungi. But what are the disadvantages of the alcohol hand rub? There are some disadvantages, like it is not having proper activity for bacterial spores, and it will not have any antimicrobial activity for non-enveloped viruses. So in this case there are two disadvantages for alcohol hand rub. Now coming to the steps. Instead of concentrating on number of steps, I am going to tell how was the technique, what is the proper technique you have to follow so that you will cover all the areas of the hand. So that is important. So first you have to wet your hands and take adequate amount of soap solution. Then do palm to palm rubbing to bring up a lather. So first step is palm to palm rubbing. Then next is fingers interlaced so that you are cleaning the in between the web spaces. So that step is, this is the interlacing steps, cleaning the web spaces. Now coming to interlocking. So this is like back of the fingers, both the hands. This is like doing interlocking, cleaning the back or part of this finger, then reverse it and then the back part of this fingers. That is called as interlocking step. Then thumb, you will miss the thumb. So there is one step dedicated for thumb so that you do concentrate and clean, doing rotational movement around the thumb for both the hands. Then last is cleaning the tip of the fingers. That is the most important place, and the nails have to be cleaned. So last step is using the tip of the fingers in a rotational movement on this palm, then using the tip of the fingers on the other palm in a rotational movement, followed with wrist rotational movement of both the hands. So these are the ways you can clean each and every part of the hand. So that is why it is given in the form of steps. So you have to follow the technique and do it for how much time? 1 minute. For alcohol hand rub also you have to follow the same steps. When you do hand hygiene, this is very important. 5 moments of hand hygiene. That is, you have to use alcohol hand rub before touching the patient, also after touching the patient, before any procedure, after procedure or body fluids exposure, and after touching the patient's surroundings. Even after touching, you go just adjust the urobag, do a hand rub. Just adjust the bedding or linen, do a hand rub, so that you don't get the bacteria on your hands and don't transmit it to yourself, don't transmit it to the next patient. So these are the 5 moments where you have to do hand hygiene. So second is PPE. So what are the PPE that you are going to wear? This is called as PPE, stands for personal protective equipments. So it includes goggles, face shield, mask, an ordinary face mask, a N95 mask, apron, plastic apron, this is a gown, and gloves. So these all components are called as personal protective equipments. So who all the staffs need PPE? So each healthcare worker will need a different type of PPE, right? So first we'll take with the cleaning housekeeping staff. You can see the PPE. Is he wearing a different gloves? He is having a thick heavy duty rubber gloves. So that because he is doing cleaning of the toilet, which is heavily contaminated, he is handling the biomedical waste segregation. So he needs the thick rubber gloves or heavy duty rubber gloves. And see his shoes, these are called thick rubber boot shoes. And other than that, he needs an apron, he needs a mask and a cap. Whereas if you see a doctor in the labor room, she needs a gloves up till the elbow, an apron, a closed covered shoes, goggles, mask and cap. A laboratory person will need a white apron, then a glove, a mask, a cap and a goggles to prevent the splash. So there is a sequence where you have to put on the PPE. So always there is one particular order you have to put on the PPE. So what is the first thing you will wear? It is gown. Next is a mask, then goggles. What is the last thing you are wearing? So whenever you put on a PPE, the last thing you wear is the gloves. And similarly, what is the first thing you remove? That is also gloves. Because after doing some contaminated procedure, your gloves are going to be contaminated. So next thing you have to remove is the gloves. And something I want to tell about the PPE at this point, where I have seen nursing staff doing lots of mistake while handling the PPE. So can you touch the front of the mask? Why? Because the infectious particles are going to land directly on the mask. So you whenever you have to adjust or touch the front of the mask, do a hand rub or avoid touching the front of the mask. Remove the mask using the ties or elastic band. Never touch the mask. Don't keep it in pockets. Again, you are contaminating your pocket. Now coming to wearing a gown is easy, then wearing a gloves. Now in between also you have, while wearing, if you do contaminate your hands, you have to do hand rub. After wearing gloves, can you keep touching everywhere? You have to limit touching after wearing a glove, because you will have all types of bacteria on the gloves. You are protected, but you are transmitting the bacteria in the gloves to so many places. So that has to be again disinfected and cleaned. So avoid touching places after wearing gloves. Similarly, I told removal steps, remove gloves first, then goggles, gown, mask. And after removing all the PPE, definitely you have to do soap, water, hand washing or at least alcohol hand rub. How to wear a cap. This is the way you expand the elastic and wear it, and wearing a mask. So see that always there will be a steel clip given which should be on the nose, and you have to press it properly and see how the ties are tied. One tie is on above the ear behind the head, whereas the next tie is below the ear, that is round the back of the neck. And similarly, when you remove, which tie you will remove first? Bottom. Then remove the top tie. And immediately put it in the bin. Then one of the standard precaution is cough etiquette. So whenever you get cough, you, not only patients, everybody has to follow cough etiquette. Whenever you get cough, cover it with the tissue paper and then discard the tissue paper in the bin. If tissue paper is not available, use the bend of the elbow, cough, and then you have to do soap, water, hand washing or at least an alcohol hand rub. Now this is coming to the biomedical segregation. This is also a very important part of standard precautions. So green is for general waste, where you discard kitchen, paper, towel, tissue, water, plastic bags. All these things are, this green is for general waste, so there is no biohazard symbol. But the rest like yellow and red bins, there is biohazard symbol. So what does go in red bin? Hope you are aware now. What things? Anything which is infected and plastic. So gloves goes in infected red bin. Similarly, what are the other plastics you use generally? Syringe. plastic syringes, plastic apron, and then urinary catheter, Foley's catheter, this and IV administration set, IV plastic bottles. All this will go to red bin with biohazard symbol. In yellow bin, if it is with biohazard symbol, you will discard the laboratory waste, chemicals, and soiled waste. Like for example, cotton, gauze, all these things. And then if there is a symbol with cytotoxic C symbol, there you will discard the cytotoxic medicines, right? Then for blue it is glassware like vials, glassware, and for sharps like needles, you not put it in any bin, you have to only put it in punch-proof container. So right, there should be definitely a biohazard symbol in the bin as well as a biohazard symbol in the plastic yellow bag. Standard precautions while handling cleaning equipment. So while doing a cleaning, you have to classify each area based on the risk stratification. For example, if you're going for housekeeping, you have to see whether that area is a low risk area, a moderate risk area, high risk area, or a very high risk area. So based on the risk of that particular hospital area, you have to fix the frequency. For a low risk area like hospital office, a medical record, MRD. So in the library, here is the risk is the least, low risk. So you just cleaning for once a day will be adequate. Whereas for moderate risk area like general wards, you can do it like twice a day. For high risk area like labor ward, OT, we have to do after every case. And you can, for high touch surfaces, you can increase the frequency 3 times a day. Like for very high risk area like isolation room, you can also put it as 4th hourly or 4 times a day. So because based on the high risk area, you have to increase the frequency of cleaning. Whenever the floor is mopped, always mop it as a figure of 8, right? So this is the pattern how you have to do the mopping, and use a double bucket or a triple bucket system to mop. So what do you mean by double bucket system and a triple bucket system? So here one bucket will have water, that is for rinsing the mop, so that once you clean the floor with the disinfectant, then rinsing should be done in a separate bucket of water, so that you do not contaminate the disinfectant water too much, so that the efficacy will be reduced. That is why we are following a 2 bucket system for floor mopping, or otherwise called as 3 bucket system. Whenever you start cleaning, always start cleaning from the cleaner to dirtier. That is important. Then always have a checklist for housekeeping, starting from date, which department, name of the cleaning staff, ICU in charge should also sign this chart. See what all things you have to clean: patient trolley, right from telephone, bedside locker, chair. It is cleaned in the morning, cleaned in the evening. Whether it's not cleaned, whether it is these instruments are not present in the ICU. Following which, high touch surfaces. What are called as high touch surfaces? Surfaces that are frequently touched. Example, door handle, okay, and a syringe IV pump, monitor control buttons, monitor touch screen. So these are called as high touch surfaces. The frequency of cleaning will be morning, evening, night, 3 times a day. So high touch surfaces you have to concentrate more to clean, because these are get frequently contaminated easier. So having environmental cleaning. So environmental cleaning should be done not only for the floor, every equipment which is present in the surrounding of the patient. Now coming to the standard precautions, safe linen laundry. So soil linen, infected linen, and dirty linen. There are 3 categories of linen. So patient bedding should also be sorted and sent for proper washing. So what is soil linen? Blood stained or body fluids are called soil linen. What are infected linen? For example, bloodborne pathogens, HIV, HBV, HCV. So these cases and isolated patients are called infected linen. So how will you send a soil linen or infected linen to the laundry? That is important. So you cannot mix all the linen together. So you have to sort and segregate. Soil linen and infected linen should go in a bag with biohazard symbol to the laundry so that the laundry person identify this linen is highly infectious. Probably it is soiled with blood, or it is used for a patient, a high risk patient like HIV, HBV, HCV. So what he will do, he will disinfect it separately, either with sodium hypochlorite and then further taking for normal washing with detergent. Used linen can go in green bags. So similar, this all sorting, disinfection, then washing, then extracting, then drying. If there is damage for linen, it should be repaired or other discarded, ironed, and then sent to central store area. So this is the flow chart how you do the linen management. Sorting of linen should be done at the point of generation itself. So it is the one who has removed and changed the bed sheet for the patient should do the segregation at the point of generation itself. Okay. These are the laundry bags that you use for collection of laundry. Dirty linen, this is always also called as dry linen or used linen. This is all wet linen, like soil linen and infected linen. Then sharp safety. Little more just a few slides for sharp safety. This is very important because you commonly giving treat medications, parenteral medication to the patient. You are handling needles, syringes. So there are many chances that you get the needle stick injury, right? Even though you wear a glove, you can prick yourself, and sometimes mucocutaneous splash. The splash blood body fluids can splash into your eyes, can splash into your mouth or nose. So these are called as mucocutaneous splash. So what is the risk if you get a needle stick injury, or if there is any bladder body fluid splash? What is the risk? There are we are concerned about only 3 blood-borne pathogens. What are they? Whenever you get a injury, one is HIV, HBV and HCV. So if the source patient from whom you have got a needle stick injury, or if the source patient is seropositive and you got a blood splash from the patient, then you are having a risk to get that blood-borne pathogen. So that is where we are very concerned of. What is the risk of transmission after a needle stick injury? So it is hepatitis B virus. It is 30%. But we are lucky that hepatitis B virus is vaccine preventable. So once you take 3 doses of hepatitis B vaccine, after 1 month you have to check the antibody titer, whether you are immune. So if the antibody titer for hepatitis B virus is more than 10, then you are immune, which means that even if you get a splash from a HBV positive patient, you will not get the disease, right? But only thing, after getting 3 doses of vaccine, you have to check your antibody titer. If it is more than 10, then you are immune. So we are safe with HBV virus. Are you right? But only thing, we have to take the vaccine. The next is hepatitis C virus, 3% transmission risk. Do we have any vaccine for hepatitis C? No. Similarly, we don't have a vaccine for HIV also. So this time we can do follow-up testing so that whenever we get ourselves positive, we have to start the treatment. That is the only option left for HCV. Whereas for HIV, you can immediately start the PEP drugs. PEP drugs means post-exposure prophylaxis drugs for HIV is available. So if you get a positive patient, needle stick injury, or from a mucocutaneous splash from a HIV positive patient, within 2 hours, what is the time frame for giving at least 75% protection for not getting the infection is you have to start the PEP drugs for HIV within 2 hours. So what are the things when you get a needle stick injury? You get a needle stick injury when you are giving injection to a patient, the patient suddenly moves. Then there is a chance you get a needle stick injury. Recapping. Recapping of needles is a bad practice which I have seen, where very easily you can go for a needle stick injury. So what is the other option without recapping? One hand technique. You have to place the cap on a table. The tip of the needle, you have to lift the cap, insert, and slowly upright the syringe so that the cap falls over the needle and then you can fix. That is called as one hand technique. Never recap a needle or else you are prone to get the needle stick injury. Transferring body fluids between containers, that also can cause a injury, and failing to dispose the used needle in the puncture-proof container. That is a simple negligence where after using a sharp without putting in puncture-proof container, if you leave it on the patient trolley, what happens? The sharp is left unattended. The next staff comes, he or she doesn't know the needle is lying there. Suddenly he will go and grasp something and get an injury. So you are putting another nursing staff in danger because of your simple negligence of not discarding the needle in the puncture-proof container. So never ever in your future you have that practice of leaving the needles open on the bedside of the patient. So whenever you get a needle, discard it in the puncture-proof container and make your colleagues also give safety to them also. So this is a never recap, and you have, this is called a puncture-proof container where you have to, when it is 3/4 filled, you have to discard. So what you have to do when you get a needle stick injury? First thing you have to attend and give a first aid to your injury. So if it is a needle stick injury in a hand or any other place where you can wash with soap and water, first thing you have to wash the needle stick injury site with soap and water. Okay? What happens if you get a splash? Then can you put soap and water in your mouth and eyes? No. You can only splash plain water from the sink. If sink, clean water should be there. If you don't have access to clean water, you can use a normal saline IV fluid bottle and rinse your eye at least for 10 to 15 minutes. Roll your eyeball so that all part of contaminated particles are removed. And after doing first aid, what can you do next? Immediately inform your ward in charge. Then immediately go to the casualty, inform the duty doctor, and make sure that you give information to the infection control team who are going to track the source. Okay, you have to know whether the source from which you have got a needle stick injury or mucocutaneous patch is a positive patient. So you have to contact the infection control team, track the source patient, test a sample, you have to get it, and after getting a consent. So we all know, we're doing a HIV testing, we should get a consent from the patient. So you have to inform the patient, so and so staff has got a needle stick injury, so we want your sample to do the testing. So get the sample from the source patient, run it in the laboratory, find out whether the source patient is having any HIV, HBV, HCV in the disease. If the source is negative, you need not worry. But if the source is positive, what else you have to do? You have to take the post-exposure prophylaxis, right? So already I have discussed about reporting. What are the fluids that are very infectious, like blood, body fluids, all cerebrospinal fluids, vaginal secretions, pleural fluid, pericardial fluid. Every body fluids can have these virus. So not only blood, if you have a mucocutaneous splash with any of these body fluids, it is to be followed up, right? This is called as non-intact skin. Now, for example, you get a splash on the intact skin. Like skin, you get for example, a HIV positive blood has, one drop has fallen on your intact skin. Then will you get infection? No, because skin is very protective. You need not worry. You just have washed with soap and water. Nothing to worry. But if you have an ulcer in non-intact skin, which is called as like small ulcers, and if the blood falls on these ulcers, then there is a slight risk of getting the infection. It's better to start the PEP if the source is known positive HIV patient. So for HBV, what is the PEP you can give? You can go for a vaccine, and immunoglobulins are there. If you are not vaccinated, for example, you have not taken completed the course of 3 doses of hepatitis B vaccine and you got a exposure from HBV positive patient, then there is PEP, there is post-exposure prophylaxis available. You can get the 1 dose of vaccine along with immunoglobulins. Immunoglobulins are costly, but definitely it will give protection from you getting the infection. And how many within 24 hours. For HBV, within 24 hours you have to get the PEP, post-exposure. For HCV, no PEP available, only you have to do follow-up testing. For HIV, PEP is available, tablets, which can be taken in 2 hours. So these are same thing I have discussed already. For HIV drugs, I told 2 hours you have to take, but suppose you have not able to get the drugs within 2 hours. The maximum at least within 72 hours you have to take the PEP drugs. Another standard precautions is following a aseptic technique. Madam is talking aseptic technique while inserting Foley's catheter, aseptic technique, peripheral cannula insertion, aseptic technique. What is this aseptic technique? That will clear your doubt in this slide. So perform hand hygiene, that is one component of aseptic technique. Maintain a sterile field. So the work environment should be clean. Do proper skin preparation before inserting or puncturing the skin. And what are the key parts? So these are the key parts. You have to protect them from being contaminated. For example, the tip of the needle is a key part. The tip of the syringe is a key part. The ends of the IV administration set is a key part. So never let the ends being fallen down or touch the bedding or touch the trolley. So these are the ways how you transfer the bacteria from the tip directly into the bloodstream of the patient. So you have to do protecting the key parts. So that is all these put together is called as aseptic technique. Injection safety, one needle, one syringe, one time. I think everybody is aware with this. No reuse of syringes. Even for the same patient also, except for the insulin, other syringes, medication, you discard, right? And never share from IV bag. Never share the same IV fluid bottle withdrawing the normal saline for more than one patient. So never share from the same IV bag. If you are using a multi-dose vial, try to dedicate it for the single patient. So safe injection practices also, you should need a clean workspace, hand hygiene. So I'll show one photo. See, this is a photo where a clean environment, a workstation for preparing the medication should be clean. Can you see IV administration set with an IV bottle lying there? All the needles, syringes, caps, everything lying in an unclean way for preparing medication. So this is not a safe injection practices. You have to maintain a clean workstation. Have a tray, clean it with some disinfectant, then start. Okay? So this is regarding cleaning disinfection only. You can classify the equipments as 3 types, that is called as Spalding's classification. So any equipment which is called as a non-critical equipment, for example, stethoscope, BP apparatus, it is only having contact with the skin. So that equipments are called as non-critical equipments. For that, a low-level disinfection is enough. Whereas if there is a contact with the mucous membrane, for example, endoscopy, in those things, it will lead a high-level disinfection. For endoscopy, you need glutaraldehyde disinfection. Or lastly, for sterile area, if there is a contact like instruments like doing surgery, so therefore that glutaraldehyde is not enough. For that, you have to do proper sterilization, that is doing autoclave or ethylene oxide sterilization to remove the bacteria, including the spores. This is called as Spalding's classification. And last but not the least, all vaccine prevention is one area you're breaking the chain of transmission of infection. So all get vaccinated with hepatitis B and TT. Thank you for being a long section.
Thank you, ma'am, for your valuable presentation.
If you have any doubts also, you can ask me regarding the needle stick injury, because you are going to into practice. If you have any fears or any doubts, you can ask me.
Regarding which year there will be more after COVID, more precautions. That's why which year there will be
WHO. 2000, I think 2011 they start, hand hygiene is implemented from long back. 2011 it was introduced by WHO guidelines. Yes, sir.
Even nowadays after 2018, NAT also criteria like that. Which hospital all are will be WHO only protect, madam?
No, sir. It is up to us to follow which guidelines we want. Kayakalp gives environmental cleaning guidelines, hospital infection control. That is given by the Ministry of Health.
Yes,
So that is a standard guidelines. You can follow Kayakalp guidelines. WHO is an international guideline. CDC, Center for Disease Control, is another international guideline. All these are standard guidelines. Anyone you can implement and follow.
But which, for example, where consumer, which is very best you are practicing?
Sir, you can go with Kayakalp, sir. It is our Indian guidelines given by our Ministry of Health. For low economic status also, hospitals, these guidelines are designed by our Ministry of Health and Family Welfare.
Then some of the hospital and all, then Western countries follow, CIPLA, like separate guideline for ICU protocol.
CIPLA has guidelines, I don't know, sir.
That one wording,
Center for Disease Center, maybe? CDC?
CDC, and one more, the ICU set up in cardiac arrest, that word.
ICU set, everything it is there, sir. You can, depending on which guidelines you prefer, for each thing it is like mandatory. WHO, always it is hand hygiene.
Yes, madam.
For CDC, there is a surveillance definition. For COTI, CLAPSI, VAP, which I discussed in the transmission-based precautions. So they have defined the surveillance definition.
Sorry.
When you can say the patient is having a COTI. So that surveillance definition and a national network and all the surveillance forms, we get it from CDC. They have defined and given it clearly. For ICU protocol, cleaning, disinfection, everything, Kayakalp has given it correctly.
Yes, ma'am.
So all these are standard guidelines, sir. For each one SOP, I have followed different guidelines, sir. If you go for NABH,
yes, madam.
you have the NABH standards with you?
Yes, madam.
Yes. So after every standard, they are themselves giving the reference where you have to go for guidelines.
Yes, madam.
For antibiotic stewardship, they recommend WHO guidelines. For WHO hand hygiene, NABH says go for you can read it, sir. And the end, for example, HIC standard 1.
Yes, madam.
They will give what references you have to read up, what guidelines you have to implement. So everything is given in NABH standards, sir.
Yes,
reference, everything is given.
Indian government is suitable for things.
Which is your suitable.
Yes.
They will give 4-5 options. SHIA guidelines are there.
Yes.
National nursing safety guidelines. Whichever you like, you can follow, sir.
Okay. Thank you, madam. Thank you, madam.
Thank you, ma'am.
Thank you. If you are not immune, then you have to go for that. So actually 3 doses are mandatory. First, second and third dose. After 5 years, they are saying to go for a booster if your antibody level titer is less than 10.
So every 5 years we have to check for
You have to first check your antibody level, madam.
Okay.
First you check if it is less than 10, then definitely you should go for a booster. If it is adequate, for example 25 or 30, 35, then you need not go for a booster.
Okay, okay.
Immune.
Thank you.
Sorry, thank you.
Thank you, ma'am. To honor our fourth speaker, I request our organizing chairperson to present the certificate and the organizing secretary to present the memento. Thank you so much, ma'am. Enfermeros are there when the first breath is taken, and enfermeros are there when the last breath is taken. Have you all noticed I have used a different word now? The word is enfermero. Anisha, do you know the meaning of that word?
Yes, of course, but our delegates may or may not be known about this. So can you please describe it?
Of course, my pleasure. In Spanish, the nurses are called as enfermeros. So we all are enfermeros present over here. I think information will be useful to you all. Thank you. So, I think everyone is hungry, right? Let's refill our tummy with a delicious food prepared for you all.
See you back shortly.
Thank you.
எல்லாரும் லஞ்ச் ஹாலுக்கு வாங்க. லஞ்ச் சாப்பிட்டுட்டு மறுபடியும் வந்து ஒரு டான்ஸ், அதுக்கப்புறம் உங்களுக்கு என்டர்டெயின்மெண்ட் நிறையா இருக்குது. ஒரு 3 செஷன் இருக்குது. ஓகே, தேங்க்யூ ஸோ மச்.
முன்தினம் பார்த்தேனே பார்த்ததும் தோற்றேனே சொல்லனை கண்ணால நெஞ்சவும் பொன்னானது இத்தனை நாளாக உன்னை நான் பாராமல் எங்கே நான் போகேனோ நாட்களும் வீணானதே வானத்தில் நீ வெண்ணிலாய் ஏக்கத்தில் நான் தேவதா இப்போது என்னோடு வந்தால் என ஊர் பார்க்க ஒன்றாக சென்றால் என இப்போது என்னோடு வந்தால் என ஊர் பார்க்க ஒன்றாக சென்றால் என முன்தினம் பார்த்தேனே பார்த்ததும் தோற்றேனே சொல்லனை கண்ணால நெஞ்சவும் பொன்னானதே இத்தனை நாளாக உன்னை நான் பாராமல் எங்கு நான் போகேனோ நாட்களும் வீணானதே.
கண்மணி அன்போடு காதலன் நான் எழுதும் கடிதமே பொன்மணி உன் வீட்டில் சௌக்கியமாய் நான் இங்கு சௌக்கியமே உன்னை எண்ணி பார்க்கையில் கவிதை கொட்டது அது எழுத நினைக்கையில் வார்த்தை முத்தது ஓஹோ கண்மணி அன்போடு காதலன் நான் எழுதும் கடிதமே பொன்மணி உன் வீட்டில் சௌக்கியமாய் நான் இங்கு சௌக்கியமே உந்தான காயமெங்கும் தன்னாலே ஆறிப்போன மாயம் என்ன பொன்மானே பொன்மானே என்ன காயமானே போதும் என் மேனி தாங்கிக் கொள்ளும் முந்தன் மேனி தாங்காது செந்தேனே என்ன காதல் என்னவென்று சொல்லாமல் எங்க எங்கே அழகே வந்தது எந்தன் சோகம் உன்னை தாங்கும் என்னென்றும் போது வந்து அழகே நின்றது மனிதன் உணர்ந்து கொள்ள இது மனித காதல் அல்ல அதையும் தாண்டி புனிதமானது
அபிராமியே தாராட்டும் சாமியே நான் தானே தெரியுமா சிவகாமியே சிவனில் நீயும் பாதியா அது உனக்கு புரியுமா
சுபலாலி லாலி லாலி லாலிலே சிவகாமி லாலிலே லாலி லாலிலே
ஓஹோ கண்மணி அன்போடு காதலன் நான் எழுதும் கடிதமே
லாலலா லாலலா லாலலா
பொன்மணி உன் வீட்டில் சௌக்கியமா நான் இங்க சௌக்கியமே
லாலலா 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 லாலலா.
Thank you, students, for your mesmerizing and melting song. Another song will be performed by them.
உள்ளதை சொல்கிறேன் உன்னுக்குள் சேர்ந்திட நான் எதிர்பார்க்கிறேன் இமைகள் மூடி அருகினில் வா
Thank you, students, for your melting performance. Our students are waiting here to entertain you. We have a skit to be performed by a third-year BSc Nursing students, SKS College of Nursing, which is loaded with full of comedy. Sit back and enjoy.
வணக்கம். ஓகே, இன்றைக்கி நம்ம என்ன பார்க்க போறோம்னா, ஊரில் எவ்வளவோ பிரச்சனை இருக்குது. ஆனால் இன்றைக்கி நம்மள தெரிய 2 பிரச்சனை வந்திருக்கு. ஒருத்தங்க என்னன்றாங்கன்னா நாட்டு மருந்து தான் கேட்டுன்றாங்க, இன்னொருத்தங்க என்னன்றாங்கன்னா மாடர்ன் மெடிசன் கேட்டுன்றாங்க. ஸோ அதனால் 2 பேர்த்தையும் கூப்பிட்டு வச்சு பேசிடுவோம். ஸோ இப்போ ஃபஸ்ட்டு வந்து யார் ஃபஸ்ட்டு வந்து பேர் மங்களம். பேரே மங்களமாக இருக்குது, அவங்களை கூப்பிட்ருவோமா? மங்களம், கொஞ்சம் மேலே வாங்க.
I'm very happy. Start music.
வணக்கம்மா.
ஓ, வணக்கத்துக்கு குப்பையில போடு. எனக்கு அடுத்த ப்ரோக்ராம் இருக்கு, சீக்கிரம் பண்ணு.
அடுத்த ப்ரோக்ராம் இருக்கு, நல்லா அழகாக கூப்பிட்டுருவோம். சரி, அவங்க துணைக்கு யாருமா வந்திருக்காங்க?
என் கூட 6 படையப்பா வருவார்னு நினைச்சேன், ஆனா வெறும் படையப்பா வந்துட்டான்.
படையப்பாவா? பேர் நல்ல பேரை தான் வச்சு கூட்டு வச்சு பார்த்துருவோம்மா. படையப்பா மேலே வாங்க.
நதுதனா திரணனா நதுதனா தன திரணனா திரணா நதுதனா நதுதனா நதுதனா.
அடச்சி, ஐயோ, இவனோட எனக்கு பெருந்தொல்லை. இவன் வந்தாலே
உங்க ஆளு தானே?
ஏய், ஆளுன்னு சொல்லாத.
சரிம்மா, சரிம்மா. இப்போ உங்கள் ஆப்போசிட் டீமை கூப்பிட்ருவோம். பேர் நாகரிக மாலா. எவ்வளோ நாகரிகமாக இருக்காங்க பார்ப்போம். நாகரிக மாலா மேலே வாங்க. பாருங்கம்மா, எவ்வளோ நாகரிகமாக இருக்காங்க.
நாகரிகத்தை பார்த்தாலே தெரியுது எங்கே வச்சு கும்பிடுதான்னு.
அம்மா, அதாம்மா மாடர்ன் ட்ரெண்டு. என்னம்மா இப்படி இருக்கீங்க ஒன்றும் தெரியாமல்? சரிம்மா, உங்களுக்கு உங்கள் துணைக்கால் யார் வந்திருக்காங்க?
என் கூட ஜிம் போடியான ஜிம்மி வந்திருக்காங்க.
ஹலோ.
சரிம்மா, நான் கூட ஜிம்மி இன்னும் நாய் வரும்னு நினச்சிட்டேன். ஆள் தான் வந்திருக்காங்க. சரி, இப்போ நம்ம எதுக்கு இங்கே வந்திருக்கோம் தெரியுமா?
ஏன்டி ஆளை பார்த்தா போஸ்ட்மார்ட்டம் பண்ண வந்து டெட் பாடி மாதிரி இருக்கான், இவன் தான் ஜிம்பாடியா?
அடச்சி, இந்த நேரத்தில் கையை விடுதான்.
சரி விடுமா, ஒரு பேர் சண்டை அப்புறம் பேசிப்போம். சரி, இப்போ நம்ம எதுக்கு வந்திருக்கோம் உங்களுக்கு தெரியுமா? சரி, நானே சொல்கிறேன். இவங்க என்ன சொல்கிறாங்கன்னா ஓல்டு மெடிசன் தான் கேட்டுன்றாங்க, நீங்கள் என்ன சொல்கிறீங்க மாடர்ன் மெடிசன் கேட்டுன்றீங்க. ஸோ 2 பேர்த்தையும் பேச வச்சு முடிவு பண்ணணும் எது கரெக்டுன்னு. ஓகேவா?
கால் வருது,
கால் வருது,
கால் வருது,
ஜிம்மி கால் வருதுடா பாரு.
ஐயோ,
கால்ல வரலமா?
அட, இவன் காலை விட்டு நோடமா தள்ளி
தள்ளி அம்மன் இருக்குமா? கும்பிடுங்க கும்பி. எப்போ பார்த்தாலும் எதாவது கட்டிக்கிட்டே ஏமா இப்படி பண்ணுறீங்க? அன்டீசெண்டாக பிஹேவ் பண்ணுறீங்க. தலை வலிக்குதுரா, இன்னும் என்னெல்லாம் பகிர்ந்த பொண்ணு தள்ளி இன்னைக்கு. சரி, இப்போ நான் ஆரம்பிக்கிறதுக்கு முன்னாடி ஒன்று சொல்லிடுறேன். எல்லாம் பக்கத்தில் வாங்க. நல்லா பார்த்துங்க, இங்கே இருக்கவங்க எல்லாரும் ராஜபரங்க சேர்ந்தவங்க. அதனால் பார்த்து பக்குவமாக பேசணும். இவங்க மனசு வச்சா நம்ம எங்கேயோ போயிடுவோம். ஓகேவா?
அப்படியா?
சரி, ஓகே. சரி, ஆரம்பிக்கலாம். சரிம்மா, இப்போ உங்களுக்கு இருந்து ஆரம்பி. நீங்கள் தான் வயசில் மூத்தவங்க வேறு. சரிம்மா, சிக்கன் ஃபாக்ஸ் வந்தால் நீங்கள் என்னம்மா பண்ணுவீங்க?
அட என்னப்பா கொஞ்சம் விளங்குற மாதிரி சொல்லுப்பா.
சரி, அம்மா போட்டால் நீங்கள் என்னம்மா பண்ணுவீங்க?
ஓ அம்மா நோய் போட்டாப்பா.
ஆமாப்பா.
அம்மா நோய் போதான்னு பார்த்தா இப்போ எங்கள் காலத்து வைத்திய முறை பார்த்தானா மஞ்சள் வேப்பலை அரைச்சி தண்ணியை ஊற்றி பிள்ளைய குளிக்க வைப்போம். அதுக்கடுத்து அவங்களுக்கு வந்து நல்லா குளிர்ச்சியாக கொடுப்போம், சூடாக காரமாக எதுவும் கொடுக்க மாட்டோம். அவங்கள வந்து தனிமையாக வச்சுக்கிடுவோம்ப்பா.
சரிங்கம்மா, நீங்கள் சொல்லிட்டீங்க. இப்போ ஆப்போசிட் என்ன சொல்கிறேன்னு கேட்போம். நீங்கள் என்ன பண்ணுவீங்க?
நாங்கள் வந்து டயக்னோஸ் பண்ணுவோம், அதுக்கப்புறம் ஐசோலேட் பண்ணி வைப்போம், அதுக்கப்புறம் ஆன்டிபயோட்டிக்ஸ் கொடுப்போம், அது கூட சேர்த்து ஓயின்மெண்ட் கொடுப்போம். எதுக்குன்னு தெரியுமா? பிம்பிள்ஸ் எல்லாம் வரும்ல, ஏன் ஃபேஸ் மாதிரி கிளியராக வைக்கணும்ல ஃபேஸ்.
பார்த்தாலே நல்லா தெரியுது எவ்வளோ கிளியராக இருக்குன்னு.
பாரு உன் கண்ணு முன்னாடி 2 பேரும் என்ன பண்ணுதாங்கன்னு பாரு.
சின்ன சிறுசுங்க அப்படி தான் இருப்பாங்க. நீ ஏமா பேசுறீங்க வயசான காலத்தில்? சரிம்மா இருங்க. சரிம்மா, இன்னொன்று கேள்வி கேட்குறேன். சாப்பாடு நீங்கள் என்ன கொடுப்பீங்க அம்மா போட்டுருந்தா?
சாப்பாடாப்பா, சாப்பாடு இப்போ எங்கள் காலத்தில் வச்சு பார்த்தோன்னப்பா எல்லாமே இருக்குது. சோளச்சோறு அதுன்னு பார்த்தோன்னா சக்கரை நோயே வராதுப்பா. அப்புறம் கம்மங்கூழ் கேப்பக்கூழ் அந்த மாதிரி சத்தான பொருளை தான்ப்பா நாங்கள் கொடுப்போம். நாங்கள் எப்பவும் சத்தாக தான்ப்பா கொடுப்போம்.
சரிம்மா, இப்போ அவங்கள்ட்ட கேட்போம். நீங்கள் என்ன மேம் கொடுப்பீங்க?
இட்லி வடை தோசை பூரி சப்பாத்தி.
போதும் நல்லா சர்வெண்ட்டாக வேலை செஞ்சுருக்கீங்க உங்களை டாக்டருக்கு முன்னாடி.
பாருங்க எப்படி சொல்லுதான்னு பாருங்க. இப்படி இட்லி பூரி சாப்பிட்டா இப்படி பீப்பா மாதிரி இருக்கா நினைக்க.
அக்காவை என்ன சொல்றது பாரு, அடிடாவனே.
என்ன எங்க அக்கா உனக்கு பீப்பாவா? ஏய் ஏய் ஏய்
ஓ ப்ரோகிராம் மால என்ன அடி வாங்க
விடுவா.
நான் வரல.
வாவா பரவாயில்ல.
டா வரலடா.
டாவா
அதெல்லாம் ஃப்ளோல வரும்பா.
சரி வந்து நில்லு.
இங்க பாருடா, இங்க வந்துக்கிறவங்களா பெரிய ஆளுங்க, அதனால நம்ம சண்டை போடக்கூடாது சரியா?
யோ ஃபர்ஸ்ட் காலை கீழே போட்டு உட்காரியா.
சரி எழுந்திரிங்க அவங்க கொஸ்டின் போங்க. சரி ஓகே, இப்போ சண்டைலாம் முடிஞ்சிச்சா? அப்படியே ஆரம்பிக்கலாம். சரி, இப்போ 2 பேருக்கு நல்ல காமனாக ஒரு கேள்வி கேட்குறேன், எல்லாத்துக்கும் வரும். இப்போ ஃபீவர் வந்தால் நீங்கள் என்னமா பண்ணுவீங்க?
நீ வந்ததுலேருந்து புரியாமே பேசுதப்பா, என்ன புரிஞ்ச மாதிரி பேசுப்பா.
காய்ச்சல் வந்தால் நீங்கள் என்னமா பண்ணுவீங்க?
காய்ச்சல் வந்தால் இப்போ காய்ச்சல் வந்துச்சுன்னு வச்சுக்கேன். இப்போ எங்ககிட்ட நாட்டு மருத்துவம் இருக்குது, நிறையா இருக்குது, நிலவேம்பு குடிநீர் இருக்குது, அந்த மாதிரி கசாயம் இருக்குது, அது போடும். அது மட்டும் இல்லை, எங்கள் காலத்து சாப்பாடு முறை பார்த்தோன்னா மிளகு, அந்த மிளகை நச்சு இடித்து ரசம் வச்சு கொடுத்தா சளியும் போயிடும் ஆளும் போயிடும்.
ஆளு போயிடுமா?
இல்லை காய்ச்சல் சரியாக போகணும்.
சரிம்மா நீங்கள் என்ன பண்ணுவீங்க?
நாங்கள் ஃபஸ்ட்டு வந்து வயிற்றை செக் பண்ணுவோம், ஒரு 3 days ஆன்டிபயோட்டிக்ஸ் எல்லாம் கொடுத்து பார்ப்போம். மெயினாக என்ன கொடுப்போம்டா?
பேராசிட்டமல் கொடுப்போம். அதே மாதிரி அந்த கொரோனாவே வந்தாலும் நாங்கள் சாம்பிள் எடுத்து அது எல்லாத்தையும் க்யூர் பண்ணிடுவோம்.
சாம்பிள் எடுத்து இங்கே பாருடா, எல்லா நோய்க்கும் சாம்பிள் எடுத்து பார்க்காங்களாம், அது என்னன்னு போய் பாருடா.
இப்போ பாரு ஒரு ரியாக்ஷன்.
அட பாவி, என்ன பண்ண போறோம்?
சிஸ்டர் கொஞ்சம் கிட்ட வாங்க.
புது புடவை அடியே, என் புடவை கை வச்சு கை கால ஓடி பண்ணி
போதும் இதையே முடிக்க முடியாது. ஏமா இப்படி அன்டீசெண்டாவே இருக்கீங்க?
அது போகல அன்டீசெண்டா இல்லை, நான் அன்டீசெண்டா இருக்கேன்.
சரி, உங்கள்கிட்ட சொல்லி ஒன்றும் ஆக போதில்லை.
ஆமாண்டி.
என்னது?
ஆமாம் ஆண்டின்னு சொன்னேன்.
நீ வந்ததுலேருந்து பேசிக்கிட்டு இருக்க.
சரிம்மா, 2 பேர் சொல்லிட்டீங்க. ஏதாவது கேட்குறேன். சரிம்மா, இப்போ நீங்கள் என்ன சாப்பாடு கொடுப்பீங்க? வயசில் மூத்தவங்கள்ட்ட கேட்டுருவோம், நீங்கள் சொல்லுங்கம்மா.
சாப்பாடுன்னு பார்த்தோன்னா நாங்கள் வந்து அந்த காலத்துலேயே சத்தான சாப்பாடு தான்ப்பா கொடுப்போம். கம்மங்கூழ் கேப்பக்கூழ் அந்த மாதிரி எங்கள் காலத்தில் சாப்பிட்ட ஆளுக்கு சாப்பாடு தான் நாங்கள் கொடுப்போம். அது நம்ம சத்தாக தான் நாங்கள் கொடுப்போம்.
சரிம்மா. சரி, நீங்கள் என்னெல்லாம் பண்ணுவீங்க ஹாஸ்பிட்டலில்?
எல்லா சாப்பாடும் கொடுப்போம். அதே மாதிரி வந்து பார்த்தீங்கன்னா ஊசி போட்டு காட்டுவோம்.
ஏப்பா எப்போ பார்த்தாலும் வந்ததுலேருந்து நீனும் அவளுக்கு காட்டுவேன், என் கண்ணு முன்னாடி ஒன்று காட்டுங்க பார்ப்போம்.
காசு விழுந்துருக்குது உங்களுக்கு தான். காசு அங்கே விழுந்துருக்குது உங்களுக்கு தான் பாருங்க.
எங்கே விழுந்துருக்கு? ஐயோ குத்திட்டான்டா.
நீங்க நாம போட்டு காமி நீங்க
வச்சு குத்திட்டான்டா.
சரி விடுங்கம்மா, ஏதோ புதுசா குத்துற மாதிரி.
ஐயோ எனக்கு வேற ஒரு ப்ரோக்ராம் இருக்கு, சீக்கிரம் பண்ணிப்பா.
அப்ப என்னமா ப்ரோக்ராம் இருக்கு வந்ததுல?
அடுத்த ப்ரோக்ராம் என் ப்ரோக்ராம் சொல்வதெல்லாம் போய் வைக்காத கை.
நல்ல ப்ரோக்ராம்மா, நல்லா ஓட வேண்டிய ப்ரோக்ராம் தான். சரிம்மா.
அப்பா கேஷ் கிடச்சிச்சு, ஈவினிங் டீ குடிக்கலாம் சரியா? யாருக்கும் தெரியக்கூடாது சரியா? யாருக்கும் தெரியக்கூடாது.
சரிம்மா. சரி, நான் இப்போ என்ன தீர்ப்பு சொல்ல வரேன்னா, நான் உங்கள் மருந்து தான் சிறந்து நான் சொல்ல வரல, அவங்களுக்கு தான் சிறந்து நான் சொல்ல வரல. ஃப்ரெண்டுக்கு யார் யாருக்கு என்ன பொதுவாக தேவைப்படுதோ அதை அவங்க எடுத்துக்கிட்டோம். ஆனால் நான் என்ன சொல்கிறேன்னா, நம்ம என்ன சாப்பாடு எடுக்கணும் அதுக்கேற்ற மாதிரி நம்ம கண்டிஷன் இருக்கும். ஸோ ஆனால் நல்ல ஃபுட் எடுத்து நல்லா நம்ம ஹெல்த்தை மெயின்டைன் பண்ணிக்கணும். ஸோ தேங்க்யூ.
சரி வாண்டி, கை தாங்களா கூப்பிட்டு போகிறோம்.
அடைச்சி கையை விடியா.
Thank you students for your mind-blowing performance. I definitely believe you all will be enjoyed with this performance.
So let's move on to the 5th seminar session. Nurses dispense comfort, compassion, and caring without even a prescription. I would honorably welcome our organizing secretary to introduce our fifth speaker.
குட் ஆஃப்டர்நூன் எவ்ரி ஒன். எல்லோரும் நல்லா லஞ்ச் சாப்பிட்டோம். இப்போ வந்து தூக்கம் வந்துவிடலாம் உடனே, அதனால தான் ஒரு சின்ன ரெஃப்ரெஷ்மெண்ட். இன்னொரு 1 hour கழிச்சு இன்னும் அதிகமாக தூக்கம் வரும், அப்போ இன்னும் நிறையா கொடுக்கும். ஓகே, எல்லோரையும் வந்து தூங்க விடாமல் வந்து லிசன் பண்ண வைக்கிறோம். தேங்க்யூ ஃபார் யுவர் பேஷன்சி. ஓகே, நவ் ஐ வெல்கம் மிஸ்ஸஸ் கே திவ்யா ஹட்சன், Professor, St. Bonny White College of Nursing, Salem. Her total experience is 10 years. She completed her UG in the year of 2009 in Sharmila College of Nursing, Chennai. She completed her PG in the year of 2014 in Shiva Parvati Mantra Daya Health and Science, Erode. She started her career as a assistant lecturer, associated professor in various institutions, and currently working as a vice principal in St. Bonny White College of Nursing, Salem. In the year of 2023, she awarded by Dr. MGR Medical University for RRC unit by St. Bonny White College, Salem. She organized and attended as a resource person and delegates for state, national and regional level from 2009 to 2024. Now I welcome Mrs. K. Divya Hudson to start this session. Welcome, ma'am.
Good afternoon, one and all gathered here for this conference. Thank you, Christy ma'am, for giving a nice introduction on me. And I want to thank Selvaraj sir, principal in SKS College of Nursing. And also I want to give a thanks to SKS management. And also I want to give a thanks to my management in St. Bonny White College of Nursing. And before in your college, the given topic is revitalizing nursing excellence and embracing best practice, innovative for an optimal care environment. Before going to my topic, first I will define what is nursing excellence. It is a nurse commitment to provide the highest level of quality care. When the patients come to the hospital, we should provide a highest quality care to the patients, for our patient that make a difference in every day. So while patients coming to the hospital, we should provide a quality care and holistic care and lovable manner. How to separate? Okay. Next we can move on the, will you operate? Next we can move on the objectives of nursing excellence. To ensure that nurse receive a consistent information regarding policies. Nowadays many policies and standards and procedures schemes, and the standards, procedures and documentations to support the practice and familiarize them with the vision. Vision is to accomplish the process, to the mission is provide a quality care by the hospitals and values and goals and organizational structure of a healthcare facility. Next we can move on the components. What are the components of nursing excellence? That is high quality care. Always the patient need high quality care. So we have to provide high quality care in the hospital setup and good communication. First, the communication is very important. While a patient is entering inside the hospital or ward or OP department, first the hospitality is important. That is, we are talking with the patients. What happened? What care you need? Which doctor suppose you have to meet? Okay, that is a good communication you should maintain with the patients. And also, while providing procedure, whatever procedure, the administration of medication, it is a simple procedure we will say in a nursing setting. In that setting also we have to do the procedures in the aseptic manner. the aseptic manner is previous resource persons are spoken, I think so. And the follow the protocols according to the protocols will be changed by the institution or different to the hospitals. They follow the protocols also. And also next, characteristics of nurse excellence. Analytical first plan, diagnosed and provide a care and implementation of the care. The analytical character suppose the nurse should have. And communication, already I thought communication is very important. Then cooperative means providing opportunity to the nurses in various settings like a hospital or society or tribal areas. Then coordination, the coordination is very important to provide a care in the hospital setting, the ICU or semi-ICU. Disseminated knowledge, the disseminated knowledge apply evidence-based practice findings and also research analytical findings. How we can apply the evidence-based practice and also the research findings through the through attending the seminars, conference, workshops and etc. And also the case through the case presentation also we can know that. And we should be empathetic and also evidence driven, innovative in thing and also introspective. Then excellence in nursing care. Actually, I took this photo from, I searched in the Google, I want the image from Tamil Nadu. I want to show the people who in Tamil Nadu, so I post that photo. The nurse who deliver excellent nursing care, implement nursing in a professional and competent manner, demonstrate a holistic approach to caring, possessing personal qualities which enhance practice to relate to patient, families, peers, and also providing care to the patient, the hospital administrators and also the community members also involved. The gold standard for nursing excellence, already I told that the holistic approach, we are providing care to the patient in the holistic manner and quality of care. That always the people or patients or person or subject need the quality of care and we should be accountable. We should be, as a nurse, we should be responsible in that particular place. And also continuous improvement of patient care. With the end of the care, with the end, the patient, when the patient feel comfort, when the patient receive the good satisfied care. Then qualities of good nurse, that is time management, flexibility, effective communicator, then optimistic, then it should be a critical thinker, hardworking and detail-oriented. The detail-oriented means in that ward, we have 10 patients in that ward, means we should know what from the patient name to till the end of the treatment, everything we should, as a nurse, we should know. That is detail-oriented. How do you achieve clinical excellence? That is, doctors can demonstrate clinical excellence by delivering the best possible treatment to their patients and also correctly diagnosing the illness, that is very important, and listening attentively to the patients. First, if the patient come to the hospital, first we allow the patient to talk, ventilate the patient to talk, allow the patient to ventilate their problem. Through that only we can know what problem, what need the patient want. And next, take a diagnostic, take a diagnostic procedure related to the disease. That is very important. Nowadays patients are telling that the diagnostic procedure is taken not related to my disease. Okay, that is very important. Diagnostic procedures taken related to the patient disease and empathizing with the patients, practicing effective teamwork and engaging in research and education and mentoring others. And benefits of clinical excellence to patients, that is high quality of care, improve patient satisfaction and increase stress of hospital. So increase stress of hospital and healthcare system. If the public trusting particular hospital means only the people frequently will come and take the treatment in that hospital. That is very important. And also cost effective medication and treatment. And benefits of clinical excellence for healthcare providers: satisfaction of in their work. That is very important. Satisfaction, okay. After providing care to the patient, okay, the patient relieved from particular pain, the patient will smile. Yes, from that smile we are so satisfied. Okay, we given a nice quality work, holistic care to the patient. Okay, and increase recognition. If the people are working in the hospital or institution, if they are work done perfect manner, we should recognize within their field. After seeing happiness from the patient, face feeling is fulfillment of their holistic care. Relationship between clinical excellence and patient satisfaction. Clinical excellence is strongly correlated with the patient satisfaction because it ensures that patient receive the best possible care and have the best possible outcome. That is, for example, nursing procedures. Maybe we can take an example of administration of medications and principles of nursing procedures. Principles of nursing procedures as a professor, while I am taking class in the laboratory, first I will say, for example, I can take an administration of medication. I will set the student to set the tray for administration of medication. What the student will bring only simple tray. Nowadays they are not telling about what the clean tray containing, this is a sterile tray containing, that also they are not telling. So we have to educate, we have to tell the patients, this is the clean tray containing. Suppose we have to keep all those articles, and also before administering medication or injection, first we should explain the procedure to the patient. First point we will tell, and also we will provide a privacy to the patient. Yes, students? Yes. Then first we will explain procedure, then provide privacy, then provide a comfortable position. Yes or no? Before going to do the procedure, we will say like that. That protocols we have to follow in the hospital also. Okay. And also nowadays all institutions are not competency to give a education about nursing, what they are studied in the book and what they are doing in the hospital setting. It is very different. Okay, compare the book thing and also the clinical setup. Okay, after completing a 4th year, okay, the student will go and join the particular hospital. Immediately the HR person will say, we will give a training for 6 months. Yes, we will give a training for 6 months or 3 months. After that, they will train up you as a clinical setting. Okay. That is thing. And also patient feedback. And also, what role does leadership play in promoting clinical excellence? Leadership plays a critical role in promoting clinical excellence by setting a vision. Every hospital, corporate hospital, or small clinics have visions and culture that values quality patient-centered care and continuous improvement. And leaders can also promote clinical excellence by providing the necessary resources and support to healthcare providers, and by holding themselves and their terms accountable for achieving high standard of practice. Actually, these slides will say that it is a teamwork will success to save the patient life. See, in that I post that image, that is this color coding that we are following in the hospital. Okay, so we can take the example of code blue. Okay, if the cardiac arrest patients came to the casualty or intensive care unit, immediately they will announce what? Code blue, code blue, code blue. 3 times they will announce. In that time, the team members, wherever they are, they will come to the casualty immediately. They will give care to the patient. They will secure the patient life. Yes? Okay. Nursing excellence standards. set the complete set of standards of evaluation of nursing service in grant of certification, that is NABH, and standard nursing procedure manuals we are following to give a care to the patients, and framework for quality of care for patient and quality improvement of nursing service models. Nowadays many models are also we are following. Simple model I wrote, Roy adoption model. Okay, so Roy adoption model, if the patient came for the hospital with the complaints of fever, first we will check the monitor the temperature and we will provide a cold compress. Yes or no? The basic procedure, the cold compress at administration of medications. Okay, this treatment is effective means it is good. If treatment is positive means again we will go to the first one. We will provide the cold compress and administration of medications. Then help to build quality culture at all level of hospital. I will finish fast, okay? I won't bore you people, I think so, okay? After having lunch, okay. So ways improve your clinical skills, that is population management, care coordination, beneficiency engagement, patient safety and practice assessment, achieving health equity, emergency response, preparedness, integrated behavioral mental health, and expanded access to care. Okay, how to promote nursing excellence, how to improve the nursing excellence. Professional development, striving to increase the certifications. If the people are completed DGNM, try to study in post-basic nursing and study in MSc nursing to improve the qualification and continue and formal education course. Nowadays many various courses are there, okay. So in that you have to study, and membership with the professional organization. According to the nursing, the professional organization, Student Nurse Association, in your college it is there, I think so, SNE to TNAA, Trained Nurse Association of India, we have to register in that organization. And also emphasize nursing role in the community towards improvement of health to the community by various, nowadays community health nurse, okay, community health, many posters are giving by the government for the DGNM and ANM and BSc nursing. So next we can see criteria of nursing excellent, that is first one nurse resource management, second one nursing care of patients, third one management of medications, fourth one education, communications and guidance, fifth one infection control practice, and sixth one empowerment and governance, last one nursing quality indicators. So nursing resource management is to acquire, provide and retain and maintain, acquired and provide and maintain competent nursing staff, right member to need the patient and community served by the organization. And also here that after completing the course we are registering as a registered nurse and midwife in Tamil Nadu Nursing Council. Yes or no, as a nurse, okay, we are registering. And also for the doctors also we have the registration, they are registered in IMA, that is Indian Medical Association, and also Tamil Nadu Medical Association. And standard of nursing resource management, the organization will have a documented system. See, nowadays document system is going on, and the organization process structure and process for inductions, and the organization will have process in place in service education they are conducting, and continue nursing education, that is CNE, it is under Tamil Nadu Nursing Council, our registrar ma'am is following. And also this is a process for credentialing and privileging of nursing personnel. Permitted to credentialing means we are assessing and we are securing those who are the health care providers and provide care to the patient without supervision. Then the nursing resource management, the NRM1, the organization has a documented system of nursing resource planning. Second one, the organization has a structure and process for induction program and for induction programs then for enhancing the transition of novice. Who is novice? What is meant by novice? Yes? Novice, student nurse. Okay. So novice, 2 competent nursing professionals. Okay. Next, NRM3, the organization has process in place for induction training, in-service education, continuing nursing educational programs, and for documentation for the same in the personal file. And in RM4, in that there is a process of credentialing and privileging of nursing professional permitted to provide, already I told, the permitted to provide a care without supervision, and appraisal system for evaluating the performance of nursing staff exist as an integral part of nursing resource management, and there is a provision of acknowledging outstanding performance and contribution of nursing personnel. Next one. Next one, nursing care of patients. Nursing care of patient, it is a method which focus on information and facts about patients. Okay, so we should focus on information about the patient's disease conditions, social and personal history, and application of knowledge written in nursing care. So for example, the patients came for pain in the hand. Okay, simply they came for a pain in the hand. As a physical examination, we have 2 types. That is only general physical examination and focus oriented physical examination. As a nurse, general physical examination, we will ask a question, where you have pain. The patient will say simply, I have pain in my hand. Okay. At focus oriented examination, to the inspection or to the palpation, we are touching the patient, we are focusing particular area. Oh, in hand, this place you are getting pain. Like that we have to assess and we have to provide a care to the patients. Okay. And nursing care is a specialized package of support delivered by specially trained care and overseen by the qualified clinical nurse. And nursing care management. And nursing care management, everyone, actually my topic is everyone know as a nursing students, okay, and also my dear colleagues. The nursing care management is defined as a process of planning, organizing, activating and controlling and managerial function of nursing in order to determine, accomplish the objectives of nursing care. In the objectives of nursing, while we are writing the nursing care plan, first we will write the assessment, yes. Next we will write the diagnosis. Next we will write the objectives, yes or no. The objective data we will write and subjective data we will write. Objective data, the patient says that, subjective data, the patient says that, objective data, what the nurse will perceive from the patients after the treatment and before the treatment. Clear? And nursing care of patients, a nursing manual shall be established. See, nursing manual, according to the manual only we are following. We have the structure manual established and reviewed periodically as defined by HCO, Human Care Organization. Okay, HCO means Human Care Organization. NCP 2, assessment and reassessment shall be done by nursing professional as per prescribed format. We for that for all the care, everything we have format. As per format we have to do the assessment and also the reassessment. And information is exchanged and documented during. See, this is a communication gap we will feel. Information is exchanged and documented during each shift, staffing shift and during transfer between unit and department. Yes or no? Yes or no? Many nurses are suffering in this because of the communication gap, not aware of patient details, and that time what happened? Not able to administer medications, not able to administer injection, and not able to prepare the patient for the OT. Okay, and also there shall be established policies and protocols for vascular access device, and nursing care of patients shall be supervised by senior nursing professionals, and nursing care of vulnerable persons. Vulnerable patients means that may be elderly, children, physically, mentally challenged people, supervised by senior nursing professionals. Here நான் நிறைய சொல்கிறேன், we supervised by senior nursing professionals, but nowadays our students are not like that. They want to do all the things their own way, I think so, yes. But all things are supervised by senior and experienced professionals. The nursing care of patients under restraints, pain management, restraints, pain management, end care life, and practice, everything will be supervised by senior nursing personnels. Next, management of medications. Identify of required medication and store will be done and supervised by nursing staff made responsible for these functions, and storage of medication in the ward, other therapeutic areas shall be supervised by responsible nursing personnel. So, and also monitoring of the patient after medications and administration supervised by responsible personnel which were posted in particular area, not particular area, that particular ward, okay, particular ward or particular unit. The nursing professional must report near misses medication errors. See, this is very important actually in the hospital setting. Medications error and adverse effect events as per policy of HCO for analysis by the appropriate staff predefined and identified by the HCO, and preventive measures be taken by the senior personnel which are posted in that particular hospital. And the organization shall ensure that it has a policy on verbal orders which will be applicable to doctors also. Nursing profession, the policies are the human care association policies are applicable not only the nurses, those who are working in the hospital, for everyone it is applicable, included doctors also. Education, communication and guidance. In that, the organization shall ensure that nursing professionals are trained in communication skill. See, communication skill in the first year itself we are telling the students to maintain good IPR with the patients. Yes or no? Talk with the patient, yes. Yes, if Malayali students are there means we are telling the students to talk in Tamil. Yes or no? Yes? Yes. Okay, they are also learning. Good. And nursing professionals are aware of their responsibility in protecting patient rights. Nursing professionals communicate as and when required with relevant team members to achieve continuity of care. Patient and family are educated where essential and in case of any change in nursing care plan. Then infection control practices. Infection control nurse shall be designated by the organizations, and the nursing personnel shall adhere to standard precautions. If we are going, see for this slide I want to share only one thing. Already infection control protocols everything ma'am took, but if we are going to the ward, maybe we can take as a ICU. If you are going to the ward, what are the infection control protocols you are capturing? If you are asking to the nurse, immediately the nurse will say the infection control manager will capture all the thing. Yes or no? In the hospital setting. Okay, that is only happening now. Okay, the infection control person will be there. He will take over in that. Next, empowerment and governance. The responsibility of those responsible of nursing management are defined. The head of the nursing service ensures that suitable mechanism exist to govern the nursing service. The nursing professionals are involved to participate in decision making related to the organization and nursing service. In nursing quality indicators, in that there is a structured quality improvement and continuous monitoring program in nursing service. Then the organization identify the key indicators to monitor the structure, process, outcome and the continuous improvement of nursing service, and nursing quality improvement program is supported by the management always, and also incidents, complaints and feedback from nursing professionals are collected and analyzed to ensure the continual quality improvement of care and to the hospital. The quality excellent model, one model I posted, empowerment in nursing, empowerment of nursing, work plan based on survey result. Okay, in one ward 10 patients are there, there is only nurse can't handle. Okay, so according to the work plan we have to plan data transparency, the patient's information should be in transparency, organizational learning and also appreciation and achievements, and also nowadays all the patient records are the computerized, and organizational management models we are following, and core domains we are following, and self-evaluation survey and standardized measuring of tools. Quality excellence in healthcare, doctors and hospitals are increasingly being held accountable, that is responsible and comprehensive, to develop actions aimed at improving the quality of care and reducing cost and cost effective medication and cost effective, all the society members, all the peoples are needed cost effective treatment and medicines, and achieving better patient centered care. Importance of nursing excellence, that is, if you have a good culture of nursing excellence, then you are more likely to have better physician engagement. What is meant by physician engagement? In one hospital we are going to see one doctor, okay, the doctors prescribe medication, giving treatment nicely, and also whatever medicines the doctor given by to the patients, it is more effective, means more people will go and visit the same doctor. Yes or no? Yes, that is only physician engagement. Next, excellence in clinical area, that is application of knowledge to populations, systems, operation, delivery of outcome of quality of care. Quality excellence in healthcare, that is only improve the, we have to provide a quality care and also patient centered care. Commitments to nursing excellence, that is continuous professional development and aspects of nurse lifelong learning, and CPD is vital for maintaining up-to-date knowledge, and also previous ma'am told we should update our knowledge. Okay, the caduceus sign in the snake is there, yes or no? In the snake it will remove the old skin. So like that our medical field nowadays many treatment modalities are coming, so we should update our knowledge in the medical field every day. Dedication is very important in providing nursing care to the patients. And how do we as a nurse become excellent communicator? That is a communication, oral communication is there, verbal communication is there, and also active listening is very important. What the patient is ventilating, okay, so the patient start to ventilate their problem, in between we are asking question, means what the patient will do, patient will stop the problem what he is ventilating, so allow the patient to ventilate. And active listening, and also in the medical field the written communication is very important, documentation and also presentation skill. That is clinical excellence. Already I told we have to demonstrate and diagnosing the patient illness and provide a health care to the patient. And qualities, as a nurse we should see, okay, actively for this slide, okay. So as a qualities of goodness, caring and compassion, excellence communication skill, empathy, organization and attention to detail, problem solving skill, stamina, and endurance, means stamina physically and mentally we should have to treat while treating the patients or while giving counseling to the patients, sense of humor and resilience, and commitments to patient advocacy, willingness learn to grow, strong critical thinking we should have, and good time management, integrity and leadership, experience, cultural sensitivity and awareness. 6 C's of nursing: care, compassion, courage. We should have courage, okay, to give care, okay. Communication, commitments and competence. 5 pillars of nursing. What are the 5 pillars? Caring is one of the pillar. Yes? Yes? Next one, communication. Without communication, we can't give the care. Through the communication only, we can identify the need of the patient. And also critical thinking, whether we should give a cold compress or whether we should administer the medication. Critical thinking is very important. And also, the nurses always following the professionalism. Yes? Yes. Okay. And holism. Holism means giving care in the spiritually, physically and mentally. That is only holism. Physically means to the body. Mentally means we are giving counseling to the people psychologically. R. Finally I finished. Okay. Happy? Happy? Okay. R. Registered nurse and midwife for the backbone of healthcare centers. Can you clap for this? We are the nurse. Yes or no? Yes. See, I want to teach I want to post this slide because of teach like a pineapple. Okay, always while you are seeing the teacher, with the teacher outside look, it should be pricky sensation. Yes or no? Okay, look like a pineapple, it will be a pricky sensation. After giving teaching, it look like a, after learning, the teachers are look like a sweet. Okay, okay, it look like a tall, wear a crown, be sweet on inside. Thank you for your kind attention.
Thank you, ma'am, for your valuable presentation. To honor our 5th speaker, I request our organizing chairperson to present the certificate and the memento. Nurses are unique and kind. They have this insatiable need to care for others, which is both their greatest strength and fatal flaws. I am honored to welcome Mrs. Christy Kamalam ma'am to introduce about the 6th speaker.
I welcome Mrs. Indumadi, Assistant Nursing Superintendent from SKS Hospital Postgraduate Institute, Salem. Her total experience is 19 years. She completed her UG in the year of 2003 in Madras Medical College, Chennai. She started her career in the year of 2003 as a neonatal nurse and pediatric ICU nurse at Dr. K.M. Cherian Heart Foundation, Chennai. In 2007, she moved to UK and worked as a ICU nurse till 2021 in North Bristol's UK. Currently, she worked as a ANS in SKS Hospital and Postgraduate Institute, Salem. Now I welcome Mrs. Indumadi to start this session. Welcome, ma'am.
Thank you, ma'am. Good afternoon, all. May I know how many of you all from clinical setting? From hospitals, clinical areas, nurses? I can see only few hands. Okay. The topic given to me is Safe Haven, cultivating a secure healthcare environment and minimizing clinical risks. So, evolving healthcare. As we all know, global healthcare is changing with health systems operating in increasingly complex environments. Do you all agree with this? Is it growing now? Yes? Yes. So while new treatments, technologies and care models can have therapeutic potential, at the same time, they also constitute new threats to safe patient care. So patient safety is a fundamental principle of healthcare and is now being recognized as a large and growing global public health challenge. So what is healthcare environment? So it includes primary health centers, clinics, hospitals, nursing homes, also standalone centers like laboratories, blood banks, and dialysis center. So in the healthcare setting, whose safety is we are looking into? So it's categorized into 3 sectors: people safety, place safety, and safety of the property. So first we see people safety. So safety of people includes patient safety, staff safety, and visitor safety. Then safety of place. So infrastructure safety, fire safety, electrical and mechanical safety. So in safety of property, stores, assets, and equipment safety. So in that we mainly focus on patient safety. So patient safety is paramount in the healthcare setting. Unsafe healthcare setting can put patients and staff at great risk. So what is the definition of patient safety? So patient safety is defined as absence of preventable harm to a patient during the process of healthcare. Within the broader context, patient safety is a framework of organized activities that creates culture, processes, procedures, behaviors, technologies, and environment in healthcare that consistently and sustainably lower risks, reduce the occurrence of avoidable harm, make error less likely, and reduce impact of harm when it occurs. So according to World Health Organization, 1 in 10 patients is harmed in healthcare and more than 3 million people die every year because of unsafe healthcare. In lower to middle economic countries like India, Sri Lanka, Indonesia, and Pakistan, 4 in 100 people die every year because of unsafe care. In that, half of the harm is preventable and 50% of the harm is attributed to medications. So patient safety in India. In India, patient safety is even more crucial because we all know India is a diversely populated country because of the complex healthcare system, lack of regulation and standardization in the healthcare sector, lack of awareness among patients about their rights and responsibilities. So we all know we have a complex healthcare system because of the a diverse population. We have a rural and urban also, depending mainly on the economy also. If those who have money, they get better treatment, and the poor people won't get the same treatment. So India has a population of around 1.44 billion people, and healthcare services are not equally distributed across the country. So what are the common clinical risks we have? So we are coming to the main points now. So these are all the common clinical risks happening in the hospitals. So medication errors, hospital acquired infections, surgical errors, diagnostic errors, patient falls, pressure ulcers, patient misidentification, unsafe blood transfusion, and venous thromboembolism. The first one is medication errors. So what is medication error? It's any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. So what are the types of medication error? Medication error can happen at different levels during the time of prescription or during transcription or interpretation error. Preparation error normally happens while the doctor is prescribing the drug. Transcription error occurs mainly in pharmacy while dispensing the medications. preparation errors and administration errors are mostly covered by us because we the nurses normally prepare the drug and administer the drug. So we should be careful while preparing and administering medications. So administration errors include wrong dose, wrong time, omission of the drug or extra dose. So 1 in 30 patients affected due to medication error in healthcare setting. Ensuring medication safety is paramount in preventing medication errors, adverse drug events and patient harm. So hospitals should implement robust systems to support safe prescribing, dispensing, administering and monitoring of medications. Clear communication with patients and their families to ensure they understand their prescribed medications, their purpose and any potential side effects. So being in the clinical area, I noticed, I think we don't practice this at all. We just go to a patient and just give them medications. We don't explain to the patients at all because I practiced where we always, even if we give a simple medication, we tell the patient, even the patient is semi-conscious, even if the patient is confused, we still tell the patient the medication, what medication we are giving, so when they have to report it to us. So how we can prevent medication errors? So by following the rights of medication administration, we can prevent most of the medication errors. So we all know we have 10 rights of medication administration: right patient, right drug, right dose, right time, right route, right documentation, right assessment and right education. So the next one is, the next clinical risk is healthcare associated infections. I think this was covered by Dr. Maharanisa ma'am. She already explained in detail, so we just see what it is. So infection acquired during the course of hospitalization due to lack in following infection control practices. It can develop either as a direct result of healthcare interventions or being in contact with the healthcare setting. So that will lead to prolonged hospital stays, antimicrobial resistance, disability, additional financial burden on patient families, and we can avoid deaths also. So surgical error. A surgical error is an unintentional preventable injury occurring in the perioperative period. It includes retained foreign bodies, mislabeled surgical specimens, wrong site surgery, wrong procedure and wrong patient errors. Surgical errors continue to occur at high rate. So 10% of preventable patient harm in healthcare was reported in surgical settings. Most of the resultant adverse events occurring pre and post surgery. So to avoid the surgical errors, the World Health Organization established surgical safety checklist, which is used widely in clinical settings. The checklist is based on the successful international program Safe Surgery Saves Lives, which incorporates validated checklists to be reviewed by the surgical team before induction of anesthesia, before skin incision and before the patient leaves the operating room. By following these, we can minimize or reduce the occurrence of surgical errors. So this is the standard WHO safety checklist. I think most of the hospitals they use before surgery. So this has to be entered by the anesthetists and surgeons before giving anesthesia and before incision, then before leaving patient before the operating table. So then is diagnostic errors, misinterpretation of test results, failure to order appropriate tests and delayed diagnosis which result in incorrect or delayed treatment. These all comes under diagnostic errors. So how we can maintain safety during diagnostic stage? These also already covered by Dr. Magaranisa. Avoid needle stick injuries, manage blood and chemical spillage, safety measures in radiology department, biomedical waste segregation and disposal. So the next clinical risk, patient falls. So accidental falls in healthcare settings leading to injuries such as fracture or head injury. The rate of falls in acute care hospitals range from approximately 1 to 9 per 1,000 bed days. High quality evidence shows that multi-component interventions can reduce risk for in-hospital falls by as much as 30%. So how we can prevent falls happening? By doing risk assessments, patient and staff education, bedside signs and wristband alerts, footwear advice, scheduled and supervised toileting, and doing medication review, because certain medication will make the patient to become unsteady on their feet. So all these steps by following, we can reduce the occurrence of falls in hospitals. So pressure ulcers, also known as bed sores, these are injuries to the skin and underlying tissue resulting from, and implement proactive measures to prevent future incidents. And the government has initiated various programs and policies to improve patient safety and reduce the incidence of medical errors. Such programs are National Patient Safety Implementation Framework, the National Health Policy. In addition to government initiatives, healthcare organizations and advocacy groups taking steps to improve patient safety by implementing quality management systems, accreditations programs like NABH, NABL and JACI, Joint Commission International, to ensure that the hospital provides safe and effective patient care through standard operating procedures, increasing awareness among patients and providing training. So patient safety is a critical aspect of healthcare and is essential to ensure that patients receive the best possible care and clinical outcome. So the next comes staff safety. So 5 ways to improve staff safety in healthcare includes promote a culture of safety, measure the performance of safety protocols, optimizing staff scheduling, improve patient handling, use safer medical equipment. So we just go in just brief about other safety. Electrical safety by if we find any loose wires and connection, report it to the electrician and properly plugged and fixed cables. Electricity by having electricity backup and safety fuses with each equipment. And fire safety is by using fireproof material for construction, have fire exit in all buildings, smoke detectors and water sprinklers on the roof of all floors, fire extinguishers in all areas, fire hydrants in all buildings. Also we need proper training in fire management. So other factors contributes to secure environment are by maintaining a cleanliness of the healthcare setting, well design of patient areas and CCTV and security. So what are the roles and responsibility of nurses, management and patients and visitors? So the employees' roles and responsibilities are, all employees have the responsibility for their own health and safety and that of co-workers and patients. Employees follow safety procedures and report any hazards, accidents or near misses through incident reporting, so that the concerned people can do root cause analysis and can get a corrective and preventive actions to prevent the incidents happening again. So the roles and responsibilities of management is accountable for providing a safe environment, promoting safe work practices and providing resources and support. Ensure safe work practices, provide resources, equipment and training education. So patients and visitors should cooperate with us on safety and follow the guidelines and rules put in place for their safety. So hospital safety plays a pivotal role in providing quality healthcare and ensuring the well-being of patients, healthcare workers and visitors. By implementing these strategies and fostering a safe culture, healthcare organization can effectively enhance patient safety and improve overall quality of care. By working together, we can ensure that patients receive the best possible care without any harm. So in nutshell, patient safety, sense of error. We should identify when the error happening. We have to sense it, then act to prevent it by properly identifying and reporting, follow safety guidelines, inquire into near miss incidents, accidents and death, take appropriate remedial measurements like corrective and preventive actions, and it should be responsible. So, thank you. Any questions?
Thank you, ma'am, for your informative presentation.
To honor our sixth speaker, I request our organizing secretary to present the certificate as well as the memento.
It is the most awaited moment where the second part of our dance is to be continued in this moment.
This is for there is an announcement for the delegates. We have shared the feedback form in the group, CNE group. So kindly fill up your feedback forms. So this is a more valuable to us. So kindly fill up your comments and your criticisms. So that will help us to improve in future. Thank you.
So ladies and gentlemen, let's encourage them and give them a round of applause to our third year BSc Nursing students.
இந்த நாள் வரை வண்டியை விடவில்லை. வண்டியை விடாம நாள் கணக்கா சுத்திட்டு இருக்கா? என்ன ராமலிங்கம் ஆலைய பார்க்க முடியல, எப்படி இருக்க?
நான் நல்லா தான் இருக்கேன். நீ எப்படி இருக்க?
நல்லா இருக்கேனப்பா.
என்ன எப்ப பார்த்தாலும் சைக்கிள் சுத்திட்டு இருக்க?
என்னப்பா ஆத்திரவசம் வண்டியிலன்னா ரொம்ப சிரமமா இருக்குல்ல, இதுக்கே எவ்வளவு செலவு தெரியுமா? ஓ
Elevating care, harnessing evidence-based practice to transform nursing excellent.
அப்படின்னா
அபி தேக்கோ சூப்பிஸ்தானு.
முக்கிய செய்தி: தமிழகம் முழுவதும் 144 தடை உத்தரவு அமலுக்கு வர இருக்கிறது. நாளை மாலை 6 மணி முதல் 31ஆம் தேதி வரை 144 தடை உத்தரவானது அமல்படுத்தப்படும் என்று முதல்வர் அறிவித்திருக்கிறார்.
இதெல்லாம் என்னடா, பார்த்துக்கலாம் விடு, வா மச்சான் நம்ம வெளியே போயிட்டு வரலாம். டே மாமே வேண்டாம்டா, ஏதாவது ஆயிர போதுடா, பார்த்துக்கலாம்டா வா. என்ன ஒரே இருமலா இருக்கு, வாசனையே வரமாட்டுது. அம்மா அம்மா எங்கம்மா இருக்க? நீ வைக்கிற கறிக்குழம்பு வாசனையே வரமாட்டுக்கு, எந்த ஒரு வாசனையும் தெரியலம்மா, ஒரே தலைவலியா இருக்குமா. வாங்கம்மா நம்ம ஹாஸ்பிட்டல் போயிட்டு வரலாமா?
சிஸ்டர், நியூஸ் பார்த்தீங்களா? எல்லா பக்கமும் கோவிட் பரவிட்டு இருக்கான், எல்லா பக்கமும் குவாரண்டைன் வேற போட்டாங்க. என்ன பண்ணுறதுனே தெரில, நாம தான் தடுத்தாகணும்.
நாம தான் போராடி ஆகணும் சிஸ்டர். பரவாயில்ல, என்னானாலும் பார்த்துக்கலாம்.
பிறர் துன்பம் தன் துன்பம் போல் எண்ணினால் வரலாற்றில் ஒரு தலைவன் உருவாகுவான். எரித்தாலும் புதைத்தாலும் அழியாமலே வருங்காலம் பேர் சொல்ல உரமாகுவான்.
இப்போ எப்படி இருக்கு கண்ணு, பரவாயில்லையா?
அம்மா பரவாயில்லம்மா, நான் இருக்கிற நிலைமைக்கு செத்துருவனே நினச்சேன், ஆனால் என்னை காப்பாற்றிட்டாங்கம்மா. இவங்க தான்மா நம்ம தெய்வம்.
கடவுள்னு சொல்லாதீங்க. அந்த கடவுள் நம்பிக்கை எங்களுக்கு இருந்ததுனால தான் ஒரு செல்ஃப் கான்ஃபிடென்ஸ் வந்து இவரை காப்பாற்ற முடிஞ்சுது. அந்த செல்ஃப் கான்ஃபிடென்ஸும் கடவுள் நம்பிக்கையும் இருந்துச்சுன்னாவே போதும். ஒரு கோவிட் என்ன 1000 கோவிட் வந்தாலும் எதிர்த்து நின்று போராடலாம்.
ചുണ്ടിൽ സ്നേഹത്തേനുണ്ടോ പെണ്ണെ ഓഹോ കണ്ണേ എൻ കണ്ണേ നിൻ കണ്ണിൽ നീലനിലാവുണ്ടോ കണ്ണേ
ഓ കൈതാളം കട്ടാതെ മെയ്താളം കാണാതെ എന്താണ് പുത്തൻ പോയാട്ടം ഓ ആകാശം പൊൻകിണ്ണം ആശിക്കും തേൻകിണ്ണം നീതാനെ നേർക്കാ നീതാനെ மாமதுரை அன்னக்கோடி மாமதினி அன்னரெடி மருத மெச்சும் அன்னக்கோடி மாமதினி நல்ல குத்து அடி மாமதுரை அன்னக்கோடி மாமதினி அன்னரெடி மருத மெச்சும் அன்னக்கோடி மாமதினி நல்ல குத்து அடி.
Guarding against germ, combating hospital acquired infection. நம்ம சாப்பிடுவோமோ சாப்பிட மாட்டோமோ, தூங்குவோமோ தூங்க மாட்டோமோ, ஆனால் எந்த ஒரு செயல் செய்கிறதுக்கு முன்னாடியும் பின்னாடியும் கை கழுவிட்டு தான் பண்ணணும்.
அங்கே புட் த சாங்.
Oh my goodness, it was such an innovative performance that you all have given us today. Thank you students for entertaining us. A cup of tea is a cup of peace. So before moving to the next session, let's have a short break with a smiley face. Thank you.
One's discipline. For example, if the nurses wanted to write something, straight away they can take the nurse's record. If doctor wanted to write something about the patient's progress, straight away they can take the progress notes and can record. Disadvantage, in that information about a particular client problem is scattered throughout the chart. So it is difficult to find chronological information on a client problems and progress. So we have to go through all the charts. Then only we can come to know the full history of the patient. Next, problem-oriented medical record. In problem-oriented medical record, data arranged according to the problems the client has rather than the source of information. SOP is used for this chart. Yes, subjective, what the patient tells you. For example, the patient complains the patient is having painful micturition. Objective, what the nurse observe and see. The nurse observe the urine, whether it is clear or it is cloudy or it is blood stained. Next, assessment, what you think is going on based on your data. So we can come to the conclusion the patient may have the urinary tract infection. Plan, what you are going to do. So we can encourage the patient to have a plenty of oral fluids, and also it can be informed to the consultant. Consultants may ask us to send the urine sample to the laboratory to find out the organisms present. Then the antibiotic started to treat the urinary tract infection. Next advantage is encourages collaboration. So in here everybody's involvement is there. The nurse involvement is there, doctor's involvement is there, and also the nurse involvement is there. The problem list in the front of the chart alerts caregivers and make it easier to track the status of each problem. Disadvantage, caregivers differ in their ability to use the required charting format. It takes constant vigilance to maintain up-to-date problem. Basic component of POMR, database, that's a date and time, problem list. There will, the patient may have the pain or abdominal distension, vomiting or nausea. Plan of care. So what we are going to do based on the patient's problem. Next, progress notes. We must check whether the patient is relieved from the pain or relieved from the patient's complaint or not. Next, PAA charting, problem, intervention and evaluation. Similar to SOAP charting, both are problem oriented. PAE comes from the nurse's process and SOAP comes from the medical model. P problem, I intervention, E evaluation. Advantages. The PE system eliminates the traditional care plan and incorporate ongoing care plan into the progress notes. The nurse doesn't have to create and update and create a separate plan. Disadvantage, must review all the nursing notes before giving care to determine which problems are current and which interventions were effective. Focus charting, a method of identifying and organizing the narrative documentation of all client consents. Uses a columnar format within the progress notes to distinguish the entry from other recording in the narrative notes. The progress notes are organized into data, action and response. Example, date and time, focus. We are focusing on particular acute pain related to surgical incision. Progress notes. Patient reports pain is 7 out of 10 in 0 to 10 scales. A injection morphine 1 milligram given at 9:45 p.m. So patient reports at 10 p.m. pain 1 out of 10. Almost the patient is out of pain. Advantage, provide a holistic perspective of the client and the client needs. So we are focusing on the particularly focusing on the patient and patient's problem. Provide a nursing progress framework for the progress notes, DER. You don't need to have all 3 categories are recorded in order. Next, electronic documentation. Definition of electronic documentation. It allows nurses to use computers to restore client data, client assessment, medication administration, client teaching, progress notes and care plan updating. Guidelines of using of electronic documentation must be comprehensive, accurate, timely and clearly identify who provided and what care. Never reveal or allow anyone else access to your personal identification number or password, as these are in fact electronic signatures. Next, inform your immediate supervisor if there is suspicion that an assigned personal identification code is being used by someone else. Change passwords at frequent and irregular intervals. Choose passwords that are not easily deciphered. Log off when not using the system or when leaving the terminal. Maintain confidentiality of all informations. Advantages, different electronic documentation, facilitate quickly, providers at different locations, access by different providers at the same time, increases accuracy and legibility, reduced error or omission, enhance quality of documentation, improve communication between healthcare providers. Disadvantage, computer downtime sometimes can crash or break down, making information temporarily unavailable. Computerized system can threaten a patient's right to privacy. Confidentiality may be a problem. Sometimes somebody comes to know your password. Cost includes the cost of software and hardware, cost of the training and cost of supervisory involvement during the transitional period of change. So role of nurse manager in documentation. A nurse manager must assume responsibility for ensuring complete and accurate documentation. Assist staff in adhering to both clinical and documentation standards. Provide continuing education. professional feedback and input into policy and documentation system changes whenever possible. Must ensure that nursing staff comply with up-to-date standards. It is important to ensure that they document that compliance accurately and completely. Ensure that the nursing staff follows the established policies of the organization, emphasizing the importance of documentation through written guidelines, policies, job description, and performance appraisal. So I would like to share my experience. Actually, it happened when I was in UK. A gentleman got admitted. He's about 60 years old, and he came to the hospital at around 6 p.m. He came with a history of uncontrolled diabetes mellitus and limited mobility. He needs help. He needs assistance to stand and transfer him to the to the bed. So he was taken to the room, and he was sitting in the reclining chair. So the nurse came, the nurse completed all the procedures, so admission procedure, everything she completed. But around 9 o'clock, sorry, the nurse completed everything, all the procedures, all the admission procedure, everything she completed. So at around 9 o'clock she came to the patient's room, and she wanted to help him to transfer him to bed. But the patient refused to transfer to. He said, I am very comfortable sitting in the reclining chair, so I will be sitting and sleeping in the reclining chair only. In the morning, so whole night he was in the reclining chair only. So in the morning, when his daughter came, she asked, why my dad is sitting on the chair? Why he did not go to the bed? So she said, your dad only refused to go to bed. Then she said, so okay sister, you come with me. I will convince him, and we will transfer him to bed. So they both came. They transferred him to the bed. So that time they noticed, the nurse noticed, he developed a pressure ulcer at his bottom. But the doctor said, when I brought him to the hospital, he did not have any pressure ulcer. So this one was in the daughter was taken this to the court. So in the court, it's because actually the nurse she documented everything, all the admission procedure, so all the administration of the medication, everything very fantastically she charted. But only thing she forgot to chart, she did not do the initial skin assessment. So she was not, because the patient refused to go to bed, so she was not able to do the skin assessment. That one she did not document. So it was taken to the court. At the end, this one, the result was against that nurse only, because she forgot to document the patient refused to go to bed because I did not do the initial skin assessment. So please everyone keep this mind. This documentation not only to protect the patient, this is to protect the nurses also. Thank you.
Thank you, ma'am, for your valuable presentation. Now we are moving to the valedictory session.
The journey doesn't start at the beginning, it begins at the end. Well, good evening ladies and gentlemen. I welcome you all to this valedictory session. As we conclude this enlightening seminar, I would like to express my heartfelt gratitude to all the speakers for sharing their immense knowledge and expertise with us. I am privileged to appreciate all the attendees for their active participation and valuable contribution. I request all the dignitaries to be on the dais.
A strength of a man's virtue should not be measured by his special exertion, but by his habitual acts. To felicitate the pleasure and gratitude, I would like to invite the Treasurer, Dr. Shirpi Manisa, MBA, PhD, the Chief Executive Officer, SKS College of Nursing.
Good evening. So, after one full long day of learning, you all will be willing to go back to home quickly. I will not take much time. First, my sincere appreciation to the organizing team. From morning till this time, all the topics were selected cautiously as per the today's nursing requirements, and it was very well organized event. Even these topics used to I would recommend doctors also to attend these kind of topics. So documentation part, last presentation I was watching, the importance of documentation, everyone knows these days. NABH teaches that only, because modern day, those days, 5-10 years back, there won't be much expectations from patients as well as from the attenders. But these days, the quality of care everyone is expecting, and it is our duty to give 100% quality care. Patient care is very, very important in modern days healthcare. So we all should keep in mind, we are all here for the benefit of the patients as well as our safety also. Safety of the patients and safety of the nursing care providers is very, very important. So I take this opportunity to appreciate the entire organizing team for organizing such a wonderful event. And for SKS College of Nursing, this is the first seminar. And first seminar itself, they proved that they are good. I mean, I would rate them 100%. And going forward from next year onwards, we'll be, improving, and we'll be doing better job as far as nursing education is concerned. And I expect all your feedback. I think feedbacks will be Google Forms feedback will be there. Please give your honest feedback. That will help us to improve further for next year. We'll definitely consider all your feedbacks, and we'll improve and we'll implement. Thank you so much, and thank you, Madam, and the speakers and the participants for coming all the way from various places in Tamil Nadu and to come to Salem and attend this program. Once again, I sincerely thank everyone for attending this program. Thank you.
Thank you, sir. Now, I invite our Chief Executive Officer, Dr. Shirpi Mani, sir, to present the certificate and memento to our Tamil Nadu Nurses and Midwives Council Observer, Mrs. Garagadurga Ma'am, MSc Nursing, OBG Department, Gokulam College of Nursing, Salem. Thank you, sir.
Once again, I request our Chief Executive Officer, Dr. Shirpi Mani, sir, to present the certificate and memento to our Organizing Secretary, Mrs. Christy Kamalam, ma'am, MSc, PhD Nursing, Administrative Officer, SKS College of Nursing.
Thank you, sir. I request Chief Chief Executive Officer, to present the certificate and memento to our organizing chairperson, Professor P. Selvaraj Sir, MSc, PhD Nursing, Principal, SKS College of Nursing, Salem. Thank you, sir. To acquire knowledge, one must study, but to acquire wisdom, one must observe. So, I would like to call Mrs. Ganagadurga Ma'am, MSc Nursing in OBG Department from Gokulam College of Nursing, the TNMC Observer, to give a feedback about the seminar.
Respected dignitaries on the dais, special invitees, resource persons, the organizing team of faculty and students, and dear delegates. Wishing you all a great evening. And to tell about the sessions, I think the title, Revealing Nursing's Heartbeat, itself looks so attractive, that how a beating of the heart keeps a person alive. Likewise, all the principles and procedures which keeps the nursing alive in the healthcare setting has been brought into the sessions. And really all the resource persons have put a tremendous effort in bringing out the session in a simplified yet effective way for the students and other people to understand it very easily. And a special appreciation to the student volunteers who have put your the session contents into your special performances, so that you made it like incorporated whatever you have learned into the special performance and even entertained the delegates also. Really it was very nice. And on the whole, the session was found to be very useful and informative for the students who is going to enter into the clinical field, and it is a refreshment session for all the other seniors who have participated. And so I think everybody have enjoyed the full day session, and thank you for the opportunity given. I take this time to thank the Tamil Nadu Nurses and Midwives Council, management of Sri Gokulam College of Nursing, and management of SKS College of Nursing for giving me the opportunity to be an observer in the CNE. And I take this time to congratulate SKS College of Nursing for successful completion of the first CNE, and best wishes for to have many more CNEs in future. Thank you.
Thank you, sir. I request all the dignitaries to be off the dais. Next, moving to the scientific session. Challenges are what makes life interesting, and overcoming them is what makes life meaningful. I am privileged to welcome our organizing secretary to introduce about the 8th speaker.
It's a last one, so it's a finishing one. It's from our college. I welcome Mr. Sambath. I welcome Mr. Sambath, lecturer, SKS College of Nursing, Salem. He completed his UG in the year of 2019 in Shanmuga College of Nursing, Salem. He completed his PG in the year of 2023 in PSG College of Nursing, Coimbatore. He worked as a team member in many programs. Currently, he is working as a lecturer in SKS College of Nursing, Salem. Now, I welcome Mr. Sambath start this session. Welcome, Sambath.
Good evening to one and all. You are all waiting for going to home, right? It's okay, last session. Okay. First of all, thanks to our management for wonderful opportunity to deliver the topics. Okay. The topic is navigating the clinical frontiers, the overcoming nursing challenges with the innovative solutions. And before that moving, I have some prepared the AV aids. Please distribute the AV aids. Okay. In the introduction, nursing binds the human society with a bond of care and affections. Nursing is calling to care with offers and oceans of poignant stories and full of challenges. The scope of nursing practice has expanded and extended to different settings and other than hospitals only. Nurses deals with most precious things in this wide world, the human life. Yeah, this is problems and solutions. In that problems, the workplace mental violences, lack of synchronicity and non-nursing role, shortage of staff nurses and workplace health hazards, long working hours and lack of recognition. These are all problems. And solutions are positive practice environment, positive teamwork, workload balance and evidence-based practice and closing education service gap and recruitment retention policy. See one by one. Challenges faced by nurses at workplace. The first point in the sense, workplace mental violences. Workplace violences is a widespread in healthcare settings. Huge amount of workload and responsibilities on the staff can often lead to distributed mental peace, which ultimately leads to less efficient care due to work stress. Workplace mental violences can be in the form of threats, verbal abuse, honesty and harassments, which can cause psychological trauma and stress. In the second, the sense shortage of staff. In deficiency of manpower leads to unmanageable patient load and disparity in the nurse-patient ratio. Mainly for example, in one ward means there 30 patients will be there. Only the management inadequate staff members means only to provide these 2 staff nurses to manage the 30 nurses. It's difficult to provide the efficient care. Okay, and the nurse-patient ratio needs to be well maintained, as it is highly affect the patient care delivery system. When nurses is forced to work with the high nurses to patient ratio, the patients are die, patient infectious, get injured and get sent home too soon without adequate knowledge. For example, to incompleting the health education for get home to the patients. And third, in the sense, workplace health hazards. In that, nurses is confronted with the variety of biological, physical and chemical hazards during the course of performing their duties. The level of occupation safety and hazards, the health training and resources are available for the nurses in incorporation, implementation and uses of such training and resources with the management support and leadership are critical aspects the preventing adverse outcomes from the occupational safety and health hazards the nurses are exposed to on a daily basis. And the fourth, in the sense, is a long working hours. Yes, they are over duty. Okay, in the sense, the short staffing pattern in a healthcare units is often the results in long working hours and double shift of the staff nurses. It is quite difficult for nurses to provide the efficient nursing care. And next, the lack of synchronicity is a disharmony and lack of teamwork. Teamwork is an emerging challenges in the healthcare sectors. Yes, Indumai says that these some challenges for the environment. They are one of the teamwork will be there. And harmonious relationship is among us the healthcare workers is an essential requirement for healthcare system. Nurses is beyond the indirect opprobrium, which means the criticism of every dear for the stressful situations, the incident which occurs in the hospitals. Next, they have challenges, the solutions to scrub the challenges. The first, the points is positive practice environment. In that work environment plays a large role in the ability to providing quality care. There are adequate facilities will be provided the hospital managements. Okay, and the safety and security of the nurses should be given the importance, and the harmonious human relation and incentives for salary increment for extra duty will be staff nurses will be maintained, means they are adequate salary will be given the hospital management. That is the incentives in work settings may serve as a motivation and encouragement of the nurses. And the second, say equipments and materials. Yes, the one organization will be then run means there are adequate facilities will be provided, means they have to provide the efficient patient care, and also patient satisfaction will be improved. The ability and adequacy of samples of equipment and consumable supplies is often a matter of concern. The hospital management should ensure at regular basis that supplies and equipments are adequately available for the smooth functioning of the hospitals. The third, the positive teamwork. Yes, not only the nurse only to provide the efficient care, they are combined with the doctors and healthcare workers, technicians, physicians and pharmacists. They are combined it to make the teamwork to provide the efficient care. That is the teamwork. A team need to be taught about the importance of teamwork, and a good team can always conquer the goal of effective and quality patient care. Recruitment and retention policy, in that a proper and well planned policy for recruitment and retention has to be included in the organization. Yes, one organization will be run means they are yearly once to conducting the interview to selecting the staff nurses to recruitment and retention policy will be followed that. And the closing education service gap, in that practical and theoretical things of the nursing aspects should be emerged to and extended the closing education service gap, and evidence based practice, in that the nurses should follow the research articles should be follow that only to help the evidence based practice. Nurses should also deviate the part of the focus towards the evidence based practice. Next one study will be conducted in Richard Goifrans et al. 2020, in that conducted a prospective study of investigating learning challenges from the nursing students. Yes, the nursing education program provides a theoretical and clinical training to prepare a student to practical sessions. In that the main objective to develop the competency to offer patients comprehensive and adaptive health care. In the thematical analysis, there are two types of challenges. One in the sense cognitive challenges and non-cognitive challenges. Under that, cognitive challenges are theoretical gaps. They are related themes as memorizing knowledge. The students are difficult to learning the nursing subject. They are memorizing the paragraph. That is the memorizing the knowledge and understanding professional languages and targeting useful knowledge and linking knowledge and knowledge transfer in clinical settings. These are all the theoretical gaps, and the challenges is related to clinical reasonings are data collections, identify relevant cues and formulate and justify the clinical judgment and determine the care objectives and make a care plan. These are all challenges facing the cognitive type of challenges in the nursing students. And non-cognitive in the sense behavioral challenges and procedure challenges. In that behavioral challenges, the communication problem. They are Malayalam students will be that they're difficult to handling the patient situation. Okay, the communications errors and the mainly teamwork. These are not behavioral challenges. And procedure challenges, they perform according to the recommended procedures. In that report of the study, starting a training program like nursing studies is require the important adaptation effort from each students. For example, our college to conduct the first CNE program for elevating the nursing heartbeats. That is one of the training program for improve the efficient nursing care. Okay, and that teachers must consider them in the conception, development and implementation of various educational interventions. There are a lot of educational media will be there. There teachers will be motivate the student to encourage the participants. Next challenges are challenges facing the nursing education in the advanced healthcare environment. In that advanced healthcare environment, they are facing challenges for nursing education. First, in the sense practical environment. Next, in the curriculum enhancement, and next the faculty development and technological challenges, cultural diversity, and economical challenges. These challenges are nowadays the nursing education will be facing challenges because of that semester system will be there. That is the facing the lot of challenges. Next in the sense, challenges and opportunities for our profession after COVID-19. In that, healthcare workers had more than 7-folded high risk to severe COVID-19 pandemic time. In that, how can we rebuild a strong profession as we move beyond the toxic pandemic? In that first challenges are workplace vulnerabilities, second in the sense unsustainable workloads, and the third ongoing work-life stress, and the fourth in the sense health effects. These and all the challenges facing during the COVID-19 pandemic time. In that, nursing faces a great instability. Nursing has emerged from a pandemic in a state of restlessness, which is leading to a potential crisis. A workplace vulnerabilities, nurses worldwide report the feeling vulnerable during the pandemic. The risk factors are such as the work-related stress and the lack of pre-pandemic planning and inadequate personal protective equipments. These are all the risk factors for workplace vulnerabilities. The potential solutions are that one of the organization will be present means they are adequate vaccination first should be administered to the healthcare workers. What is the first point? The vaccination. Second, the sense they are adequate supply of personal protective equipments for during COVID-19 time. That will be to protect the staff nurses also, and the ongoing institutional educations. The second, in the sense unsustainable workloads and inadequate staffing. Nurses everywhere have experienced very heavy workloads driven by staff shortages and inadequate skills. In the solutions, they are adequate retention policy, recruitment retention policy to adequate staff nurses will be taken to the management. The sensitive and reliable patient workload, the acuity scoring system, mainly the based upon the acuity scoring system for mild, moderate and severe acuity scoring, and the level of the care will be based upon that staff nurses will be recruitment. And ongoing work-life stress, the impact of COVID-19 on nurses has been is around the clock at work and at home, making it extremely challenges for nurses to bounce back from stress. The solutions are facilities must build their cultures of wellness and must provide evidence-based wellness and support the program for the whole nurses. In the sense, the nurses are suffering the health effects, the health results of the pandemic. For nurses, this includes severe burnout and mental health challenges. The opportunities for giving the during COVID-19 time, they demand urgent and sustained action. For example, government also during COVID-19, they urgently taken the staff nurses. That is the recruit and retain the talent and engage in solutions and wake up calls for the central government also is announced the recently during COVID-19 time, they announced the vacancy. In the next, the challenges faced by the nursing administrators. The first points in the sense the lack of adequate training and motivations, and second in the sense inadequate number of nursing staff. Because of the nursing administrator, they have nurse patient ratio, depending upon that they have difficult to handling the inadequate number of nursing staff and professional risk and hazards. And next the role model. Next the role model, and next the no research gap. They have no conducting the research means they have no evidence-based practice. The yearly once the conducting the department-wise research will be conducted. That will be helpful the evidence-based practice and to provide the efficient care and patient satisfactions. And next the conclusion, the patients and public have the right to the highest performance from the healthcare professionals, and this can only be achieved in a workplace that enables and sustain a motivated and well-prepared workforce. Catering to the needs of the nurses and combating the challenges can make nurses empowered, encouraged, challenged, and offering to doing what they do best without any barriers. And the last one quote will be that innovation is a catalyst and keystone between our professions past and futures. It's my sincere belief that nurses can create solution to some of the greatest challenges of our time. It's given by Oriano Barbuda. Thank you.
Thank you, sir. I request our organizing chairperson to present the certificate and memento to Mrs. Ponipas Fernando, ma'am. Now I request our organizing secretary, Mrs. Christy Kamalam ma'am, to present the certificate and memento to our Mr. Sambat sir. Thank you, ma'am.
If there's anything that's important is reporting, is integrity and credibility. Now I would like to welcome our most beloved organizing secretary, Mrs. Christy Kamalam ma'am, to give a valuable report about the seminar.
The seminar registration process started at 8 a.m., 8:30 a.m. and received 150 entries from various institutions all over Tamil Nadu. We felt delightful and pleasurable. The scientific session of the seminar started by unfolding the theme by organizing chairperson. The first scientific session is discussed by Dr. Professor Bhaskaran regarding building bond. During his presentation, he highlighted safe, high-quality communication in nursing practice and care. In the second scientific session, which discussed by Dr. Professor R.R. Kavita regarding ethical horizons, and she highlighted do what is right, not what is easy. In between, we had some refreshment by third year BSc nursing students. In third scientific session, discussed by Dr. Professor Badmavati regarding elevating care. During her presentation, she highlighted technological department in evidence-based practice and how overcome the challenges due to lack of knowledge and training. In the fourth scientific session, discussed by Dr. Maharanisha regarding guarding against germs. During her presentation, she highlighted about the safety protocols and uses of PPE and preventive measures regarding hospital-acquired infections. In between, we had delicious lunch by the third year BSc nursing students and SKS management. The fifth scientific session discussed by Mrs. K.K. Divya Harsham during Revolutionary Nursing Excellency. During her presentation, she highlighted about the nursing excellency and care management in order to provide well-organized, highest quality of nursing care. The sixth scientific session discussed by Mrs. Indumati regarding safe haven. During her presentation, she highlighted about the patient safety and prevention of common clinical risks. In between, we all enjoyed some refreshment activities by the third year BSc nursing student. Then in the seventh scientific session discussed by Mrs. Ponipas Fernando regarding pen to progress. During her presentation, she highlighted about clinical communication, documentation and regarding principles which is essential for every patient's and nurse's life. Eighth scientific session discussed by Mr. Sambat regarding navigation of nursing is challenges and innovative solution. Finally, given Google form from all the feedback from our participant in the questionnaire type, so we got out of 180% through Google. Okay. Thank you all for this cooperation and wonderful patience, and we need on the spot feedback from you all. If anybody, please come over the stage, or you stand over there and you can give the feed. How we conducted, what is the place, what is the mind.
I would like to welcome Mrs. Saranya ma'am for the valuable feedback.
Yes, ma'am.
I would like to welcome Mr. Ganesan sir, Vice Principal, PGP College of Nursing and Research.
Thank you, sir.
Good evening to one and all. First of all, congratulations all of you. My name is Ganesan from PGP College of Nursing, Vice Principal. And first of all, registration itself, I will be impressed me. Madam Christy Kamalam, I ringed 2 times, 3 times also asked. Then whether it's a credit hours there or not, again asked. Then immediately send a certificate also, I will be confirmed. Because of this first batch, no, that I will be little bit Congratulations. After I am even how to come to this place, again doubt. The route map also they given. Because of this side and all, I am a new person. Congratulations. I am not taking much time. Only 5 points will be there. It's a excellent overall conference regarding seminar aspect. The topic, the theme is revealed of the heartbeat. Still I have the heartbeat. Because of there are five aspects for me. Number one, on the selection of the content is very really good. Depend upon that. Even the eminent speaker, there are 8 speakers, especially evident Batmawad madam, and infection control in depth will be discussed. All are will be well, very well, their content will be narrated. Second one is regarding venue. The venue also very good. Because of this summer time, all will be hot. That venue also is excellent chosen. That one good also. And come to the menu. It will be delicious food given for the delegate members. Okay. Then after that, one more, I have more than 70 conference or international conference all I will attend. This is the first seminar itself. It will be a very good concept and things. And one more thing I have recommended for that Tamil Nadu Nursing Council. They given for nowadays the conference and all, they will be going and roaming here and go all, that and all there. But here the recreational activities each is session 2. That also very good. Along with they are shown for health tips. That is the things. And one more thing, all the students are very excellent because some of the college and all you do like that, some kind of there, all are will be very quiet without making teacher. They will be all are very disciplined manner and overall things. And last but least, the SKS college have conducted the first seminar itself. The sky level be achieved. Thank you.
Thank you, sir.
Never ever expect. Thank you so much through our heart in home. Okay, sir. It is a awesome and amazing comical. Thank you, sir. Thank you so much.
Good evening, everybody. Dr. Ganesan sir itself, he told everything related with your first continuing nursing education program. It looks like not a first time. It is like so many years you conducted like that. Okay, there is no words. From starting from the registration and receiving with welcome, the smiling face with the students and the teachers, and conducting everything in a sequent manner. Right, receiving the chairman, receiving the speakers, receiving everybody is very nice manner, and there is no tension. It looks like very like a very cooperative way they did. It's not a today's one day manner. They maybe tried and worked for about 2-3 months, I believe. So work hard of this SKS College of Nursing Principal Selvaraj sir and organizing committee member Madam Christy Kamalam. Thank you for everybody, the students. Yes, the topic sir says like that is revealing nursing heartbeat, like every moment what they will do next like that. We are eagerly waiting for the students' performance as well as the speakers' performance. Okay, first, okay, and here the speakers are very experienced, and the principals and the the colleges. They started earlier itself. The speakers from various colleges, they did very well, nice job, and everything goes on very smoothly. And the two nursing, that is nursing supervisors, like health service side, and another supervisor, madam, two madam, like Ponipos Fernandez and the another madam Indumati, they did very well, nice, that is PowerPoint presentation. Even though they are the nursing supervisors, they are not taking so much classes. The curriculum ours is they explain in very well manner, which is appreciable only. Okay, and I want to say the thank to the students first of all, and the various principals and the HODs and the photographer and that setting of everything, and all the peoples, those who are here participated, are very well done. So I want to say this one. Thank you, madam. Then thank you, everybody. Thank you. Keep it.
Thank you so much, ma'am. Any volunteers for feedback? An ending is not the end. If you want to a happy ending, that depends, of course, on where you stop your story. Here, I warmly welcome our organizing chairperson, Professor P. Selvaraj sir, to give end note address as well as vote of thanks.
A pleasant good evening to all gathered here. So as we reach to the conclusion session of this today state level seminar, so here on this wonderful moment, on these occasions, I want to extend my heartfelt gratitude to all who have contributed to the tremendous success of this event. Your support has been invaluable, and I am truly grateful for your enthusiastic participations. So I hope this state level seminar has met and even exceeded your expectations. So it has been pleasure to see this, there is an enthusiasm and engagement in all the participants. So we have received this 150 entries from all in and around the Tamil Nadu. So it is all this is exceeded our expectations. So there is a 260 members attempted for the registrations, but we could not able to provide. With this, there is a mandatory guidelines, only 150 we can provide. So we have received 150 entries. So I trust that you have gained some valuable insight and valuable knowledge from these sessions. So this is the wonderful opportunities. I hope, so the SKS college, it is all established in the year 2021. So it is all run by the VS Educational Trust. So it is the first CNE program in the history of this trust and this college. So here, so I am pluses and this is overwhelmed. So on this, it is established in the year 2021 with the 3 years of progress. So it is conducted this first CNE program in a grand levels, in a grand manners. So it is this is one of the best opportunities provided by the management of SKS College of Nursing. So it is so I thank this management, this especially to this our esteemed chairman ma'am and our managing directors and also our chief executive officers. So this is for given this wonderful opportunities to conduct this CNE program in a grand levels and grand manners. So within 3 years of progress, so எந்த ஒரு காலேஜுமே ஸ்டார்ட் பண்ணலேருந்து within a shorter duration, so இவ்வளோ பெரிய grand seminar programs or any conference conduct பண்ணுறது is a difficult. So that the team of the SKS done it today. So it is all the best opportunities. This is given by this management. So this management is always keen in this, always conducting and promoting this nursing educations and also providing this promoting this excellence in the clinical care. So that is why I would like to highlight here And next, that is my gratitude to this. Once again, gratitude to all the management and also the sincere gratitude to all the resource persons. So that is from the various parts. So the resource persons who has graciously accepted our invitation to participate in the events and share their knowledge. And also the special thanks to the TNMC Observer for providing the valuable feedback. Thank you, ma'am. And also I extend this thanks to the organizing secretaries. For this wonderful organization, there is a meticulous planning. This is all as a new innovative ideas. That is all is included in the sessions. So that is all is making this hall, everything in a colorful manner. This is thanks to the organizing secretary for the meticulous planning and organizing this event. And also I express my gratitude to all the staffs of Sivaraj Holiday Inn Hotel for the support and assistance in accommodating our needs during the seminars. And also I express my sincere gratitude to the IT department, Mr. Vinod. That is all is providing all these audios and video supports, and IT department from the SKS hospitals. So this all is, he is covering this from morning from the evening, this entire sessions, he is covering this with all the technical support. We thank you. So in the session we are going to upload, YouTube upload பண்ணுவோம். So நீங்கள் லிங்க் குரூப்பில் ஷேர் பண்ணுறோம். ஸோ மறக்காமல் லைக் பண்ணுங்கள், ஷேர் பண்ணுங்கள், பெல் பட்டனை அழுத்துங்க, சப்ஸ்கிரைப் பண்ணுங்கள். ஸோ தட் இஸ் ஒன். அண்ட் மோஸ்ட் நெக்ஸ்ட், இது ஒரு பெரிய கிராண்ட் சக்ஸஸ் ஆனது காரணம், it is always the entries, participants, enthusiastic participants. So I thank the various principals from all the colleges in and around the Tamil Nadu and their HODs, and also the professors in the colleges, and also the staff nurses and the nursing superintendents in and around Tamil Nadu from the various institutions. They have registered and participated for these seminar programs. So I extend my warm thanks to one and all. And finally, these programs went in a highest success. So I like to appreciate this. There is a first year, that not a first year students, there is the first batch of the students. The first batch of the students done this, they made this went down as grand success. So அவங்களுடைய support இல்லாமல் இந்த ப்ரோக்ராம் இந்த அளவுக்கு வெண்ட் ஆயிடுச்சு. And also this I thank this all other batches for the second year and first years. They have come for the attending and gaining of the knowledges. So at the end, we the team of the SKS and the management, and finally I like to express my gratitude to our enthusiastic faculty members. That is all is who contributed much, worked hard in the round the clock for the past 1 month, made this event in a grand success. Thank you one and all. And finally, we the team is signing out now. So எங்களுடைய அழைப்பதை ஏற்று எங்களுக்கு முழு ஒத்துழைப்பு தந்து இந்த ஸ்டேட் லெவல் செமினார் மாபெரும் மிகப்பெரிய வெற்றி அடைய உறுதுணையாக இருந்த உங்கள் அனைவருக்கும் எங்களது மனமார்ந்த நன்றியினை தெரிவித்துக் கொள்கிறோம். ஸோ நாங்கள் உங்களிடம் விடைபெறுகிறோம். மீண்டும் ஒரு நல்லதொரு தருணத்தில் உங்கள் அனைவரையும் சந்திக்கும் வரை we the team of SKS College of Nursing உங்களிடமிருந்து விடைபெறுகிறோம். இன்றைய இரவு நள்ளிரவாக அமைய எங்களுடைய வாழ்த்துக்கள். Thank you. Thank you for the opportunities. Thank you.
Thank you, sir, for your delightful Thanksgiving. Finally, we came to the end session. My heart always beat in the music known to the world as National Anthem. Now, please let us all stand for the National Anthem. uplifting and productive day it has been. We extend our sincere gratitude to all the speakers and participants for making this seminar a great success. See you again at a future event and have a happy and safe journey.
Thank you everyone. Thank you. மார்னிங்லேருந்து எங்களுக்கு ஃபுல் சப்போர்ட் கொடுத்தீங்க. எஸ் சரி, ஃபுல் சப்போர்ட் கொடுத்தீங்க. எவ்வளோ வந்து ஒரு சின்ன அட்ஜஸ்ட்மெண்ட் அங்கே போய் இருங்க இங்கே வாங்க அப்படின்னு சொன்னாலும் எந்த ஒரு சுழிப்பு இல்லாமல் நீங்கள் இங்கே வந்து எங்களுக்கு வந்து ஃபுல் கோஆப்ரேஷன் பண்ணி ஒவ்வொரு டைமும் வந்து என்ன பண்ணணும்னு சொல்லி கேட்டு நல்லா இது பண்ணிங்க. தேங்க்யூ ஸோ மச். உங்கள் காலேஜில் நாங்கள் வந்து கூடிய விரைவில் மீட் பண்ணுறோம் உங்களை. ஓகே, தேங்க்யூ ஸோ மச். யாருக்காவது டிரான்ஸ்போர்ட் ஹெல்ப் வேணும் அப்படின்னு சொன்னால் எங்கள் டிரான்ஸ்போர்ட் இருக்குது, உங்களை எங்கேயாவது ட்ராப் பண்ணணும் அப்படின்னு சொன்னால் நாங்கள் ட்ராப் பண்ணுறோம். சரியா? either you want to go to junction or bus stop, will transport you. Okay? Yeah, thank you so much.
எல்லாத்துக்கும் that you will get a e-certificate with 48 hours of working. சரி, எல்லாத்துக்கும் உங்கள் மெயிலில் உங்களோட e-certificate கிடைக்கும். We have entered all the updated or your credit hours in the council website. You can check the website. If there is any discrepancy, so உங்களுக்கு ஏதாவது ஹெல்ப் வேணும்னா you send the mail to the CNE. So நாங்கள் cne@sksh.ac.in, we will reply to you. But you can check once you can confirm your credit hours are entered in the online. We have updated all these 150 entries. Thank you.
Any doubts on the 9750456555 numberக்கு you can call anytime and clarify what are the things you needed. Okay, நீங்கள் வந்து இப்போ credit hours எதுவும் குழப்பம் இல்லாமல் ஏறிக்கா அப்படி சொல்லி நீங்கள் பார்த்துட்டு எங்களுக்கு அப்டேட் பண்ணுங்கள். ஓகே, தேங்க்யூ ஸோ மச். தேங்க்யூ. யார் சாங் பண்ணணும்னு சொன்னீங்களே, வாங்க. இந்த இதில் வந்து ஒரு 2 சாங் வந்து மிஸ் ஆயிடுச்சு. அதனால் அந்த டீம் வந்து எங்களை மட்டும் நீங்கள் கூப்பிட்டு பாட வைக்கலையே அப்படி சொல்லி ஃபீல் பண்ணுறாங்க. ஸோ வில் கிவ் த சான்ஸ் பிகாஸ் தே ப்ரிப்பேர்டு.
Hello.
சங்கத்தில் பாடாத கவிதை அங்கத்தில் யாதந்தது, சந்தத்தில் மாறாத நடையொடு என் முன்னே யார் வந்தது.
சந்தத்தில் மாறாத நடையொடு என் முன்னே யார் வந்தது.
மந்திரத்தால் பாயுண்ண குதிரையை மாணிக்க கையால் தொடா.
மந்திரத்தால் பாயுண்ண குதிரை மாணிக்க கையால் தொடா.
கந்தர்வன் பாடுண்ண மதிலக மன்னாரம் பூவிட்ட தனலில்.
கந்தர்வன் பாடுண்ண மதிலக மந்தாரம் பூவிட்ட தணலில்.
ஊஞாலே பாடமோ
ஊஞாலே பாடமோ.
கண்ணுக்குள் என்னென்ன நளினம் காலத்தால் மூவாத உயர் தமிழ் சங்கத்தில் பாடாத கவிதை அங்கத்தில் யார் வந்தது. காவேரியா காணல் நீரா பெண்ணே என்ன உண்மை. முள்வேலியா முல்லை பூவா கொஞ்சம் நில்லு. அம்மாடியோ நீதான் இன்னும் சிறு பிள்ளை, தாங்காதம்மா நெஞ்சம் நீயும் சொன்ன சொல்லை பூந்தேனே நீதானே சொல்லில் வைத்தாய் முல்லை நிலாவேவா செல்லாதேவா.
மன்னவன் பேரை சொல்லி மல்லிகையை சூடிக்கொண்டேன். மன்மதன் பாடலொன்று நெஞ்சுக்குள் பாடிக்கொண்டேன். சொல்லதான் எண்ணியும் இல்லையே பாஷைகள் என்னவோ ஆசைகள் எண்ணத்தின் ஓசைகள் மாலை சூடி மஞ்சம் தேடி மாலை சூடி மஞ்சம் தேடி காதல் தேவன் சந்நிதி காண 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 சின்ன சின்ன வண்ண குயில் கொஞ்சி கொஞ்சி கூதம்மா புரியாத ஆனந்தம் புதுதாக ஆரம்பம் புரியாத ஆனந்தம் புதுதாக ஆரம்பம் பூத்தாடும் தேன் முட்டு நானா நானா.
பந்தம் என்ன சொந்தம் என்ன போனா என்ன வந்தா என்ன உறவுக்கெல்லாம் கவலைப்பட்ட ஜென்மம் நான் இல்லை. பாசம் வைக்க நேசம் வைக்க தோழன் உண்டு வாழ வைக்க அவனை தவிர உறவுக்காரன் யாரும் இங்கில்லை. உள்ள மட்டும் நானே என் உசுர கூட தாரேன். என் நண்பன் கேட்டா வாங்கி கண்ணு சொல்லுவேன். நண்பன் போட்ட சோறு நிதமும் தின்னேன் பாரு. என் நட்பை கூட கற்பை போல எண்ணுவேன். சோகம் விட்டு சொர்க்கம் தொட்டு ராகம் இட்டு தாளம் இட்டு பாட்டு பாடும் வானம் பாடி நான் தான். ஹே காட்டுக்குயிலும் மனசுக்குள்ள பாட்டுக்கென்றும் பஞ்சம் இல்லை பாடத்தான். தவிலை தட்டு துள்ளிக்கிட்டு கவலை விட்டு கச்சை கட்டு ஆடத்தான். ஈரம் விழுந்தாலே நிலத்திலே எல்லாம் துளிர்க்குது. நேசம் பிறந்தாலே உடம்பெல்லாம் ஏனோ சிலிர்க்குது. ஆலம் விழுதாக ஆசைகள் ஊஞ்சல் ஆடுது. அலையும் அலை போலே அழகெல்லாம் கோலம் போடுது. குயிலே குயிலினமே அந்த எசையா கூதம்மா. கிளியே கிளினமே அத கதையாய் பேசுதம்மா. கதையாய் விடுகதையாய் ஆவதில்லையே அன்புதான். தென்றல் வந்து தீண்டும் போது என்ன வண்ணமோ மனசில. திங்கள் வந்து காயும் போது என்ன எண்ணமோ நினப்புல. வந்து வந்து போகுதம்மா எண்ணமெல்லாம் வண்ணமம்மா. எண்ணங்களுக்கு ஏத்தபடி வண்ணமெல்லாம் மாறுமம்மா. உண்மையம்மா உள்ளத நானும் சொன்னேன் பொன்னம்மா சின்ன கண்ணே. தந்தரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரரர